Hi team, I
Hi
hope
team, I hope
you are able to hear me. Hello, Sagat sir or anybody is around. If you can hear me.
हेलो सर।
हाँ कि you can hear me ना?
हाँ जी, हाँ जी।
Fantastic, ठीक है.
delivered. All okay?
All okay जी, all okay. I have already spoken at NHA. That lady will be joining in like another 5 minutes or so. नवीन सर को भी मैंने update कर देता एक बार.
ठीक है.
और राधिका request you to kindly speak to everybody in the session 1 so that they are ready because वो हमारा immediately start हो जाएगा उसके बाद. And gradually session 2 and so on and so forth.
And also Radhika वो mail WhatsApp कर देना. We are live on so and so links.
Radhika, Miss Sandhya and Deepika are also logged in. If you can just allow them to join in because they are from NHA. Welcome, Miss Deepika Rawat and Sandhya ma'am. It's a pleasure to have you with us.
Thank you, Maya.
Yeah. We'll be starting very shortly as per the schedule itself. So we are just waiting for Mr. Naveen Seth to join in as well from PhD.
Okay. Should
Yeah.
we ask ma'am to join now or maybe after some time?
We still have, I mean, if she can join in 5 minutes, I think that should be fine enough.
Okay. We'll let her know. Thank you.
Great. Thank you, ma'am.
Hello,
Morning, sir.
morning भाई मयंक, how are you?
All good, sir. All good.
चलो गुड है, जो करना हो बता देना, हम चालू कर देंगे.
Done. I'll just announce it and then we can take it forward, sir.
ठीक.
Thank you.
Mayank, shall I ask ma'am to join?
Ma'am, yes, I think it's 9:57. If she can join, we can start sharp at 10 then.
Okay.
Thank you. Sagar, sir, I would request you if you can come live as well. So we'll be like starting in another 3 minutes. The countdown is already on.
Sure, I'm live.
Mayank, I have talked to Lata ma'am and she will join around 10:15. She is in the field now. So
Okay.
yeah, she just informed me to let her know.
Sure. Because
Okay.
already there are two speakers aligned before her. So I think by that time only it's going to be
Okay.
fine.
Okay.
Yeah.
Fine.
Yeah.
Thank you.
Thank you. Can I request Mr. Anuj Prakash to kindly keep yourself on mute, please? Two minutes to go. One minute to go. We shall go live now, starting in like count of three. 3, 2, 1. World Digi Health and Wellness Forum. We welcome all of you. Very good morning, ladies and gentlemen. On behalf of the organizing committee, it's my great pleasure to welcome you to the World Digi Health and Wellness Forum, the virtual edition 2024. Before starting this session, we would like to thank our sponsors and partners to the event. Without your support, the event would have not been possible. Special thanks to the platinum partner, Abe Health. As of now, I could see that we have an astounding number of 560 visitors on our platform who are viewing the event live. We would also like to thank our esteemed guests present today with us, Ms. Latha Ganapati, IAS, Director, National Health Authority, Government of India, Mr. Naveen Seth, Deputy Secretary General, PhD, CCI, Mr. Sagar Chatterjee, CEO, Abe Health. The convergence Yeah, I am sorry. I think there was some issue with the internet. I believe now everything is in place. Am I audible?
Yes, yes.
Yes, you
Fantastic.
are.
So sorry for the inconvenience. So we would like to thank our esteemed guest present today with us, Ms. Latha Ganapati, IAS, Director, National Health Authority of India, National Health Authority, Government of India, Mr. Naveen Seth, Deputy Secretary General, PhD CCI, Mr. Saugat Chatterjee, CEO, Abe Health. The convergence of digital technology and healthcare has revolutionized the way we approach wellness, providing innovative solutions and opportunities to enhance the quality of life for individuals worldwide. The virtual edition of the World Digi Health and Wellness Forum serves as a platform for thought leaders, industry experts, healthcare professionals, and stakeholders from across the globe to come together, exchange ideas, and explore the latest advancements in the digital health and wellness. We have curated an exciting agenda featuring keynote presentations, panel discussions, and some of the interesting networking sessions focusing on various aspects of digital health and wellness, including telemedicine, wearable technology, AI in healthcare, mental health, remote patient monitoring, and much more. As we embark on this journey together, I encourage each of you to actively participate, share your insights, and engage in meaningful discussions. Let us seize this opportunity to collaborate, inspire, and drive positive change in the realm of digital health and wellness. I would like to express my deepest gratitude to our distinguished speakers, sponsors, partners, and attendees for their unwavering support and contribution towards making this virtual forum a reality. Without further ado, let's dive into the enriching sessions ahead and let us exchange the knowledge and ideas begin. Thank you once again for joining us at the World DigiHealth Wellness Forum Virtual Edition 2024. Together, let's pave the way for the healthier and more connected future. Wishing all of you a fruitful and memorable experiences. Thank you so much. And now we'll move forward to our partners for the event, PhD CCI, PhD Chamber of Commerce Industry, and kindly allow me to welcome Mr. Naveen Seth, Deputy Secretary General, PhD CCI, to say a few words, please. Thank you so much, sir.
Thank you very much, Mayank. Good morning to all of you. First of all, I'm really sorry that I am traveling in the car. I have to go for a meeting. So there might be some disturbance. So esteemed participants, distinguished guests, and respected colleagues. So I'm really happy to be part of this event today, which has just started. And I think our partnership with the GECI is going to go a long way. And I, on behalf of PhD Chamber of Commerce and Industry, welcome you all for this. So I think in today's dynamic business environment, the integration of technology into healthcare and wellness solution is not just a trend, but a necessity. The World Digi Health and Wellness Forum provides a unique platform for us to collectively explore the vast opportunities that digital advances offer in transforming the landscape of healthcare delivery and wellness management. Our partnership is a testament to our belief in the power of collaboration to drive positive change. The PhD Chamber is dedicated to promoting economic growth, sustainable development, and technological innovation. By aligning ourselves with the initiatives like the World Digi Health and Wellness Forum, we aim to contribute to the disclosure surrounding the pivotal role of digital technologies in shaping the future of healthcare and wellness. I would like to express our sincere appreciation to the organizations, fellow partners, and participants for their dedication to making this virtual edition a reality. Together as partners, we look forward to playing a meaningful role in advancing the dialogue and facilitating the exchange of ideas that will shape the future of digital health and wellness. As we embark on this journey, I encourage each one of you to actively participate, share your experience, and build connections that will extend beyond this virtual forum. Let us collectively harness the potential of digital innovation to create a healthier and more connected world for all. Thank you for your attention, and I wish everyone a successful and enlightening experience at the World Digi Health and Wellness Forum Virtual Edition 2024. Thank you very much.
Thank you so much, sir, for the kind words, and thank you so much for joining us even when you're traveling. So it's an honor to have you with us, sir. Thank you so much. So up next we have our platinum sponsors. As we always say, Abe Health presents the World Digi Health Wellness Forum. Please allow me to invite Mr. Saugat Chatterjee, CEO Abe Health, to take the discussion forward. Sir, over to you.
Thank you, Mayank. Thank you so much. And a very good morning and a warm welcome to all the participants, and the attendees of this event. On behalf of Abhay Health, I welcome all of you all to this edition of WDWF 2024, which is World Digi Health and Wellness Forum. This platform is not only a platform of interaction and knowledge sharing, but the intent of this platform has been made in order to create a long-term sustainability in terms of collaboration, growth in the space of healthcare. And when we talk of healthcare and the digital version of healthcare, we often understand that, digi health is all about innovation. It's all about AI-driven exercises. It's all about data interpretation and how to kind of measure the various body vitals. But then the endeavor which this platform is going to provide, and at the same point of time, the endeavor which also falls in the same alignment of our health, is the endeavor in which we are trying to ensure that the digital version of the health leads more from a preventive to informative to curative. And that's a transition which we are going to make in this journey. And our health is proud enough to participate, collaborate, and be a part of this extensive journey with all of you all together, where we can do a much more meaningful integration of business in terms of impacting the consumer life, the patient's life, and also the life of those who are attending to the patients in a much more simplified, constructive, and yet meaningful way, wherein digital innovation can impact and help all of them in the journey together. At the same point of time, I would also like to take this privilege to update all of you all that Abhay Health as a company, we have brought into this industry a range of very innovative product range, which includes products from the range of rapid testing kits, which includes pregnancy, ovulation, dengue, malaria, HIV, and the list goes on. And with the same point of time, we are also bringing in a range of OTC home use and personal hygiene product category, which includes antiseptic liquid, fast band-aids, cotton balls, cotton buds, sanitizers, uh, fruit cleaner, home cleaner. So a range which will ensure that, in our lives and the times to come, how through our brands Assure and our brand Act Fast, we impact this lives of all the people, wherein, as we always say, prevention is better than cure. So therefore, there is no other better alternative than to have a preventive health opportunity into the entire healthcare synopsis. And as we keep saying that, it's a punch word which we often use in our communication, that in our health, we say that be assured and be healthy. So with that note, I wish all of you all good health and happiness. And once again, as a part of this forum, as an organizing committee, and also as a part of the sponsor for this forum, Abhay Health wishes everybody, all panels and speakers, a wonderful session and a day together. And I'm sure we will continue this association in the long times to come. Thank you so much.
Thank you so much, Mr. Sagar Chatterjee, for the enlightening words, and it's really setting the mood for the event. So we'll in fact request you to kindly stay with us till the end, because there are a lot of insights which is going to come from Abhay Health about the new advancements which are happening in terms of the medical technologies to go with. So thank you so much, sir. So I would request the team to kindly allow Miss Lalita Madam to kindly join in. She's already there in the waiting room. So up next, we have our guest of honor for the day, Ms. Latha Ganapati, IAS, Director, NHA. I would request the team to kindly allow her from the waiting room, please. We have her colleagues along with us, Ms. Deepika Rawat and Ms. Sandhya, who have joined us. Very good morning, Ms. Latha Ganapati ma'am. I request you to kindly take the discussion forward, please.
Am I audible? Am I audible?
Yes, ma'am. Yes, ma'am. You're audible.
I'm traveling. I'm in a field inspection with respect to some urgent work from Prime Minister's office. That is
Okay.
so. If my signal is poor, I'll switch off my camera and talk.
Okay, no problem, ma'am. Thank you so much for joining at such a short notice as well. And thank you so much for making yourself convenient to be with us today.
Yeah.
Thank
Should
you.
I wait for my turn or
Yes,
some? Yeah.
ma'am. Yeah, it's your turn to go ahead. We are already live. Thank you.
Okay. Okay.
Over to you, ma'am.
Yeah. Good morning to all of you. Uh, I want to extend my heartful thanks to the forum which has given me this opportunity to put forth my ideas and the stand of NHA and what NHA is doing towards digital health now. Okay. Actually, National Health Authority, we are the part of Ministry of Health. We have two mandates to do before us. One is that Pradhan Mantri Jan Arogya Yojana, and Digital Health Mission is another project we are carrying on. You know very well that the government is decisive to give the quality healthcare to the people of India, and that too with a vision of universal health coverage and with the platform of digital ecosystem. This is a overall picture what NHA is doing. Pradhan Mantri Jan Arogya Yojana is a public insurance scheme. It's a world's biggest health insurance scheme, public insurance scheme covering nearly 60 crores people. And it is a centrally sponsored scheme with a 60% financial contribution from Government of India and 40% from state government. You know very well that any person who is in the lower bottom of the economic structure is always under the threat of health issues. Whenever his family is pushed into the health issues, he is further pushed into the poverty line. The out-of-pocket expenditure for the health issues is the biggest threat in any normal Indian citizen's life. To address this issue only, Pradhan Mantri Jan Arogya Yojana has been launched. Now today it is covering nearly 60 crore people. As on date, we had 6 crore admissions worth of 77,000 crores, which is equal to 10 billion USD. And this entire insurance coverage happens in a digital platform wherein the claims are adjudicated on a robust digital platform, wherein all the 39 states except 3 states have all joined in this health insurance scheme. They've converged their own insurance scheme with us. And today we have treated almost 6 crore patients, 6 crore admissions so far. And as I already mentioned, 77,000 crores worth of money has been spent on this. How do we do? Any patient who is in the SEC database, that is socially economic vulnerable group, people are identified and added in this group. They've been issued with the Pradhan Mantri Jan Arogya Yojana health card, which also happen on the digital platform only. People are identified in the field through the app. Their verification happens based on the Aadhaar ID, either on the fingerprint or on the OTP mode. They have been verified and they are added in the database and the card is issued to them. The card holder can any hospital get admitted and get the treatment. 28,000 and odd hospitals are empaneled. Even the empanelment happens on the digital platform. So robust platform we have, through which we have nearly some 2,000 and odd packages we have, which is in the back end of the software, and every one is treated according to their ailment, and the claims exchange happens on the digital platform. So this is how the Pradhan Mantri Jan Arogya Yojana happens. For quality care, we have NAFU triggers, which are AI-based triggers, which identifies the fraudulent issues also. And this is a dynamic process wherein we day to day we develop new triggers and find out any kind of fraudulent, and we prevent the misuse of the claim submission by the hospitals. This is one part of the Pradhan Mantri Jan Arogya Yojana, which is now the scheme of the Government of India, which is protecting the rural mass from getting into poverty because of the health issues. So we have been implementing this successfully, and we have been improvising this on day-to-day basis. However, the future of India depends on the digital world. And the health sector, of course, the big sector has to be on the digital platform only, based on which already in 2018, Honorable Prime Minister has launched the digital mission, which we are now promoting from 2018 onwards, which has got 4 building blocks, namely ABA. Every citizen of India will have a unique health identifier number, which is called ABA, which is created through an app or in the website in a digital platform, followed by HPR, HFR, and HMIS. HPR is the facility, the registry for the health professionals. HFR is the registry for the health facilities, which has to be registered under this platform. They are all connected by HMIS system, wherein all the transfers will happen through in the digital platform. When any facility joins in this ecosystem, the cross talking between the facilities, between the individuals is quite possible. So Ayushman Bharat Digital Health Mission is now adopted by all the 36 states, and we have been in the process of adoption of public hospitals as well as private hospitals. The public hospitals have been encouraged to register their HPR and HFR, and they've been encouraged to adopt HMAS, which is ABDM enabled, so that they will be part of the digital ecosystem. Same way, private hospitals also encouraged to have the HMAS, ABDM enabled HMAS, and they've been encouraged to register their HPR details. And we have been giving certain incentives like a digital health incentive scheme, where every hospital, whenever they share a registry record, they'll be paid to ₹20. And the public hospitals are earning crores of rupees through this incentive scheme, which is encouraged for the adoption of the ABDM. Once this for the entire health system to become digital ecosystem, we are almost in the bottom edge of the implementation. That is, now the awareness is spreading throughout India. Because of this, now the public hospitals are becoming HMAS enabled, and private hospitals are becoming aware of the scheme, and we are encouraging this through the microsite adoption also, wherein 500 to 1,000 health facilities are there. They are declared as microsites, and there will be a handholder who will be going and marketing about the digital health mission, and they'll be encouraging the adoption of the scheme. This is how the digital health mission is functioning, and it's a long way to go for us. Once the adoption is completed in India, we'll be completely on the digital platform. The important factors, the ABDM, which conceptualize, ABDM has conceptualized 3 important factors, that is unified health interface for services, Health Information Exchange Consent Manager for data, and National Health Claims Exchange for claims. These are the main three conceptualizations we have done on this technological stage. So we'll be looking forward for a digital transformation of Indian health system in near future, which will happen in another few years. With this, I'm closing my remarks. I'm on my way to another district to see some health facilities. Thank you very much for your patient listening, though I'm not good in delivery. I'm very poor in communication. Anyway, whatever I wanted to communicate, I hope I have communicated to all of you.
Yes, ma'am. Thank you so much, ma'am. I think it was wonderful to have you with us. Your insights were really important because there are many schemes from the government which are unknown or which are yet to be basically floated in the market as well. So at least with your initiative, people will get to know more about the new initiative which the government is taking to make the health system better. And apart
Actually,
from that, I would also like to mention that we have approximately 680 people who are viewing us live right now. Any questions regarding the discussions which ma'am has put forward? Request you to kindly put your notes and put your remarks on the question form which is there on the platform itself, so that we can bring it forth to ma'am and see what possible arrangements can be done in terms of answering your questions too. And ma'am, thank you so much. I think the world have really seen the worst of the health issues during the COVID times. And India definitely was one of the countries which came up fighting very hard with the digital health schemes which was there. And I think we were one of the best controlled countries in terms of the COVID-19. And salute to the whole National Health Authority of India and all the doctors and all the people who were involved in fighting that the fighting that situation at that point of time. So thank you so much, ma'am, for your time, and we really look forward to connecting with you in future as well.
thank you so much. Thank you.
Thank you. So before we come to the next panel, I would like to thank all of our members of the inaugural session, starting with Mr. Naveen Seth, Deputy Secretary General, PhD, CCI, Mr. Saugat Chatterjee, CEO, Abe Health, and Ms. Lata Ganpati, IAS, Director at NHI. Without your support, we couldn't have actually moved forward. Thank you so much, sir, for joining us, and really hope that we could connect in future as well and make more opportunities available when it comes to the World Digital Health Wellness Forum.
Yeah, sure, sir. Thank you, Mayank. Thank you very much.
Thank you, sir. Thank you. Take care. So up next, we have the first panel discussion, which is digital health ecosystem, interoperability, integration, and seamless patient experience. In this particular panel discussion, we're going to explore the challenges and opportunities in creating the interconnected digital health ecosystem that promotes data sharing, interoperability among various health technologies, and ensures seamless experience for patient across different platforms. In this session, we have Mr. Nitin Gupta, Managing Director, India and South Asia, Fuji Films Sonside India Private Limited. He is the moderator for this session, so welcome. We have Dr. Arjun Dang, CEO, Dr. Dang Labs. Welcome, sir. We have Dr. Ashish Chaudhary, Managing Director, Akash Healthcare. Dr. Harsha Guduru, Founder, Restori Healthy Tech Private Limited. We have Ms. Deepika Thakur Gandhi, India Business Development Head, Cleveland Clinic. Mr. Anurag Saxena, Chief Business Officer, Reverie Language Technologies. Welcome all of you, sir. And I would hand it over to Mr. Nitin Gupta to take the discussion forward. Thank you so much, sir. So if you can unmute, you are unaudible, sir.
Now is it okay, Mayank?
Yes, perfect, sir.
Yeah, thanks. So Mayank, I was hearing to the past session, and I think we all as an ecosystem is moving towards digital India. And so once again, good morning and thanks for joining in. So like this digital health initiative, digital health ecosystem, which we are talking about, I think is the need of the hour. And like, as a country, we aspire to become developed country by 2047. And we all know, developed country depends a lot on the citizen, how citizen health is there, and health is something which is the top priority of any economy, and GDP is directly related to health of the citizen. So I think this is very interesting subject, and particularly I am very digital savvy, and the fintech has changed the landscape of finance industry, the way this technology, the app culture, and the faster mobilization is there. I think same is required in health. We have made a good progress, but yes, I think a lot to do, and good to see different stakeholder, and in this panel, I think very diverse panel, where I think we have from hospital side also, healthcare provider side also, and back from a trade side, those who develop equipment, software, solution side of healthcare also. I think very diverse panel, and I think we would like to discuss around interconnected healthcare ecosystem in depth. And I think why the first question arises, why probably health, digital health and data is so important, because as a patient, we visit hospitals, and then we tend to take consultation from some other sources. So currently, I think a lot of progress is to be done. There is a good start from government in terms of launching a platform like Abha, which I think will be creating some kind of digital health ID, and subsequently the data can be stored over there and can be accessed with the consent of the patient. So it's a very wide topic, and I welcome all the panelists and all those who have taken time to hear. And I think my sincere thanks to World Digital Health and Wellness Forum for having me here. Quite enlightening, and I think we have very diverse and good panels. So maybe I think introduction is already done by Mayank, so we can probably jump into the directly the questions. So my first question would be from Miss Deepika. I think probably if you can answer on what are some of the opportunities and challenges in patient health data interoperability, and how it can be integrated in a better unified way, delivering seamless patient experience. I think we all know the importance of data. Now, I think data is something which is there in our watch, in our mobile, in our devices, in hospital, in diagnostic center. There is a lot of data related to patient finance. So over to Ms. Deepika, maybe if she can throw some light on this, and then other panelists can, I think, add on to that. Yeah.
Yeah. Thank you so much, Nitin, for the introduction. I think with regards to data interoperability, I see there are more opportunities than challenges, and I'll explain, why.
Certainly.
I think in a country like India, there is a lot of variability in care. And when you try to merge different data sets, whether it's your EHR data set, your supply chain, your pharmacy data, you combine that with your insurance or claims data, we get a very powerful data set. And we are able to analyze, where there is variability of care. I want to use specific examples so the audience and the viewers can relate to it. Back in the US, what we were able to do was we were challenged with a question, okay, how do we reduce the cost per case for a cath lab procedure, right? And this is for a hospital client. And to be able to do that, we were able to combine the data from the electronic health record. We were able to combine data from the cath lab, the procedural data, then from the pharmacy, from supply chain. And what we understood was there was quite a bit of variability in the cost per case when we added all those, data sets. And what we were able to show to the physicians is that without changing the risk factors, without impacting the outcomes, the reason some of the cases were high in cost was because of use of specific medication or contrast dye. Some contrast dyes are more expensive than the others, right? So the physicians were convinced we were able to standardize the case for cath lab procedures, and that's just one example of how we were able to use interoperability of data to impact the value-based equation for patients, which is high quality care, low quality cost. In terms of patient experience directly, right? I mean, I think there are plenty of opportunities: admission, discharge, transfer process. We are all familiar. And I think there is significant opportunity to improve that. One of the ways we are trying to improve that, at least at the Cleveland Clinic, is to see if there is any way to capture the intake form, right? Your history, your past medical history from home. That way, we reduce the waiting times of patients when they come into the hospital. Can think of several other examples. One inside hospital being pain management, right? Where patients can press a button and they can indicate their level of pain, and then there is pain controlled machine that delivers the bolus in a very safe and effective way. So overall, I think we have a great opportunity here, to impact both the patient experience as well as operations efficiencies. And I think India has done a tremendous job. We don't have any dearth of infrastructure. I know some of my colleagues here have experience with the Ayushman Digital Bharat mission. I think we are in a very good place to utilize all the infrastructure. I was just looking at the adoption of SNOMED and the usage of electronic health records, and government has all the resources in place. I think the challenges will be with one adoption, especially in the smaller, rural and tier 1, tier 2 towns, or where clinics are not able to afford those electronic health record systems. So adoption is one, and then clinical documentation. I think it's garbage in, garbage out. Otherwise, you have all these fantastic AI tools, some tremendous analytics available, but I don't know how we'll overcome the challenge of physician time in India, because if they don't document in a standardized, structured format, then we're not going to have that structured data to analyze. So I think that's one opportunity or one challenge. But at least in the US, we've been able to use a lot of mid-level providers, physician assistants, nurse practitioners to do a lot of that documentation, so the physicians can actually spend time, with the patients. So those are just my perspectives.
No, thanks, Devika. Quite insightful, and I think you touch the grassroots, what's the challenges, what's the opportunity, and maybe I'll request Mr. Anurag if he can add on to this subject, as he's, I think, very close to his expertise.
Thank you, Mr. Gupta. Thank you for the opportunity. So I think one good thing that we have done is we have implemented the basic things for ABDM, right? For example, we have interoperability of data now. We have interoperability of services also, and we are moving towards interoperability of insurance, right? So idea is that as a patient, if somebody goes from one hospital to another, they should not be required to carry physical files. And that objective has been achieved through ABDM, right? Now, I think what we need to do is we need to move towards adoption in an accelerated manner, so that all hospitals get onboarded and all HMIS systems get integrated, so that wherever we go, we see a digital payments kind of experience. Because today I can go from one pawn shop to another, and I can use Paytm, I can use PhonePe, any other provider, and there is interoperability. Similarly, if if my health records can be accessed through all channels and can be accessible to all doctors and registered users, that is the ultimate objective, right? So we have to move towards adoption. We have seen some challenges in the past. For example, the funding is limited right now. So if you go to a small clinic, they may not want to spend too much on HMIS systems, right? But they still want to get onboarded on the digital journey. So we have to make sure that these systems get affordable, and there is some funding available, some subsidy available from the government. I think there are a lot of initiatives that are going on. There are some free systems also available, but we have to see how does a small clinic or a PHC, CHC in a tier 2, tier 3 area gets access to that ecosystem, and they start participating in the digital ecosystem, right? So that is, I think, the most important thing right now, and there is a lot of focus from NHA as well, and we are happy to see the progress.
Yeah, thanks, Mr. Anurag. I think quite valid point. How do you see, government and private, these are two engines of growth of any economy, country. Here, how do you see their roles? Maybe, can you throw some light? What you think should be done by the private sector, and what you think the support government should provide?
See, government can only be an enabler, right? They can't be funding private setups. But I think a lot of these initiatives will be driven through market forces, right? So if a clinic feels that by being ABDM enabled, they can get more business, they can get more patients, or even if it's a single doctor setup, he can get access to virtual teleconsultation patients, they will definitely participate, right? So I think a lot of it will be market driven, and we see a lot of players offering affordable solutions, which are subscription based cloud solutions, which actually make it affordable. So I think everybody is in it together, and government being an enabler has played their role. But I think we just need more players to come in and adopt.
Yeah, sure. Thanks, Mr. Anuga. We have Dr. Ashish also, who is kind of like service provider, entire healthcare, like handling patient, handling inside, and handling, of course, the intermediate data management. So, any insight from Dr. Ashish? I think you must be like managing all three aspects.
So from the hospital perspective, I think I belong to an era which has seen all paper-based patient care management in my early days. And from that time to today, where we are totally unexposed to the EMR or EHR health record, or for that matter, any HIS usage in our system. For last 6 years, if I see my data, I don't remember when was the last time when I wrote a prescription. So having said that, that kind of adoption, has become, a commonplace now. In our facility, 95% of the doctors are using EMR, especially for diagnostics and their order entries. Yes, what ma'am said, garbage in, garbage out. They are not able to, do the history examination and the critical, part on the EMR objectively, so that that data is not worth analyzing. But I think slowly and steadily we're going there. The physician time management, yes, that's one important thing. But in last 4 years, every clinician has every clinician realized the importance of being on the system, because now they are able to change the treatment while on the go. They are able to see the critical results even when they are not in the hospital, and they are able to institute the necessary treatment. So that has given a lot of value to the clinician. If at the end of the day any digital intervention is going to improve the patient outcome, the clinician will definitely be on board. Yes, when it comes to an organization, maybe expenditure or the capex expenditure on IT and digital efforts, maybe fifth or sixth, on their priority list. But slowly and steadily, it is growing up, because we are seeing some value in it. We are seeing some, lot of government initiatives getting on board. As simple as, you look at the NABH 5th edition and how the audit is happening now. Every small little thing is going online. If you look at the DNB curriculum program, if they have to conduct an exam sitting right from their head office, they are conducting the final exams through online platforms. So things are changing, and like what Mr. Anurag said, market forces is driving, but also the value which it creates, or sometimes it becomes a compulsion for the hospital to comply to the digital norms and many platforms. So overall, it's going in the right direction. I hope that with the kind of patient load we have in every hospital, whether it is government or a good private hospital, I think digital transformation is only going to improve the patient's experience. It's going to reduce the waiting lines. It's going to reduce the wasteful activities in the hospital, and of course, the clinicians, will gain best out of it. As an organization, one has to be very, focused on slowly and steady implementation of a particular, which is of most value for their set of patients. It could be different for single specialty. It could be different for a quaternary level hospital like Medanta. So one has to best requirement for their own setup in according to a judicious.
I would request the Alma team to kindly mute, please. I would request Alma team to kindly mute, please. Sorry, sir. You can go ahead.
Anurag, please mute.
Please go ahead.
This could be one of the side effects of
digital world.
That's about it.
No, thanks, Dr. Ashish. I think quite valuable input, because you handle both sides, like probably the provider side and the patient side, because you are directly frontline, patient experience. So my next question is from Dr. Harsha. I think we talk about a lot of devices, digital healthcare devices, and how can we devise more ease of use in digital health devices, and so that patient experience is improved. Ultimately, we all are striving towards better patient care. So fintech has changed again, I would say. So any insight from health tech to adopt fintech kind of speed? Yeah. I think you're mute, Dr. Harsha, you are on mute.
Yeah. Thank you, Nitin. I think one of the points I wanted to talk about this space, particularly when it comes to the patient experience, especially when it comes to managing devices and data, comes from personal experience at Restory, because we handle a lot of geriatric patients. And we have seen this gamut that over the last maybe 10 years, what used to be earlier, people would just carry a passbook, which they would go to their own primary physician or probably their neighborhood hospital, and that would carry their entire history and de facto become a very simple record for people to see कि क्या हुआ 10 साल पहले, क्या हुआ 20 साल पहले. But that has changed now. In the last maybe 3 decades, we are generating, and like Deepika has mentioned, it's garbage in, garbage out, because at an average, we have a healthy person generates 8 to 10 pages, and a not so healthy person generates maybe 30 to 40 pages of data per year. And all of this comes from multiple sources. So we have sources both in the urban and rural segment. Urban segment, like most of my colleagues on this forum, they're all tech enabled, they're all digital enabled. So you can always access the reports. You can always go back to the source and get the reports. But the challenge that happens now is there is definitely a loss. There is what we call as signal incoherence is there. People go to meet with a doctor, and suddenly you realize that there is data missing from a particular segment. And the bigger problem is not with carrying the data around, but the bigger problem is end of it impacts the clinical decision making process. Or from a cost perspective, we are a very cost sensitive nation, barring the top maybe 10 to 12% of people. Even going for regular lab tests on a continued and consistent basis as an out of pocket becomes a pain point. And this fragmentation has been a challenge. And I think two people, that is yourself and Dr. Ashish, have mentioned a very valid point, and that is something I think the entire healthcare industry should look at insights from, which comes from fintech. 10 years ago, the process of knowing your bank balance, the process of knowing if you've spent 10 rupees would have been go to the bank, stand there, get the passbook stamped, and come out. And then ATMs came in, and then you would just walk to the nearby ATM. And now, with this whole new two-factor authentication, just being able to get an OTP and then download any app and get your data, you can be bank A, bank B, bank C, you can be a small rural bank, you can be the largest bank in India account holder, and still you get both your data on one point, as long as because everything pivots around two numbers. It pivots around your mobile number for authentication, and it pivots around your PAN number or other number for enrolling yourself, for registering yourself. And we have all this technology which is already there, and fintech over the last 7 years has democratized technology to a point where even a person who let me give a very simple example. Even a pani puri wala or the guy of the CEO of a Fortune 500 company uses the same tool at the same cost. And for a country like India, I think that becomes a very, very critical part, that how can you democratize technology to a point where the cost becomes non-prohibitive. That said, I'll get into the core topic, which is about devices and patient experience. So when we look at devices today, there are three grades of devices that we see. One is your clinical grade, your hospital monitors, you have your hospital connected systems, your imaging, etc. Then you have your consumer grade, which is probably skyrocketing at 200 to 300% year on year, which is your wearable watches, your Holter trackers, wireless Holter trackers, chest patches. People are watching sleep bands. And suddenly we realized we have gone from having 10 to 20 data points coming in every month, where you typically would go to a clinic to get your blood sugar or blood pressure tested, to now devices collecting. An Apple Watch collects maybe 3,000 to 4,000 bits of data every day. And all of this is just lying around, being extremely individually accessible, but not really going to the doctor when the doctor needs to see it. And that leads to poor quality consultation, poor decision making process, and ultimately that leads to poor patient experience. So we've had a recent example where somebody I know, a doctor, a big issue happened at the clinic just because they say that, oh, the doctor didn't ask me whether I had an MRI done earlier and prescribed an MRI. Now the problem is there is no record of that MRI for the doctor. And we don't have the time or bandwidth to ask everybody, oh, have you gone to somebody else? Have they given a prescription? Unless the patient is forthcoming about this data. And the challenges that we see when it comes to this particular aspect is that one is the cost. So in a country like the US, healthcare technology, particularly in the space of giving accessibility to information. You have these large organizations, you have Cerner and Epic, and the cost per patient is absolutely unviable in a country like India. And as Lataji had spoken earlier, I think the whole ABA concept is something the private medical field, the health tech providers should wholeheartedly embrace. But that leads to a second issue, which is to be onboarded, with a platform like Epic or Cerner, all your data flows in a certain way. It is all coded under ICD-9. It is all coded under ICD-10. So I know that ABC lab giving a blood report for my hemoglobin and an XYZ lab giving me a blood report for my hemoglobin will all flow in the same data structure, which we currently don't have. Even two labs today, let's say I prescribe a CBP to a patient. They come back and say, this lab doesn't have CBP. They have something called a hemogram. And now medically, we know that. I think Dr. Arjun would know this quite well coming from the diagnostic space. Both of them are the same, but just because of the lingo change, the data doesn't flow very safely. And the long-term solution obviously has to be, unified coding. We need to get to a level where all data is accumulated at one place and we bring the cost down of data. But from where we are to get there, we are talking about maybe about a $25 to $30 billion expenditure, which the private industry will never be able to keep up, because I can go charge. I would have patients who would pay 1,000 rupees for a consultation, but if you add on a 100 rupee cloud charge to that consultation, they would just walk out saying, because the mindset has still not come there, that education and awareness is missing. But I think in the shorter term, I think we should use platforms like ABBA. We should take lessons from, the experienced people in the fintech industry on how can we use WhatsApp, because now WhatsApp has become a very personalized democratic tool to receive data. How do you trigger an OTP? How do you trigger information sharing to using your mobile number as a base? Will this apply to 100% of people? Maybe not. But I think as it stands now, people who use private healthcare and maybe about 80% of people who use public healthcare do have access to all this data. They are registered through various banks. They are registered through unique identifying markers. And over a period of time, like how they have done in China, we should start pivoting around one universal ID. Let the data come in any way possible. But once the data starts coming in and people realize the value of having all this data at one place, patients start feeling better because they see that their experience when they go to various providers gets better. And as the next step, we can start looking at charging patients, because again, nothing comes for free. Charging patients to be able to hold their data, consolidate their data, rather than what the new health tech companies are doing today, which is create a solution which is unique, which is customized, be able to go to market and tell people that, oh, my EMR is the most advanced, it has AI built in, it has logic built in, and then struggle to find 10,000 people or 5,000 doctors who will use the EMR. And I have seen adoption rates plummet down the line, because end of it, what doctors want is, I want to see the data. I'm not going to sit and train my receptionist to start typing in. And organizations like Akash and some of the larger corporates have really taken this up on a war footing basis by digitizing their entire patient journey. But then end of it, they cater to maybe 2% or 3% of the population. The remaining 97% of the population is suffering from poorer clinical outcomes, poorer patient experience, because they are unable to get their data given in the right way. And I think unless we are able to bring in the clinical and consumer grade enterprise devices all into one platform, let the patient authenticate it every time they go to the doctor, so that this willy-nilly sharing that happens today is not there. I think that is a question for the next topic, which is about data security. This will also solve the data security challenges that we have. Thank you.
No, thanks, Dr. Harsha, and I think quite valuable. And as we say, when we opt a delivery in Amazon, we always hate 40 rupees charges. So that's how the mindset is built. And as you said, if you bill something for digital, they take it. It should be there. But I think slowly progress is happening. So my next question would be with Dr. Arjun. I think we talk a lot about technology, data transfer, technical issues, but I think we are human, and humans are probably more of habits. How do you see behavior from clinician side to have a better integration of data? What behavioral changes you, Dr. Arjun, expect from more of clinical side to better accommodate the data, apart from the technical challenges which Dr. Harsha shared. I think more of behavior, first behavior is corrected, and technology is always there to support that behavioral changes. So over to Dr. Arjun.
Thank you. Thank you, Nitinji, for that very relevant question. Before I start, I would like to thank WDWF for having me on this esteemed panel with such stalwarts in the healthcare domain. It's really fun because I've been listening in for the past 15, 20 minutes and very, very interesting. Because the way that I see it is that digitization has a different definition when you look at the different stakeholders in the ecosystem, whereas a lab is a completely different point of view, and completely echoing Dr. Harsha's words that I think half our customer care is always baffled by CBP or CBC or PS or a hemogram, and there are five other terminologies that we can come up with. But I think that uniformity that is there, not only starting from the prescription but to the ultimate report, is I think the beacon of hope that we see in the years to come. Now, the ABBA ID is something that is fantastic. Very, very proud to also tell you that we are one of the first labs that's completed the M1 milestone. But I think in this entire process, what goes unnoticed is that from a perspective of a histopathologist. So I'm a histopathologist, and for the ones who are not aware, basically we look at biopsies and then try and figure out what the diagnosis is. And we encounter this on a daily basis. The quality of my report, and I can scream this from the top of every mountaintop, is that the quality of my report is directly proportional to the patient history, the clinical details, the medication that the person is on, the family history. And without that, the quality of my report can go from a 2 to 10 till a 10 on 10. So that is how important it is. And like your question, Nitinji, you asked that how can the behavior change? I think basically in big bold capital letters, it is collaboration versus competition. And the short-term goal is obviously competition, but the long-term goal is collaboration and to give the patient the better outcome. Now, also from a cost perspective, I might have to run three more tests to give the same diagnosis, whereas that same patient would have done some similar test or some immunohistochemistry markers or some other genomic test earlier that can empower me to mention that in my report and then give a conclusive diagnosis. So I think patient care and patient outcome is something that is certainly on top of the charts, but also looking at it from a research perspective. And also my team does a lot of that. Just a small example of how we do these surveillance studies, and it actually guides the government and state governments and the central government to actually focus on that particular disease. For example, now you have a vaccine regimen for children, but until we actually find out that what is the antibodies that are present in that particular community, and then convey the incidence versus the protection that that part of the population have. I mean, the government will just be guessing about which vaccine to introduce, which disease area to focus on, where the budget should be putting their finances in. So I think it's a very, very large domain where we are working in, and definitely the behavior part where awareness, education. I think after collaboration, competition, the second would be awareness and education about understanding about standardization, understanding about interoperability, and also very important from the lab's perspective is to empower and incentivize. I'm sorry to say, but incentivization is extremely important for the LIS vendor, that is the lab information software vendor, for them to get a push. And even the ABDM this time, my compliments to them, the way that they're doing it on a war footing, where there is an incentive, very small incentivization, but significant one for the LIS vendor and for the labs as well. I think that is phenomenal, because that is obviously pushing them and their teams to achieve this faster. Also, in a country where we have last mile delivery as a formidable challenge, I feel the uniformity and the interoperability between the different LIS vendors, I think, is critical, because lab as such is a service provider where I would say 9 out of 10 or maybe 99 out of 100 labs do enroll a particular LIS vendor. Similarly for hospitals, unless you have your own inbuilt one, And if these vendors collaborate and are incentivized by ABDM, which they already are, I think the information and the data, the way it will start flowing is going to be very interesting. Also from a lab perspective and on ground, I was just discussing with my team the earlier day. We've recently integrated our customer care software and our LIS software and our CRM. Now, what this actually does is that we did like a small study in which we were able to reduce the number of double pricks that we do in a month to actually 30 to 40% lesser. Now, someone will ask, how is that possible by integrating your different systems? And it's really simple because we basically integrate the feedback from the patient and the phlebotomist to our CRM before assigning another technician for the same patient. So in this world, I feel from small to big, this interoperability and integration of different systems supported by the government initiatives and the behavioral change in physicians, clinicians, and the healthcare stakeholders is, I think, going to be critical and very interesting to see in the years to come.
Sure, Dr. Arjun, I think very insightful. And I really like, I think, as you said, the competition versus collaboration. I think both has to be there and both have their roles to play. Like when we cook dishes, there are different ingredients. So these two are good ingredients. So in relation to that, Dr. Arjun, maybe taking the discussion forward. So like, no, when we talk about patient empowerment, they have the data required, but then a risk comes like no self-interpretation. Like, no, how do we like no make patient aware that, okay, you are in charge of your data, but like, no, we are the clinician and like no our diagnosis and our treatment will be like no the thing better interpretation of data. So how do you see the risk when transparency increases, this risk also increases? So any thoughts on?
So Nitin, on a lighter note, yesterday I received a call from an elderly lady, and the customer care manager told me that she's screaming, sir, and someone from the doctor's team needs to speak. It's better if you speak. So I'm always excited to speak to patients and assist them. So I was like, okay, transfer them to me. Elderly lady speaking in Punjabi, can't repeat her words, but she said that to see urine culture sterile ditta hai. I was like, yes, man, it's a sterile culture. You have no growth in your urine, and that means you don't have any infection unless you were on antibiotics. And she said, how can you say I'm sterile? I have two grandchildren. So she has Googled what sterile means, and she's gotten to the point
Okay.
what sterile means, and then she's interpreting that. So obviously, ChatGPT, Google, I think this is actually either can be an assistant or it can be the big bad wolf. And obviously, interpreting your results correctly with the physician's help is critical. Now, what has actually happened in the past few years, and even we were the one of the first few adopters, is that you have these smart reports that actually help patients interpret the report in a very simplified version. Instead of using scientific jargon and instead of using very high-fly wording that they can't understand, it's actually broken down to understand what this means, what they can do on a daily basis from a perspective of lifestyle and follow up, and then take it forward. So I feel educating patients is very important. Also empowering lab providers with such tools that helps us break down the reports in very easy to understand paragraphs or wordings is critical. And also along with this, apart from this, the patients to understand that the final gold standard for any diagnosis is not a good lab, it is not your investigation, it is the doctor who's actually examining you and then looking at the report. I think that needs to be hammered in and that needs to be understood before people start looking at reports and understanding and interpreting it themselves. And so just a very small example of another very common female hormone test that we do, and maximum queries come for that. It's called a prolactin test. Now, what happens in a prolactin test is that it's maximum as soon as you wake up. So a lot of teenager girls get this done for their PCOS, other hormonal profiles, and the instruction for that is that you have to wait for 3 to 4 hours until you wake up and then do the test. Otherwise, you might get a falsely elevated prolactin level. Unfortunately, with an elevated prolactin level, if you type these three words on Google, you get a brain tumor as the headline. So we get and it is true, an elevated prolactin level is seen in a pituitary adenoma, but that is not the case in 99 out of 100 patients. It's just that they've had a late night and woken up late and given the sample soon after waking up because they thought it was fasting when it's actually not. So again, I think that education, that instruction, that training of medical staff so that instructions flow freely to the consumer or the patient side also is critical.
I think on the lighter side, Dr. Arjun, I was reading my physicians, like, no, he has very clearly written, keep your Google knowledge out of the room. So very, very relevant. I think we talk about a lot about devices, data, and like, no, integrity, but I think patient has to be equally updated, educated on like, no, how do we really see the data, and clinicians are the best judge. I think, yes, we can make some interpretation out of it, but yes, that's very good. Thanks, Dr. Arjun. And I think now, I think we are moving to probably another section of future. We always see future. So how do, like, no, maybe my question is more towards Mr. Anurag, that like, no, how do you see the future of these devices, like, no, interconnected, interoperability, and like, no, data is now in our watch, in our phone, like, no, in our lot of wearables. You can do 24-hour glucose monitoring and other stuff. So a lot of data available, but how do you see, like, no, it can be seamlessly for patient experience, future of these devices? Maybe any, like, no, trends, maybe AI is something which is, I think, changing the game everywhere. Telemedicine we saw in COVID, I think, no, it has helped a lot. So maybe Dr. Anurag and Miss Deepika, I would request if they can throw some light through their experience.
Yeah, thank you, Mr. Gupta, for giving me an honorary doctorate. I'm not a doctor yet, but thank you so much. I aspire to be a doctor one day. I think what I want to do is I want to focus on the mass market here, right? So while people on this call, all of us are in metro cities, and we are all well educated, and we can access all these digital systems. But as a future, I think what we want to do is we want to cater to the mass market, the Bharat citizens, and make sure that they are digitally included, right? So one suggestion is that while people are talking about chat GPT, AI, we have to make it very accessible for all the rural citizens also, right? So imagine a rural farmer sitting in Tamil Nadu who doesn't read English. He wants to know where is the nearby Jan Aushadhi clinic, or he wants to do a test, right? So he has no way right now, right? Either he will dial a helpline, which people may not answer also at times, or he will try to navigate on the website, which is not readable, right? Because he can't read English. So we have to focus on digital inclusion through technology, and we as Reverie, we are focusing on that. So we need to make all these digital interfaces multilingual for all official 22 languages, at least to start with. We also need to make it very simple for people to access, right? So right now we are focusing on interfaces which require reading, but imagine a conversational AI interface that provides answering capability in regional languages also. So elderly Punjabi lady, rather than cursing on the helpline, if she can talk to her voice bot and she can get answers, and she can also read about some of these tests or whatever, right? That is the future of technology that we want to see. And we have to look at other futuristic applications as well. We have to make it maybe a portable healthcare assistant which can be made available, where at least I can read up about if I have some problem, at least for basic diagnosis, I can talk to that personal health assistant, and I can book an appointment, I can do my daily tasks, right? That is something that is required. And obviously there are advanced applications as well which can be looked at, but my focus is to look at how do we focus on digital inclusion and make it very simple for patients.
Yeah, I think ease of use is something, Mr.
Absolutely.
Anurag, I think, yes, that's very, very, very relevant, because we have all skill set of patients, like, no, tier 1 patient, metro patient, very advanced, very, like, no, at all not. So I think Dr. Ashish is here. Maybe any aspirational, like, no, this kind of technological changes which you are look at in terms of better patient handling. For example, patient coming to hospital, you can ask them to do basics, maybe BP, sugar, and other stuff at home, and you get that data. So something aspirational in terms of, and some trends of the future in, yes.
So if you talk about things like remote monitoring, yes, seamless monitoring of blood sugar at home has become a commonplace thing.
Yes.
And apart from that, so many startups have come up who monitor the basic parameters, who just like Holters and other things, where they get seamlessly transferred to the clinician in charge. Even in hospital, while the patients are placed at various floors, ICUs and wards, the clinician has a dashboard on their phones to monitor any red flag if it happens all of a sudden, with causing a code yellow or code blue scenario. So that also gives them a snapshot of how the patients are performing, even while they are not on the rounds. In my own specialty, like orthopedics, very recently we have come across, remote monitoring for my knee patients who, after going back home, it's very difficult to track their, movement, how well they are doing physiotherapy, what is the joint balance, how many step counts are they doing, and how they are, complying with the physiotherapy. So we have very recently, acquired a product which, it's a remote monitoring device which gives you a live monitoring of whosoever patient is using that monitor for. It is basically for joint patients, or for that matter, later on, it can be used for any knee or a hip or a spine problem patient, where those sensors can give the live feedback to the phone of the patient, and then that gets transferred to the clinician or the auditor who is taking care of all the patients at the same time. So a lot of data gets collected, and we get to know patients who are not doing well, initial few weeks, maybe their step count is less. So if any outlier we find in that, a collection of say 50 odd patients who are on the monitoring device, we can institute early interventions to see whether there is something wrong from the surgical side or from the patient factors. Is there anything we can do to get him back on the track on physiotherapy and all those parameters which we have set some benchmarks? So these are some things which are coming up in a big way. Yes, of course, things have to make sure that whatever new technology we institute, ultimately it should benefit the patient first, followed by the clinicians, and of course later on the organization should also benefit out of it, because otherwise the motivation for organization to invest in a technology becomes low, and for a physician to continue to use it, because it's very difficult to change the mindset of a clinician. If they don't find value, they will outrightly reject it. So that's something which is a combination. So whenever we talk to a startup, we always see whether there was some I would say mentor from the medical side. If the IT people are making a product for the healthcare industry and they don't have input from a healthcare professional, I think they are heading for something which may not become a sellable product, or a unicorn for that matter. So one such product we are seeing, it is also in the early phase. They have already done 500 patients outside India. I hope that that's going to be something which gives us more confidence in relying on wearable devices for trusting them for our patients' outcomes, and also to monitor them from a remote. Especially in India, such things can be a major boon, because a lot of patients come from villages and they may not have an access to telephone as well. So that gives a first-hand experience, or we can track from a distance, because once the OPD becomes so high, and you over a period of 6 months you have got 500 patients to monitor, the technology has to be in place so that we are able to give the right intervention at the right time and monitor the patients even from our clinics or the hospitals.
So thanks, Dr. Ashish. I think quite a relevant.
Mr. Nitin, I would request you to kindly wrap up in next 5 minutes, please.
Yeah, sure. Yeah, I'm on it. Maybe Miss Deepika would have a lot of insight towards telemedicine. I think that's part of her expertise. So maybe quickly, if we can, share about the trends around that. Yes.
Thank you for the opportunity. I think telemedicine has played a huge role during COVID, but I think there is a potential much beyond, just urgent care, express care clinics through telemedicine. I think what we are doing at Cleveland Clinic is virtual peer-to-peer consultations, where on very complex cases, where there is not enough research. There's a lot of collaboration between different hospitals in India and our hospital in the US, where we are able to collaborate on those cases. Now we are experimenting with digital stethoscopes, where the heart and lung sounds of patients can also be sent to different hospitals. So I think there is huge potential, there's benefit to the patients. We've been able to cut down some of the misdiagnoses that can happen anywhere in the world, and so on. So I know in the interest of time I won't give you specific examples or data, but I think it has a huge potential.
Yeah, we all seen telemedicine contributing a big way in our past pandemic. We just got over it, and this helped really the patient and the clinicians both. So I think with this, I think we have a very good discussion, and I think there are a lot of stakeholders, patient, service providers, doctors, clinical side. I think as if we can put all in one frame and think about that in future, and the way IT is growing in future, even if you go to tier 2, tier 3 towns, 5G network present, 4G network connectivity, I think the future is bright. Digital health is brighter, and I think as I will conclude saying this will help us in 2047, healthier, individuals will help, healthier citizen will help in India becoming a developed country, which is our ambition in 2047. And I am sure digital health will play a great role. Thank you once again to all the panelists, and I would like to sincerely thank taking your time and sharing the expertise. And yes, sure. Thank you so much. Thanks.
Thank you. Thank you so much. I would request Dr. Harsh also to kindly open his camera so that we could have a picture clicked as well. And apart from that, thank you so much, Mr. Nitin, for making it so crisp. There are many questions which have turned up, but I'm just going to take one of them, and I would just push it to you and see what best we can you can offer. Somebody have asked an interesting question that what benefits can government be giving in terms of seamless patient experiences when it comes to digital healthcare? I think they are trying to say what benefits you recommend the government should offer for a digital healthcare system where, for example, I think I personally feel that Practo is one of the big examples where it really helped people throughout India during the COVID times. But if you could have something more similar, something more practical from the government perspective too, will make a lot of difference. I give it to you, sir.
Maybe I think Mr. Anurag is the right. He's into it, and he can throw some light on it. I would request Mr. Anurag to.
See, I think government is already doing that, right? I think what they have done is they have created credible sources of information. All they need to do is make it accessible for everyone, right? So that itself is a big incentive that I don't have to Google and look at advertisements, right? I can have credible sources of information that who is my nearby cardio doctor, which is my nearby lab offering this service, right? So if that credible source of information itself can be provided, that itself is a very, very big incentive.
Absolutely, absolutely.
Yeah, it's a plus.
Yeah,
government
great.
always is kind of enabler. I think delivery is
Yeah.
to be done by private segment, and government will facilitate the environment. I think that's the
Absolutely.
Thank you.
Absolutely. Thank you so much, sir. Thank you, Mr. Nitin Gupta, and thank you so much all the panelists. It was lovely having you with us. We hope to connect very soon again with the offline version of the event, which is scheduled in the coming months, and we'll be updating you about the dates for the same as well. Thank you so much.
Thank you. Thanks a lot. Thank you.
Great. So we'll be starting with the next panel, which is the panel 2 on ethical consideration in the digital age, balancing innovation, privacy, and security. In this panel discussion, we're going to delve into the ethical implications of digital health technologies, discussing issues related to the patient privacy, data security, informed consent, and the responsible use of emerging technologies like AI and machine learning in healthcare. It's a very, very important topic in the current market scenario. And I would like to introduce our moderator for the session, Dr. Ravi Gaur, founder, DRG Path Labs. We have Dr. Rakesh Srivastava, Senior Advisor for Innovation and Public Health, Wish Foundation. Mr. Arun Goyal, Chief Information Officer, Sir Gangaram Hospital. Dr. Vasant Venugopal, Chief Medical Officer, Clinical Products Lead. And we have Dr. Manjari Chandra, founder, Bonatra Manjari Wellness. Welcome all of you. Thank you so much for joining us. And I would hand over the discussion to Dr. Ravi Gaur to take it forward. Thank you so much, sir.
Well, good morning, everyone. And I think I was looking forward to meet you, all of you in person. But I think all this, the challenges, what we are all seeing today, I think roads are getting blocked and all issues. I think we have to turn over to the virtual mode. But then again, that's the advantage of technology wherever we are. And that's the digital age we're talking about. So I think wherever we are, we can probably interact, connect as close to as reality. Of course, a little different from the real one, but I think it's as close to as reality. So welcome and good morning to everyone. And this is, thank you, Saugat, for setting up this World Digi Health and Wellness Forum. And I think it's a wonderful idea to talk about, the various concepts of digital into the health and wellness, because a lot of things are happening, and probably digital age arrived long back, but in health, we accepted it much, much later. And we're still struggling because We don't know what regulation to take because the way it just came all of a sudden. We were not even prepared. So probably the things came, regulation, and every day changing and disrupting. So whatever regulation we make today, I think they become yesterday suddenly because things are dynamic and very fast evolving. So it's the right time to hear and talk about the important topic today and moderate. So I welcome all my co-panelists. And with this, I think important topic for today is ethical consideration in digital age, particularly balancing innovation, privacy, and security. I think this is very important today because anything what we do in healthcare, especially, it has to be absolutely ethical and without absolutely with the consent of the patient. Taking the trust is the most important factor out there. In the digital age, the challenge is not just to innovate. I think a lot of innovation can happen, but to do it responsibly. And we have to balancing the process of protection of individual privacy and preservation of collective security. That's a very, very important. And as we go through this or navigate this landscape of technology involvement, the day in and out is happening, let us remember the true measure of success lies not just in what we can create, but in how responsibly we can wield our digital power. I think a lot of things we can create, but I think many could be disruptive of no use. But how responsibly we can make use of it, that's the most important part in any case, in any technology when it evolves. And it's more so for the digital age. This is an interconnected world and rapidly evolving world. The ethical dimensions, maybe the ethics right here in this part of the world, ethics in some other part of the world, probably the culture, the cross sensibility, the gender sensibility, the population. A lot of variation happens. It's very important to have, that's why all these considerations become very, very important. And they're the one now shaping this, the linear fabric of society and influencing further the technological advancement. Today's conversation is going to be great importance. We have an extreme distinguished panelist out here, full of wisdom, new generation, and somebody who's actually connecting the both. That will be the forum we have today. So I'll be happy. I'm confident that the panelists will be able to deliberate and talk about various, what was in the past, what is the convention, what is happening, and how we are taking this movement forward. And ultimately, what's going to be the next 10 years from now? That's more important. We'll be building up a future for the benefit of all of us. So let the dialogue begin and fit that in a seat. So I'll probably start my first question. So Dr. Srivastav, sir, good morning to you, and it's a pleasure to have you here. And you have been a very, very responsible position, and you have been driving the healthcare for many years at ex-DGHS, and of course, you have been medical council director, and now, of course, which is actually the very, very social cause and a lot of doing work. My very first question to you is, sir, the ethical considerations are crucial to ensure responsible, equitable use of technology, we all know. How do we strike this balance? And, in the safeguarding individual privacy and security, because without this, nothing works today in the healthcare. Digital is important. So the question, how do we make this balance? What's your understanding? Can you show some through light? What was earlier, how transition happened, and what is current status today? What's your answer, sir?
Thank you very much. Thank you. I think it is a very relevant question. We have ethical system in the regulatory process as far as the National Medical Commission is concerned, largely non-digital in nature. Telemedicine came recently, I think about 4 or 5 years back during the COVID period, without any ethical systems being developed within the whole National Medical Commission. So on one side, there is a fast moving technology development which is integrating itself into the healthcare. On the other hand, there is a regulatory system which is responsible for ethical consideration, largely unprepared for it. So let us try to look at it from that particular perspective. When we talk about the ethical considerations, if we look at the WHO classification of digital health, which is probably most recent and is relevant to us because it is targeting to SDG 3, what priority government of India has fixed for NHM and the various type of other initiatives which government is taking. It is sitting on the 4 pillars. How does clients are ethically attended to How is provider ethically providing the services? How is the management system geared up for compliance to the ethical standards? And how it is being supplemented by the data services? To confess, I will say we are totally unprepared in these. There is only one thing which has happened till now is the Digital Data Protection Act, which has been passed out recently. It is only one component, and it talks about the security of the personal data. It talks about the various type of fiduciaries which are involved in this particular system. And it talks about many other things which are related to it. But there are large many things like how much ease of service it is providing, how much comfort to the patient it is providing, how many places it is substituting the normal services, where it is supplementing the normal services, what is the accuracy level, what is the precision level, how much system strengthening can be achieved through it, what is the role for it in the monitoring and evaluation, so on so on. The thousands of things which require ethical consideration. So my sincere comment on this particular subject that this requires a full length, in-depth discussion so that it is not limited to the data privacy, data security, and all these things. Now, second comment which I would like to make is health is something which has to be handled by human being. Machine and technology can supplement it. And their supplementation should be strengthening the overall outcome of the health delivery system. We don't have tested thing which can ultimately quantify and qualify that this is integratable and this is not. And the last comment is the health is for 70% of the persons who are living in the primary health care setup in our villages, where we have to build up our infrastructure and capacity so that we can integrate them within the system. At the end of the day, either after 5 years or 6 years, it is going to be a hybrid system because technology is not exponentially developing. It is developing 1,000 times every year. So in this particular scenario, every year new ethical challenges are going to come and we have to work for it. That is all I want to share. Thank you very much.
Thank you, sir. I think you're really, the nail hard, and probably like, yes, we know ethical things are well defined now. They're already getting in shape. But I think the biggest challenge today what we face is the unprepared regulators, because it's the way the regulators are. Because the moment your technology comes in, regulations get into processes. It's a very lengthy process, and by the time you come out of the regulation, probably the technology is already changed, disruption already happened, something more has come up. So I think just a follow-up question on that, sir. I mean, what do you feel the situation should be, sir? Like today we have this, how do you make a balance? Can it be something like that? Just thought coming to my mind, sir, when you said, it shouldn't be we have a regulatory authority, maybe regulations come up, shouldn't be a real-time regulatory authority bodies, which should be like, oil pricing, which we probably do that. So the way technologies are coming today, I think regulatory authorities have to be alert. What any views on that, sir?
I am working in technology from 2014 with Wish Foundation. My domain is innovation, all the technological solution, digital health solution, AI, ML. I am linked with BIREC and ICMR for validation of all the products which are coming and prioritized. And I have got a background of understanding of the things which can be handled by an authority, the power attached to an authority, and the delivery of the good services attached with the authority. With this thing, and working in the government for a long time, sometimes I become very perplexed whether authorities sometimes serve purpose or they don't serve. Yes, authority is necessary. But who should own the authority? The end user or the government? Should it be participatory? Should it have a 100% dominance of the government? Should it have a participatory type of it? At the end of the day, if you create an IRDA, if you create an MCI, if you create any other type of authority, it is the human being who are sitting over there. They will make it work or they will make it work bad. So authority is necessary. But what should be the composition of authority? How do you select the persons who sit at the top and take decisions? How are they uninfluenced by the pressures which is there in such type of sectors which has got a high level of vigilant motive? So all these things need to be seen. The government work like this. You make 6 suggestions from big platforms with large number of persons attending it and following it on various type of modes, and government says, okay, fine. There is a great demand for the authority. So let us start working. They will constitute a committee, they will start working on it, sitting in an office, and at the end of the day, we get something which is useless. So that is my perception. I have tried to respond to it very bluntly, might not have appealed to many persons, but that is what I feel like. Thank you very much.
Thank you so much. I think definitely the great need, sir. It's definitely been had probably, in my personal view, going to be more of a participatory. We have a lot of experts, a lot of users, a lot of government authorities. I think something like a trial, like a mobile phone kind of thing, something like that, a body should be created, which works on a real-time basis. And probably that could be some solution later on, probably take a different shape. Thank you, sir. I'll come back to you again. Next, I move on actually to the next question to Arun. Arun, you are like the Chief Information of Gangaram. You have a huge background of IT and kind of various corporates and bodies. When it comes to data, what's important? Because you are in the hospital even today. Who should first and foremost is the data. Now, who owns, who should own and control the personal data? Can we empower individuals to have their own, do what they want their data? Or can we, the patient consent, what all? And because that's very important point today. Because this, when a patient comes to a hospital, data becomes hospital, patient says, my data. So can you just throw us some light on that?
Thank you, Dr. Gaur, asking this important question in this current scenario. I would like to answer this particular question in the light of Ayushman Bharat Digital Mission, the NDHM, wherein the NHA has already put in the guidelines that the patient data, primary owner is the patient itself. Wherein in the practical ground, at a ground reality, we see that hospitals are owning the respective patient data, or the clinics or laboratories are owning the patient data. So far as the facilitating the patient data available to the individual patients are concerned, based upon the consent, there are guidelines that you need to provide in a particular framework, particular format data to the patient, and that too individual data which would be sitting into their health locker or otherwise into any cloud or any hard disk. They can keep that data with them, which could be transferable or interoperable to the other hospital. So there is another underlying guidelines which should be there, and which somebody should be driving, be it NHA or any other medical council or any regulatory body, to implement the uniform standard across the healthcare industry. So if you have a uniform standards being followed by every healthcare provider, and you are sharing the data to the patient, then that particular data will be interoperable and would be patient will be able to share with other hospitals and other clinicians, which would become a meaningful. And patient need not to carry the huge, humongous paper files for the subsequent consultancy with the clinicians. Furthermore, if you have a uniform formatted data across the healthcare industry, that particular data will become useful for the research and analytics as well, for the governing agencies and research bodies to create analytics around the healthcare information. That's one thing. You asked about the consent. So in the hospital, people do think that when patient comes to the hospital for the consultation, it is patient's consent is an implied consent. So whether it is an implied consent or an informed consent, you need to have you need to inform patient about all the treatment which you are offering to the patient. He should be well informed about the treatment, what we are giving it to him, what will be the repercussion, what will be the side effects, and how we would be treating. So well informed consent is important for the patient, be it implied or the informed. So that is a one thing. And in the Ayushman Bharat Digital Mission, that also has been properly defined out there using the Aadhaar card and other details with the clinical consultation with respect to the patient, be it in the hospital or in the clinics or into the laboratories or any other services with respect to the healthcare.
Okay, thank you for saying that's very important. I think in a hospital, when patient comes, basically the implied consent. In any case, for the treatment and all complications, everything, whatever surgery procedures have been done, there is always a consent separately taken also. But I think, Arun, like when we are talking about digital age, we have to develop an AI, we have to develop some data analytics, which is going to be like patient is gone, fine, over. But it's like the data what we get from them. Probably I'm going to work on 4 years, 5 years, 6 years from now, and probably that data maybe because there's a continuous evolving process. Same data which was 10 years, 2 years, 5 years, whatever the 1 year, and probably it continues being used. In that, you think separate informed consent is required, and what kind of a process should be? Because that's very gray area as of now to me. Any views on that?
Are you asking that the patient consent with respect to the data being used in the subsequent episodes or for the future research purposes? If
from developing an AI tool or something, like what?
Yeah, so if that is the case, it has been clearly defined into the Ayushman Bharat Digital Mission that patient consent will be taken for the data usage and those data will be anonymized. And we will make sure that data is anonymized and those anonymized data can be shared with the respective research bodies for the subsequent research purposes, or otherwise any government policy decision making with respect to the regional decisions, etc., for any vaccination program or any other program with respect to patient data spread over 1 year or 5 year or whatsoever it is. And the same data can be shared with the pharma industry for the development of any vaccination or any medicine, etc. But condition is that that data should be anonymized with the consent and information to the patient that this anonymized data will be using for respective purposes.
That's a very good, I think, answer, because probably what we need today is any of the healthcare providers, whenever the patient comes, we do take a consent of the treatment and other handling. But I think it's very important to take that consent separately, maybe a part of our consent form, where we can say that your data can be used for research purposes, developing a tool which is be anonymized. I think that's make a clarity in our consent form. That's I think one of the important point probably you're trying to say, right?
So in NDHB, Dr. Gaur, if you go through the NDHB, it has clearly been mentioned about such type of data sharing, be it anonymized or non-anonymized data. Even in the anonymization, not only the individual demographic of the patient to be anonymized, the location and the hospital is also to be anonymized so that no one can de-anonymize the data and identify the patient from which location, which hospital he has been treated.
Yeah, I think that was going to be my next question to you. In any case, I'll come back to you because these policy exist, but how many patients are aware of it? I think how do we do that? We'll probably come back to you on the next round on this question. I think thank you so much. I think I move on to Dr. Vasanta. Dr. Vasant, welcome, and you have been doing a lot of work, especially in the couple and digital imaging and the AI development. So, what measure? Because sometimes you must have heard called Watson. I think they did some IBM this kind of a thing, the data, and they did good work initially, but the entire thing failed miserably because they had. You all know the story behind what's happened. They did a lot of work in oncology and cancer. So, what measure can be implemented to enhance the transparency? Probably the reason was that quoted somewhere. We don't know the exact reasons of those failures, but probably it was the data which was like extrapolated, or maybe the no transparency. And many a time prescriptions wrong what came out because of the base was something like new. There was no transparency in the data basically. What measure should be implemented to enhance transparency and the accountability in the technology? Particularly, especially when the automated decision making is involved. That's what because you are actually working on it for multiple times, and I'll like to hear your views from that.
Sure, sure, sir. Thank you for the question. and thank you for the opportunity. I'm honored to be part of this panel. I just want to start with a small incident that traces back to your previous question. It's good to hear that the government is looking at anonymizing the location information while hospitals are sharing, because there is a class action suit that's being fought by Google Health. Because if you think of Google Health, they have access to the map location information of patients from their map services, and the hospital is sharing de-identified data without removing the location information with them, with Google, who is building their own suite of health solutions. Now they can triangulate these two information and go to, and they have the power capability to identify the patient. So that's kind of interesting to note. Coming back to your main question, Ravi sir, about transparency and accountability. Now I have worked in as a radiologist in hospitals and now moved to be part of the industry building AI solutions. There is a dichotomy or a problem that the healthcare providers are facing today. Number one is they have to kind of in a way pay for the solution that they're using, and also take ownership for using the solution, right? Which is unfair, right? Anything which goes wrong because of using a digital health solution, the onus still, as of today, falls on the hospital, be a healthcare provider, a doctor, or radiologist. So the first thing is to recognize that ownership and be transparent about what technologies they are using with the multiple stakeholders, right? The first one is, of course, the government and the regulatory body. Today, CDSO clearly states that any AI solution that's being used in clinical practice need to be registered and listed under the CDSO SAMD registration framework. The first thing is you make sure as a user that whether the technology that you're using is registered in the CDSO kind of registry. The other important thing is, we work in the space of radiology, where the new age deep learning solutions are being kind of developed. And one of the problems, at least that's being kind of talked about a lot, is the black box nature of these solutions. What it literally means is you put in an input data, they will just give you an output without kind of explaining to the user how did that arrive to that particular output. You put in a chest X-ray, gives out an output saying that just chest X-ray has TB, without properly explaining what are the inputs that it kind of took into kind of go to that conclusions. So that's the kind of the problem with the deep learning solutions that we have been talking about. But that's the thing of the past now. Now the new age technologies have built in explainability, factors and observability factors into their solution. So as a user, when you are trying to adopt such solutions, you make sure that the solution that you're using have built-in explainability and observability mechanisms that explains things in your own language, not in an algorithmic or a developer language, in a clinical language, and disclose whatever you're using to all the stakeholders, be it your patients, the authorities, or the hospitals. I think these measures can improve the transparency of using digital technologies in clinical practice.
Okay, great. I think very importantly, you said the accountability. That's a very big issue, because if I am using an AI tool developed by say XYZ, now my AI tool fails, now I'm going to be blamed or XYZ has to be blamed. I think this is a very, very great, important point. So all about that's the reason there should be transparency and very well defined accountability, because it's not like you have a data, what your tool you developed probably is a very transparent data, which is passed on to the user and have a full kind of a system. Anybody can have foolproof check. I think this is, what we need today. And there have been some, guidelines on it. There have been some processes on it. But I think we need to really drive that hard, because there's so many companies, the newer age groups that are coming out with a lot of AI tools, and especially for the healthcare, where there's always a need and demand. Disruption is a need, because bigger cities is fine, but when it comes to the tier 3, tier 4, remote area, the last minute or the post there, they definitely need these solutions, because that otherwise with healthcare, the way they progress, I think next 10 years, we may not be able to reach the last man, the desired benefits. So I think it's very important, the point to be noted. I think all of us working in this field, we should talk about wherever you're using an AI to go back, get the data, learn, and the AI developer should also have a data which is actually with a full transparency and the foolproof, because it should not be many a time like, because once you anonymize the data, you don't know data is like X has been repeated 5 times or 3 times. Probably we're not even aware of that. I think, then I think just a quick question follow up on this. Like, we are talking about, see, what could be how do we address this, minimize this algorithm bias? Because this basically is analytics algorithms have. So how do you minimize this biases in decision-making systems? Because you have worked on it, I think probably you can guide us and tell us.
Sure. So I can kind of draw examples from how do we approach this. So we, in the radiology space, there are 700 plus FDA-approved AI solutions that are available for use in hospitals, right? You pick a simple problem of a chest X-ray diagnosis. Today, there are 15 mature global companies FDA-approved that have that can do that problem, solve that problem. Now, the way we approach is we go to a hospital, give them a testing access to all these solutions within their environment on their own data, and help them to run a robust testing process, comparing all of the solutions, and help them pick which is the right solution for their own data set. If a hospital has multiple centers, we also help them to identify if there is a particular solution which works best on a particular center, particular modality, particular age group, particular vendor. So all those kind of deep driven analytics, we help them to do that using a platform-based approach. So wherein we cover, number one, the data stays within their environment. They get access to all the best possible options there. They do their own robust testing and choose the best solution for them. Now we don't stop with that. We help them also to periodically monitor the solution when it is deployed. It's very important that you have done a pre-deployment testing. You are sure that this works fine on your retrospective data or historical data. It's not necessary that it will stay so, because there is a challenge of data drifting, right? Suddenly COVID comes and everything changes, right? The entire distribution of patients changes. The new disease entity has come in over the past 3 years. How will your solution perform in such a drift kind of situation? So we help them monitor it. And there is a lot of education and training that needs to go with the users, the hospitals, the radiologists, the technicians, the clinicians. All of them need to be educated about the right way to use the AI solution, right? Because if you don't know, what are the limitations of the AI solution, you're just kind of blindfolded by only the benefits. It's going to be very risky to use those solutions. So these are the 3 steps: pre-deployment testing, education, training, understanding the limitations, and continuous monitoring post-deployment. So these are some ways we can mitigate these challenges.
Great. I think that's a good, thing. We ought to be all careful. AI is definitely helpful, no doubt. It's already here. So I think it's got whether it's a hype or a hope, peril or perish. I think these are the things probably time will tell. But of course, it's a tool is a right, and without that we can't survive. But typically, whatever we're doing is we need to be transparent, we need to be accountable, and I'm sure a lot of policies and processes have been evolved. But and a lot of training, awareness, and a lot of things. I think we need to keep holding all this and together for everybody till it's a streamlined. I think it will be in a continuous process, not in a one-time thing. Thank you. We'll come back to your next question. I think I move on to Dr. Manjari. Dr. Manjari, thank you for joining very short notice. And I think, you are really working in the space of wellness, and which is like a very, very a private space. And, what be do you think there should be a separate ethical guidelines to be in place to govern the collection, storage, use of personal data, and especially, like when you talk about business and government entities? Because we have like nutrition, we understand what I'm trying to say. So what should be the ethical guideline? And in our society, what should be we as an approach to these ethical implications of emerging technology? Your views, please. You're on a mute, I think.
Thank you so much, Dr. Gaur, for the question. It's an absolute pleasure to be here. As compared to hospitals, as you said, in the space of wellness, we have a little bit more data, and sometimes data which is specifically not just clinical, but personal data, a lot of behavioral data also that we are able to collect for the people we interact with, or you know, people who become our patients and patrons. One of the things, you know, in the ethics of data, especially, I think there are three basic pivots that have to be adhered to whenever we are looking at the data being ethical and ensuring that the ethics are not compromised. I think the first one is to have a respect for autonomy, when the person's autonomous, you know, right to that data is the first thing. The second is ensure that we are only doing good with that data. You know, the intent of collecting the data is to do good, and that there is no harm which will happen as a result of collecting that data. Because let me give you an example. For example, you know, a lot of data about behavioral patterns of people who have, for example, eating disorders, you know, or people who have, you know, morbid obesity, can also be harmful and can be used in a way where it may not be beneficial to the person whose data it is actually. So ensure that it's only for good and not for harm. Those are the basic considerations. But we've seen that what happens with data, especially when we are using you know, IMT devices, or when we're using AI as one as driver, sometimes we tend to over glorify data. You know, we tend to consider it as the ultimate point at which, you know, the intersection, any form of intervention can be done, or any solution can be offered. So we have to understand, I think, especially for companies that are doing the digital work, that this is just one point of which has to be considered in the entire treatment protocol or solutions that have to be provided to the patient. I think, you know, this there should be no hype or myth about technology. Technology is a limited, has got limited benefit, and it should be used, but that limitation should always be remembered. And other important sets of things that work around the patient's benefit also are equally important. Those considerations. I think, you know, the other thing is that the concept of conditional good, you know, that there are always conditions attached to how the data can be actually relevant and good. We cannot forget the conditions, because most of the time when, especially startups and companies who are trying to collect data to make some tangible solutions out of it, tend to only look at the compliance bit of it. So we're only considering the compliance. Sometimes the ethics are not something that, because there is a little gray zone, the ethics zone is a little gray. So you know the compliance is there, and these certain compliances have to be done. So the compliance bit is adhered to, but the ethical bit sometimes is not on top of mind of people who are developing these systems and collecting that data, and then eventually using it, whether to build AI algorithms or to offer any sort of solutions to people whose data it is there. You know, privacy and security, everybody's already spoken about, but I mean, other panelists were mentioning that, for example, it's very easy for Google to understand a person's location and then to trace a person back, because Google probably has all forms of comprehensive data. So that's another thing, because privacy and security on paper may be easy to say that we are maintaining privacy and security, but considering the technology is so intrusive and sort of disruptive, I think privacy and security are also, there has to be a double layer of privacy and security on the data, so that there is no breach of any privacy or security for people who are part of that data collection exercise.
Thank you, Dr. Manjari, for saying that. I think when it comes to the wellness space, I think it's very, very important, because one is, of course, individual personalized, because you're not ill, you this your very, very personal data, and similarly societal, society kind of a thing. I'll give an example for that matter. If it is used for the right purpose, it's beneficial. Like suppose I get to know in a village or in a community or a district, every day as a diagnostic test, I'm getting more dengue patients are dengue positive. So I can use the data. Oh, there's some kind of a endemic or epidemic likely to happen. So I rush my forces out there. But it could be, the way the business house. Somebody is talking about, okay, and it depends on the habit, about some large number of people interested in the wellness in that particular society and particular district, and they come back and you have a lot of protein supplements probably offering. So probably the communities will say, oh, this is the best market for protein shop. Let me open 100 protein supplement shop. And whatever is visible then, probably it's sold. I think you need to keep a big balance about it. That is where it's very, very important. What is right, what is not right. And I think equally important that society gets aware of it. And of course, individual and of course, the companies are using the data, they should be very, very careful about it. I think compliance need to be done and probably some regulations will follow. Now, with that, I think we'll come back to the last question again. I think Dr. Srivastava was back, sir. Sir, I think I just would have a last, 2 minutes comment from you, sir. Is the current legal framework sufficient enough? And or we to revise and adapt to law? So, because we have regulators, but I think legally, I think where do we state today? So if something goes wrong with AI tool, what is going to be action and what should be the remedy with us? You're on mute, sir. Can you open it up? So we can't hear you, sir.
Now you are able to hear me?
Yes, sir. Yes, sir.
If you look at the things which are happening globally, you will see fast change taking place in US and European Union, and there are various type of legal system which are being developed so that the regulatory system takes care of things in a right way, and if they are doing it in a wrong way, they can also be taken care of. But they are all formative stage. Nothing has been established as far as the law is concerned. Now, the India, if you just look at the India or the Southeast Asia, India is little bit behind as compared to other countries in this region, because we have a legal system which is difficult to penetrate for bringing about change. And I don't know whether the process has started in the Indian system or not. But as far as the need is concerned, it is very much needed. Now, the grey time, the period in which these legal system, regulatory system, and the hybrid system develops, they are the areas, they are the time, they are the window of opportunities for aggressive marketing for India. Now, these aggressive marketing is taking place. Whether you look at ChatGPT, the new version, which is a self-solving type of version, whether you look at the various type of clinical decision support system, or whether you look at the various type of clinical trial and pharma companies utilizing the database which is being created, all are coming in a very fast way. So on one side, there is a fast mode of actions. On the other side, there is a lack of regulation and there is a lack of the legal protection. In that particular system, which I call a window of opportunity for business, there will be a growth of the business. There will be new technology coming in, but it will be confined to tier 1, tier 2 cities, or mostly in the tertiary care area. We will lose the advantage of having a good, legally backed, regulated hybrid system in the primary care. That is what is my feeling, and I have been openly talking about it in the different forum. But the fact is that still the things are not moving the way it is moving. I work in the primary healthcare. When I tried to introduce a primary healthcare system strengthening database and a software being developed for the primary healthcare manager, I started working with the World Health Organization. They gave me a project. I tried to build it up and I tried to link it up with the budget impact studies, how much money saving it is doing, how much is the return of investment. At the end of the day, in a deficit economy like India, when it is going to meet the requirement of primary health care. It should not be cost intensive, it should be cost saving. Only then it will be sustainable. So that can only be possible when we have got a very strong legal system which can protect the regulatory authority so that they can make regulations which are large masses friendly and can help us reaching the healthcare services up to the last mile person. And I tell you, it is definitely possible with the way the government is moving forward. The only thing is that there are unconnected dots which need to be connected. Government has got a sandbox, government is doing ABDM, government is moving forward, but it is top down. The bottom stuff is not coming up. So that is where I think a community participation, Jan Bhagidari, a type of participatory approach, an authority, a legal protection system, a redressal system, like we tried to develop in the Clinical Establishment Act. So that is what is there in my mind. That is all I want to share. Thank you.
Thank you so much, sir. I think
Dr. Gore, I'll just take a minute. We need to close the panel discussion next 2 minutes, please. Request you to wind up.
we'll just thank you so much, sir. I think for saying that. I think what we require is basically a participatory kind of a thing and a collaboration amongst all of us. So now we just have 2 minutes. So I'd like to just leave it open. One, Arun, anything you want to say the last minute punchline, or Arun, you can start from here.
Yeah, as Mr. Srivastav has clearly mentioned about the regulatory thing and initiative about the public health, and mentioned about the ABDM. I would put it in a different way that there should be some regulations across the healthcare arena where frameworks should be imposed across, uniform framework should be imposed across the healthcare services. That will help us in integrating and making the data interoperable across the industry.
Vasant.
Just one line, sir. As everyone pointed out, we need international consistent frameworks with local adoption addressing the social, cultural, and existing problems. That's the need of the hour.
Great. Dr. Manjari, please.
Yeah, I think one of the important things is to create a model for ethical considerations and make it like a roadmap that others can follow. A lot of technology companies can invest some time and effort in creating a model, something that can become a roadmap for many more to follow, because most of them are sort of hunting in the dark. So I think that would be helpful.
Great. I think thank you so much, everybody. I think the need is, I'll say that the essence of our discussion, probably what we feel is lies in finding an equilibrium. Basically, a delicate equilibrium that upholds the spirit of innovation, respects the sanctity of personal privacy, and ensures the robustness of collective security infrastructure. I think all three is very, very important. It's not a task to be done taken lightly. For the decision we make today will reverberate throughout the future and shaping the ethical foundations upon which our digital society will stand. And this is very important for the healthcare. Let us remember on principle that should guide us. I think that's something the takeaway we can have. Ensure that the benefits of technological processes progress are accessible to all without compromising the privacy of individuals or compromising the security of our community. Let us make people aware. Let's work together, develop a regulatory framework or participatory. If not, government probably is doing its own work. But I think all of us together at our own level probably come back and make a collaborative kind of a thing, at least a parallel model, at least what we feel that and what society needs can be created. Develop and implement an ethical framework that only keep pace with innovation, but actively shape its trajectory towards a more equitable and responsible future. And with this, I'd like to thank everyone and for being here and sparing your time and valuable wisdom. And I look forward for a robust system coming forward. And I'm sure all of your leaders out in the field, we will be able collectively to do something. And thank you again was this digital forum. And thank you, Sagar, to the team. Thank you very much for being here. Thanks again.
Thank you so much, Dr. Ravi Gaur and all the senior panelists from the industry. Before we conclude, sir, there are many questions which came up, and we have taken one of the questions as an FAQ, basically. It says that how a data breach affects a patient. Also, based on the recent incidences, what lessons can be learned? So we thought, this is something pretty much relevant to understand, and I leave the forum open for answering, sir.
Arun, can you take that?
Yeah. So obviously, when data breach happens, patient privacy gets impacted and individual gets impacted upon. So we need to create a system where patient privacy and patient data is maintained in such a fashion that in case of data breach, patient information doesn't get compromised and doesn't get revealed in the public forum. So that is a one piece when the data, and we need to in the healthcare system, we need to make sure that all the data is so encrypted and stored in a fashion that in case of any data breach, individual patients information doesn't get leaked out into the public forum. So obviously any data breach impacts patient, obviously. That's a one piece. Second is your precious data, healthcare data information goes out of your hand or out of your country when any such type of data breach happens.
Oh,
Anybody
great.
wants to add something?
Thank you so much. Yeah.
Anybody want to add to the whatever Arun said?
Pretty much answers, yeah.
Okay, fine. Great.
Great. Thank you. Thank you so much, all the panelists, and thank you so much, Dr. Ravi Gaur. We will definitely would love to see you in person very soon. We'll be coming up with the physical edition of the event in the months to come, and we'll definitely inform you about the updates on that too. Thank you so much, all of you, and look forward to meeting you very soon.
Thank you for having you here. Thank you so much.
Thank you.
Pleasure.
Thank you. Thank you.
Great. So moving forward, I would request Dr. Ravi Gaur to kindly stay back because he has one of the keynote sessions which is going to be addressed by him now. And I would leave to Dr. Ravi Gaur to take it forward again. Thank you.
I think need to share my screen, Mayank. I have a presentation. So how do we go about it?
I would request the team Alman to kindly allow us to present, please.
Yeah, you can. I think if my screen, I don't know, how do I? You're not able to see my screen, right? Let me share.
No, sir, we're not able to see your screen. You have shared the screen, right? Yeah, now it's getting visible. Yeah, perfect, sir. We can see it.
Okay, I think we make it a full screen, or this is fine. I think good afternoon again, everyone. I think we just heard about the data, the importance of data, the digital age kind of a thing. So I think very important topic. Probably it's a whole day. Probably you can take a discussion. Whole conference can be held on this topic itself. The artificial intelligence with a hype or hope. Adopt it or you perish. That's something I like to talk because this is a very the relevant today when it comes to the usage of these the tools when we have in the digital age. Next definitely is the AI or analytics or probably coming out. No, I don't know to define what is AI. AI is, all of you know about it. AI is a subset of computer science that focuses on machine-driven intelligence. That's a artificial or non-human intelligence. AI is the understanding that machines can interpret, mine, and learn from the external data in a way where said machines functionally imitate our practices, normally which is done by human beings. So it's a notion that human thought process have the ability to be replicated and machinized. Basically, remember, that's just a notion. It's based on a thought, whatever either machines can actually replicate what's in our mind. And this is where it's a dance between hype and hope, shaping the future with promises yet to be unfold. In healthcare, hope for transformative progress because the future starts. Because in healthcare is something which is been limited to in India, especially the world, but even to in the world also. Many of the remote third world countries or very poor, underdeveloped countries, they still don't have access to right kind of healthcare. And India, especially more than tier 3, tier 4 remote areas. So AI probably is a hope for transformation and progress. And holds the potential to revolutionize entire healthcare from diagnostics, treatment, patient care, and management. And this is what we saw somewhere in the COVID. I think the future started from there. And what we were supposed to see from 10 years from now, we are actually seeing the impact today. But when you look at the history of artificial intelligence, it's not a new thing. I was tracking back, probably the thought of this was somewhere way back 1651. From there onwards, multiple people have been thinking about it, and like it's been like 1651 to 1700, 1800, 1900, but it rapidly grew after post 1900. But what is surprising is how many people thought about AI hundreds of years ago. Before even a word to describe, they have no idea how to define. The AI was not, but they start thinking about. Now, if you look at the journey, probably there's a huge journey in between. There were a lot of people that developed, like you all know, there's kind of a frisbee, a doll which was developed, which was mimic their emotions. The dog was created by Japan. Then, of course, robots kind of a thing. And all this is happening very fun. But there was a winter sets in. After 70s, things went down. But again, people kept working. In about 1990, things came up. Again, it went down. But then I think in 2010, I think the AI picked up and become embedded in our day-to-day existence. We use because of the time of smartphones, voice assistants, and all this has become no longer a pipe dream, and this is now been actually in use. Then when we go back to what to expect in AI in 19 and beyond, that's very, very important part. Now what is happening, we all know about it. What the future holds for us. Now we are all seeing it's evolving very fast. You have automated answers, probably chatbots, virtual assistants, which is helping out, strengthen chatbots assistants for heightened user experience. Because you don't have to just think of question. You just have to probably write one question. Probably your chatbot will understand your next question, what is going to be. They have an automated answer to that. So this is fast developing. Natural learning abilities, machine learning, automated machine learning, they've all become the answer to our problems. Because I say I have cough, I have fever, automatically they'll ask 10 more questions. Because you may forget to answer those questions. Because remember, when you go to a doctor, but machine will ask you 10 questions, 1, 2, 3, 4, and based on that, some diagnosis is right. Anyone medication may be suggested, but of course, under the guidance of a registered doctor or practitioner. And someday, the AI and human mankind, probably they parallelly. And but I was talking about, we have a faceless today, who can say faceless or you can say mobile diagnostic lab. There's no driver; it goes off its own. You just walk in. Probably you have a iPad. You just probably own test, and automatically there are automated robots not taking the blood samples. You can draw the samples. It automatically tests it and report this. So faceless kind of a lab. You never know these kind of a thing, but these are the answers to remote areas where human beings can't reach. Robotic-driven kind of mobile labs, diagnostic centers, smart health centers. These are all now evolving very, very fast. In some areas in the remote part of the Northeast, we have seen actually robotic surgeries happening on people. They're very, very centrally controlled, remotely controlled, and very visible thing. Latest technologies out there guiding people. So various diagnoses of disease, what are the various applications today we're talking about? Applications are like diagnosis of disease, medical image diagnosis, what we saw where people are doing x-rays, short of radiologist, images can be identified, drug discovery, medical robots, like helping out, maybe picking up samples from here to there, maybe delivering the drugs from one place to another place, hospitals, we can picking up samples from the wards, delivering to the lab area, clinical trial. Now, virtually, you can have a lot of first phase trial or second phase when done on the system by itself because they create a lot of algorithms and permutation combinations. So the trials become faster. Outbreak prediction. That's what exactly we can always say, okay, in this area, these are the diseases coming up. What going to be future? So probably all this can be, applications of AI are definitely in use and they're fast coming up. These are again furthermore defined. So rare disease diagnosis and treatment. Rare diseases are almost only another 7.5 lakh patients of rare disease exist in our country today, in the world actually for that matter. Maybe there's some diseases only about 3 patients or 4 patients. But I think more and more system probably we can integrate them together because what technology we use in one part of the world may be immediately available second part of the world, and rare diseases answers can be addressed. Then fraud detection, especially in the insurance schemes. So then gene editing, genetics is a big way. Surgeries, of course, already happening. Wearables and wellness, real-time monitoring. But we heard in the previous session, there are wellness industry. We can always say you have wristwatch, you have something called as rings, you have necklaces, you have bands. All this is, but the problem out here is, I think, there's too much of data flowing in, and we don't know what is scary. It's become sometimes very, very scary. What to use it, where to rely, how reliable it is, because it's all based again on some kind of a data. For research purposes, drug delivery, drug dose correction, medical diagnosis, drug development. These are all multiple uses. I think everywhere, I think AI has now made it a presence into the healthcare. Now, chronic health, because I think about 40% of people in India are non-NCD, the chronic health, hypertension, diabetes, obesity, and some kind of cardiovascular disorders. And of course, cancer has been added to it now, the chronic health. Is expected because this is where, because this regular monitoring is happening, it's probably what you have eaten today, what is exercise you have done today, what kind of environment you are you traveling, your sleep pattern, and if you're diabetic, probably it can guide you and help you. Next 3 days, eat this, do this exercise, sleep well, otherwise your sugar will rise again. I think same thing can happen with heart disease, prediction, neurological diseases is coming up because a lot of stress, dementia, memory, Parkinsonism, Alzheimer's, the threat looming on everybody's head now because the way that the technologies are, we have even forgotten our phone numbers. Probably we have to dig out our own phone to tell what's my number because people are earlier. I think it was hundreds of phone numbers also on our tape, but because of the technology, we don't feel it's of much of use. Probably the memory losses or maybe the many other reasons for that. This is all coming up. So this is in a summary, AI in healthcare practice today, improving the future, early detection, diagnosis, personalized medicine, prevention, healthcare workflows, digital pathology, radiology, wellness, mental health, and of course, telemedicine as we move forward. Now, one example is something like that. If you see, now this is something which is like, okay, if somebody is smoking today, now it is a mirror which actually tells if you have overall data, this is how you look like, lean and thin and fit. 20 years, if you continue, you become this. Oh, if your picture is in front of me, probably I'll help by my predictive health. I'll take preventive measure. Same thing, smoking. As today I smoke, I'm looking beautiful, fine. But 20 years later, this will all happen to my skin and area. I'll have a lot of suffering. Same things for the smart toilets are today, in any case, are being used in Stanford University, and there are about 20,000 such smart the toilets which are being used worldwide, especially in US and some part of Japan, where you get up in the morning and by the time you reach inside the toilet, you brush the body fluids, so all your data, what is like the blood is there, stool, occult blood, or sugar level, or fluid level, everything is electrolyte labeled, all is, I think, available on a mobile. And something goes wrong, alarm is immediately sent to your medical provider, and you never know. By the time you come out of your washroom, there's an ambulance at your doorstep. Okay, giving you immediate treatment. I think this is all a future. It's not really a future. It's already happening today. Which is today this is what's seen. Now telemedicine, all of you have seen the use advantage. The telemedicine regulations have been rolled out. It's a very, very big important point. It's beneficial to everybody, but the challenges are trust, privacy, regulation, what to reveal and what not to reveal. That's something what we all discussed earlier. I think the process and the thought has to, deeper insights have to go, regulations have to come up, and compliances have to build up to make people develop trust and at least of fair use. Bridging the gap, I think definitely advantage rural urban specialist consultation records. The past was illustrious. Today is weak and future definitely bullish and awesome. Now, connected health world, all this can be put together by technology, whether it's your heart, whether variables or your system, what you read, what you eat, everything can put together, your reports. I think integrated medicine, another area which is going to be benefited by the AI. We're talking about pathology. Pathology has become now computational, like biopsy reports, like especially histopathology. Now, you have a second opinion from globally. The images can be right away scanned and sent across to best the opinion specialist. Earlier, it was not. It was take months together to get a good opinion. But today, it is right within 24 hours. You're the best. This is a little expensive today. The future, but in any case, right. Labs are not like this. Probably it'll be new age pathology, entire computational kind of a thing. We do all the drug discovery I also mentioned about. It takes decades of research, costs billions of dollars. And fit only about 70 to 80% of this, 70 to 80% actually fails. But probably use of AI prediction, we'll be able to save the cost, expedite, and probably add on something in between, which is can help benefit the drug discovery.
Apologies to interrupt, sir. We would request you to kindly wrap up in 2 minutes.
Just 2 minutes. No, but again, these are all advantages I talked about. We are talking about AI failures too. But it's not only the AI failures, being you all know this. We have seen that IBM, Watson Oncology, cancelled after 62 millions for people have unsafe treatment. Microsoft AI chatbot corrupted by Twitter trolls because all kind of slangs and languages were used, as a result of which the AI chatbot Microsoft probably decided to stop it because we don't know what are they talking about and what kind of a wrong information is going around. Many falls downs of AI in healthcare and suppose, but why it has not happened yet? Because that's the biggest thing. Nothing like real medicine is possible because it's not happened because there have been ethical concerns. There have been you can say privacy concern. And next example I give you right here. This is a person, there are too many infrastructure issues, too many versions, updations happening, safety, security, real-time need. It's like a person, lady standing next door to her husband's grave, and we say that, oh, how he died. He says, no, I took an appointment. But by the time he has to update his operation system, download the app, get a username, choose a password, and by the time we could log in, probably it was too late. These are all pitfalls. So I think we need to create some uniform system where we can start using it in a very smooth manner. Well, these are all some data available. 24% are using AI, 27% are aware but top concerns, security and biases. 21% AI is not a priority, and 28% are still evaluating. So about 24% people are definitely using it, the advantage of the healthcare. Drawbacks, I've already mentioned about it. Then we have these are the issues, absolutely fall. Unrealistic expectations. Sometimes we think AI can replace human beings, not possible. Data privacy and security, there's always a leak. We need to put checks in place. Implementation, ethical consideration, regulatory uncertainty, patient relationship, which is probably from a remote, very difficult. We need to develop a new kind of a code of conduct and overemphasis on technology. So that is something, these are the challenges what we face. Now, this is an impossible war happening, human intelligence versus AI. I think it's not a human, it's a war. They are not an alternate to each other. They are probably have to work together. Perish, if you know the potential, I'll say unchecked implementation, again, go to perish. But if you navigate the path forward, balance integration, have ethical framework, regulatory oversights are taken care of, interdisciplinary collaboration, I think the huge success is going to be there. In any case, never mind. The robots here are here. Robotic revolution has arrived. Indeed, the advancement of automation when combined with robots is bringing best into our current reality. We've gotten used to having machine intelligence that we can carry around with us. Now we have to get used to intelligence that is a body and moves around without us. I think this is a reality going to happen. Last, I'll say, whether somebody will say, I'm not interested, somebody is artificial intelligence, somebody says augmented intelligence, but altogether it's going to be an awesome intelligence. So it's up to us whether, these are not scientific fiction and reality are not on the same page. This is both are going to be here. We have to live with that. We have to maintain a balance. This is what I like to talk about AI. I wish we had more time. Some other day we'll talk. Thank you so much. And anybody have any question, anything, you can probably come back to me.
Thank you so much, Dr. Ravi Gaur. It was really a fantastic, I would say it's an awesome presentation with awesome innovation. So I think AI is something which is going to change the game completely. Already we have seen the hints of it. And apart from that, yes, robotics is something which is going to be really the way forward. As we see in all the movies also, which are futuristic, completely show how things have really changed over the years and how things will change in future too. Thank you so much, sir. With this, I would request that we will definitely be seeing you very soon in the physical format too. And thank you so much for taking out time. Really appreciate your time and effort, sir. Thank you so much.
Thank you so much. Thank you, everyone. Thanks.
Take care, sir. Bye-bye. Okay, we'll be starting with a panel discussion 3 now, which is Beyond the Screen, Wearables, Remote Monitoring, and the Future of Preventive Healthcare. This discussion basically is on the role of wearable devices, remote monitoring technologies, and other digital tools in advancing preventive healthcare. Explore how these technologies empower individuals to proactively manage their health and contribute to the shift from reactive to preventive healthcare models. It's something pretty much on the lines of the discussion we had in the previous panel also. So in this panel discussion, we would like to welcome Mr. Sudhakar Maripadi, Director, Regulatory and Government Affairs, South Asia, Baxton and Dickinson India Private Limited. He is the moderator for the session, so welcome. We have Dr. Rajiv Chibba, Vice President, External Affairs, Policy, Government Relations and Outreach, Shahjahanan Medical Technologies. Welcome, sir. We have Dr. Harpal Singh Malhotra, Director, Clinical and Medical Affairs, Morphic Medicals. Welcome, sir. My good old friend, Dr. Ravi Rathore, General Manager, Policy and Strategy Affairs, Involutions Healthcare Private Limited. Welcome, Ravi. And I would also like to welcome our guest for the day as well. In fact, Mr. Vaibhav Tiwari was supposed to join in, but due to certain emergency, he couldn't join. He wasn't able to basically join the particular session. So that's one of the things which is pretty common with the doctors also. So we are dealing with the profession, which is quite challenging at times. So I would request now Mr. Sudhakar Maripadi to kindly take the discussion forward. Thank you so much, sir.
Yeah, thank you for the organizers, and I have esteemed colleagues and Ravi Rathod, Dr. Singh. Welcome. We look forward for the next 30-40 minutes. With your vast experience, how can we get the best for the audience? And the topic is also very interesting. I think let us take the topic and start with. I think before I said started, I heard from the previous panel as well, and I don't want to repeat in the interest of the time. So the technology is each time adding value. The question is, are we able to handle the disruptive technologies and the newer with a lot of making sure that patient is taken care of and has provided the support on a faster pace. And last but not the least, make sure that his personal data are protected in the bargain of whole of these activity. So let me start with Dr. Chibber. First question. Again, 1 second. So, Dr. Rajiv, I would like to ask how do you think the technology is empowering the individuals actively manage the health? With so many technologies pouring in, what's your inference? What is your take on the technology and the empowering the common man?
Thanks, Sudhakar. Hi, everyone. To my co-panelists, and also thank you to the organizers, WSDS, for organizing this. So, yeah, it's a very pertinent question, Sudhakar, if you look at it, because the current healthcare ecosystem, which comprises largely of doctors, nurses, pharmacists, and other medical professionals, they play an indispensable role in guiding us towards an informed health decision. But then, the ecosystem right now is more influenced towards, the evolving technologies. And regardless of, whatever concerns we may have, we all agree that the convergence of AI, wearable technologies, telehealth, that marks a watershed movement in healthcare. We all have witnessed this over the last couple of years, and the pandemic has also taught us very well. So that sets the stage for a reality where, personal health navigation becomes not just a supportive supplement to traditional healthcare, but a foundational aspect of what new and more individualized approach towards self healthcare can actually be do. And just to kind of like substantiate what you said, I think health being a lifelong journey with new AI models, with digital health, telemedicine, wearables, etc. Now we need to look at three essential things. One is timely access to reliable and yet understandable scientific information that people get. It's way beyond what we sometimes comprehend. So if knowledge is power, then timely, accurate, and trusted health information is arguably the most empowering tool we can possess. So, and in today's digital health information should be as readily, regardless of any socioeconomic status, geographical locations, linguistic, or even cultural barriers, we can access the information they need to make for a sound health decision. The challenge lies in developing the systems robust enough to differentiate between reliable and unreliable sources, offering only, only verified and scientifically backed data to users. So I think that's one thing that everyone needs to understand. Unless your information about scientific health is reliable and comprehensible to understand, it's not going to be something that everyone would love to leapfrog. The second is, the entire process of disease management. That's a very crucial piece. Aligning healthcare more closely to the nuanced needs and expectations of each individual so that disease management could be more critical and critically analyzed is the ultimate goal of anything new which comes into healthcare. So I think if you look at even integrating advanced technologies like learning models, telehealth into traditional healthcare settings, we can significantly enhance patient engagements, outcomes, make healthcare truly personalized, emphatic, as well as effective. So that, I mean, wearable devices like Fitbit, Apple Watches, they've already laid the groundwork for capturing real-time data related to physical activities, sleep patterns, or even stress levels. But the real game changer lies in when people will start understanding the multimodal foundational algorithms that are there when data is there. And these advanced AI systems have a capability to amalgamate multiple data streams, right from your daily step count, which we do on a regular basis, to sleep cycles. The idea is to distill them into actionable insights tailored specifically for disease management. So if that's not there, then we're kind of like not winning the game again. And last, if I would want to say, is the ability to seek appropriate care in clear, comprehensive, and affordable manner. So again, going back to what the government is saying, going back to what's globally, we're also trying to put back as a spielish, affordability, availability, and accessibility still remains the key cardinal for healthcare, even though we have transitioned to AI and wearables. So that self healthcare, if it is not affordable, people will not look at it. If it is not available, how do we make access to it? And finally, if accessibility towards various impediments, which is like data, towards even internet issues and others, if it is not there, then we're just building a mechanism where healthcare is going to be addressed, and not a mechanism where healthcare can actually drive the data and your ultimate healthcare goals and disease management. So I'll stop here, and possibly others could add into this.
Yeah, I think Rajiv, well said. I would like to see any comments from the Harpal Singh on this technology space. Is it enabling or it is complicating the things?
No, it's definitely enabling. Dr. Rajiv Chibber has taken it very beautifully, covering everything. But yeah, definitely we have to see, as previously in previous session, Dr. Ravi Gaur also mentioned that regulation is required, and we have to be the previous privacy of the patient that has to be taken into account. It's a long way ahead, but it is definitely very interesting and very encouraging. It is. I think we have to dwell together. So that's the way forward. I think previous session also mentioned same. So I totally second that. I'll take it further
Okay.
later. Yeah.
Coming back to Dr. Harpal,
I'll also like to just comment on that Apple Watch thing. So basically, it's in good initiative where we have seen an example where Apple Watch has saved a patient's life by detecting the atrial fibrillation. The ECG services of the Apple Watch is actually FDA approved, right? And apart from this, for the elderly patient, it can also detect the fall, right? When the patient falls, and after some time, it's directly send the messages to the emergency care services. So which is extremely good. But still, on the regulatory perspective, we there has some data that Apple has to stop the sales of some of their watches because of the patent infringement case, right? So as discussed in the earlier Dr. Ravi Gaur, also it has to be in in sync with the regulations and the monitoring level. That's
yeah,
what I wanted to share.
very nicely said. I have a question to Dr. Harpalji. how data integration will help in care coordination, especially with Indian elderly patient size growing phenomenally, because we say health, young India, young India. The young India is 20% are old. So I would like to listen from your side, what can be done with regards to the data integration and still add
So,
value.
yeah. So wonderful question, Sudhakar. I think it's a way forward. I tell you, I was heading Apollo Sugar Clinics and also Diabetes Endocrinology Department of Apollo Pan India, and COVID struck, and most of our patients were suffering from lifestyle disorders. I'm citing with this example that people who are listening, they will know it better. So immediately we started a call center, and we had the data integration. We had the data of the patients which were treating our, there were a lot of patients, as you mentioned, one-fifth of the population is elderly now. And I think the people coming to Apollo were almost 50%, those who were elderly. And our call center, boys and girls, they were very well trained. Most of them were dietitians. So they used to call up the patient. They used to tell the entire diet. The patient was so happy. They were so lonely. So not only they were, the problem of which will be taken care of, diabetes and its complication, but the another thing which was taken care of was the mental health. So people were so lonely. Their children were, most of the NRIs, their children parents were here. So also we not only provided the diagnostic help for the patients, also the dietary counseling. Then third part was even the medications were provided. So we had a link with the pharmacy. So we had a big chain, and it can be done in all. I don't want to name an organization, but it can be done all over. So secondly, also see the patients, as you mentioned, elderly. I'm talking of lifestyle. Then hypoglycemia is one big. People can get into hypoglycemic attacks, and people can have a fall. So fall, I think Dr. Rajiv also mentioned, and Dr. Ravi Gaur also mentioned. So these elderly patients, they can have a fall. And that Ravi Rathor, Dr. Ravi mentioned very well about the Apple Watch. But there are various other sensors also coming up now. Various UK companies, because I was part of UK government also for 1 year, and I was working with India and US, UK, and then there were a lot of companies which are mushrooming now, but a lot of them are very helpful. We were working with one technology where our premier institute, All Indian Institute of Medical Sciences, was working along with a company from UK, where the sensor gave a message to the AIMS. And there was a biker who used to run around. It was just for 6 kilometers of AIMS. I'm talking of New Delhi, and we were planning to replicate the same plan all over India in the premier institutes. So we will have some bikers. So these bikers, they will run towards the house. They will do the initial, ECG, and because all we don't have that much cardiologist. So patient has not to go taken to the hospital because of being premier institute. There's a lot of rush also. They are not manageable. People stay lying on the stretchers. So everything was taken care of. It worked very well. So not only spoke about hypoglycemia. So the second is ambulance. If patient requires, if he or she requires any other help, so immediately there is a sensor. Sometimes people are not tech savvy. So again, we have to integrate also, and everyone has to work together, and then it can go directly to. Another thing I would like to mention, NHS, though it's in pain now, but NHS has some good points also. So they have a data which covers from everything from birth of a patient to vaccination, which we are also trying to implement. Mr. Modi and PMO House, they are trying to implement that also. We're trying to integrate entire data. So that will be very helpful. So we will know which patient is suffering from what. There can be provisions, to take a track of that. And like even if the patient requires annual retinopathy examination, the paramedical staff can be sent across to the patient's house, and AI-enabled photograph can be taken over. The photograph can be passed to the center back, and an ophthalmologist can see at his own, time. It is not necessarily that he is being pushed to that. So he has time to see that picture and confirm on that, and then endocrinologist and diabetologist can taper the medications towards upward or downwards. So it's a great help. It's a wonderful thing. I think we have to just see time, beautiful time ahead, and we have to work all together as a team and take it forward.
Very, very nicely said, sir. So this UK model is very vital. If something can be done, and we are, I think, these association can take up, it will be useful. I think there are more technology providers in the market, but only one has to team up to make this happen. Very, very apt comment and suggestion. Coming to Dr. Ravi, I would like to check with you just to bring in the commonly spoken about, which is a wearable market. The wearable market is fastest growing in the world, 7.4 billion in 2020 and expected to be 19.5 billion in 2025. Can you believe? No, it is a phenomenal 40% growth happening year on year. So there is a wider opportunity, and you also stated an example of Apple. Why not? Where the people are connecting everything into mobile and then wearables. So I would like to hear from you. With the technology is increasing, do you think it will help in diagnosis, treatment, probably reducing the hospital stay and manage the holistic health issue?
Yeah, right, Sudhakarji. So we can remember the time when we were only using the digital technology for tracking our footsteps, through the tracking apps and all. But now the era where even the heart rate and the vital signs and everything can be monitored by integration of the digital technology with the sensors, right? So one way we can say that the primary role can be of this integration is for the early detection and monitoring. This all will lead to the reduction of the hospital cost and the readmission of patients, right? So for early detection and monitoring, we can say that wearables plus sensors, we can monitor the vital signs, sleep patterns with more than 90% of accuracy. And this remote monitoring can ultimately reduce the hospital readmission. So we have some data with American Heart Association, which says that this technology integration of wearables and sensors have reduced the hospital readmission by 44% in the heart failure patients. So that's a big reduction of cost and the stay and the health management. Second bigger role is in the chronic disease management, right? We are all about the common example of glucose monitoring, wearable glucose monitorings. So I think that the market cap will go to more than $13.5 billion by 2027. So that's on the chronic disease management front, which has reduced the hospital cost by 16% in next 15 years. So this is the estimate for wearable medical devices, which will reduce the hospital cost by 16%. Third is we have earlier seen, if we are tracking our footsteps, we'll take our own example. We track on regular level that today I have gone to only 3,000 steps. Why not 10,000, right? So it helps in your behavioral modification and the proactive wellness tracking. So that's the simple smartwatch example, and ultimately it increases your health fitness and reduce the overall cost. It helps the healthcare providers for data-driven decisions. We have a whole lot of data, at from the personalized level to the healthcare professionals and the individual. At the government level also, we can think of the mass data which will be generated through these wearable devices. So with better access to the data, we have the geography and demographic based monitoring. The government can have a geography and demography based monitoring, which will ultimately helps the government and the policymakers to design and implement the particular healthcare programs and the related policies, right, which will ultimately affect at the national level. So these are some of the use where one more examples are like for specific applications where the wearables can be a type of sensors will be integrated like EKG sensors, so you can monitor the heart activities also. The Apple smartwatch examples we have given, for pre-detection. Then the best giant leap in the digital wearables, we can say the implant based wearables like the Neuralink, the brain chip, which will be developed by Elon Musk, right? So where we can actually detect and diagnose and control the Parkinson disease, the patients with Alzheimer's, we can boost the memories. So this all will ultimately reduce the hospital readmissions and the healthcare costs, right? So with proper regulations, we can readily, we can be made use of these technologies at a better level.
I think well
Thank you.
said. Very comprehensively data. So wearables measures the vital and clinical grade screening. It is started with skin temperature, respiratory rate, pulse rate, oxygen saturation. It's going, beyond. It's older saying, no, the health is in your hand. So one self can say, yes, my health is in my hand. So very, very well said. I think let us now shift gears to Dr. Chibar. My question, Dr. Saab, will telemedicine enable a quicker quality treatment? Do you see any area to be addressed? Because this is a new arena, there are maybe pitfalls, there may be an opportunity for a course correction. Look forward to hear from you. So we are unable to hear.
You're on mute, Dr.
No,
Chibar.
I'm on mute. Sorry, I was on mute. So, yeah. So, I think we've already witnessed telemedicine in the last couple of years, and post the pandemic, everyone has at one point of time within his or her household seen how telemedicine has helped him or her or their kith and kin otherwise. But I think, and in fact, even the Ayushman Bharat Digital Health Mission has now done a lot in terms of telehealth, which is available through health and wellness centers, through the Arogya Health program that is there, the Arogya telehealth program, etc. So possibly telehealth does have enough, bandwidth. It's just the problems that need to be fixed, the solutions that need to be oriented. These challenges are something which everyone understands. Look at the kind of country that we are in right now. The bridging urban rural healthcare divide is huge. I mean, the lockdown has given us that entire uh, the picture that we saw during the pandemic. But telehealth consultations in remote areas at that point of time were not to the optimum level. People did not know whom to call. People did not know where to call. The systems, the numbers, the kind of sites that were available in remote areas were physically not accessible to people. What was the idea? I mean, virtual consultations could save money, could save efforts, could have less people, could declutter hospitals, could declutter your Ayushman Bharat centers, but it did not help it. I mean, even traveling long distances, people literally had to do that. So I think the first thing is that we need to see how telehealth can actually bridge the rural healthcare divide in a country like India, because it's becoming more important to reach out to people now. But if we have restrictions, then that is going to be a huge challenge. The second thing is insufficient, technology infrastructure that we are facing. WhatsApp is not the technology that people are looking at. And obviously, WhatsApp has now become the biggest telemedicine university wherever we go. So, I think we need to move away in terms of the looking at the unavailability of basic technical infrastructure, such as smartphones down the line. Even I would bet even your and my maid, or the driver, their phones are not even that enabled that can actually garner them that kind of um, health technology benefits. So I think insufficient technology infrastructure is something that we need to look at. Although we boast that India has got these many of connections, internet is widely used. We almost have like 1/4 of the global population here in India trying to use all of this, but it's not found efficient enough. The other thing that we need to really look at is the possible, clinical judgments out of these consultations. Those people are not able to comprehend. It's a big impediment in terms of whether you look at the disadvantaged populations largely. Even in the cities and the peri-urban areas that we're looking at, I doubt whether people would be able to comprehend that kind of digital advice that is being given to us. That brings us to a next level, which is called the technology illiteracy. So we've seen, and right now, Harpalji and Ravi both discussed about a major fact that the elderly population is becoming bigger by the day rather than the youth population. And Sudhakar, you also mentioned it. But the familiarity with video calls, the familiarity towards technology enablement is still not there. And, people with poor motor hand skills are faced with more difficulties to use these kind of technologies. So that's a big impediment. Another problem that comes is during telehealth, and this is virtually what I have faced in my house also, is the lack of physical examination sometimes does not give you a justifiable patient solution. So, so it may not always be suitable for patients to, show their entire body towards a particular screen and be able to give them symptomatic issues. That is a huge impediment in terms of giving the right diagnosis sometimes, and that leads to wrong treatments also. So disease management becomes a big issue. Again, there's a limited patient provider relationship also. In how does the provider follow up? How does the patient follow up? The patient would at one point of time just think that, okay, the call's disconnected, that's it. Maybe, there's a subscription that comes. If it doesn't come, where does he call back? He will have to do that entire telemedicine activity once again with possibly a new doctor. And you're facing these difficulties. Then there is lack of experts. I would feel that trained radiologists, we're not talking about doctors sometimes, trained radiologists or others who could, look at well-versed MRIs or EEGs or ECGs, etc. If they are not able to share their perspectives to the treating doctor at the simultaneous point of care while you're having that telemedicine, call or a video call, it's not going to help anyone. The specialist expertise level needs to really move up. And the final part, when you talk about impaired, is the data security and privacy part. And we've been talking about it in various associations. Sudhakar and I have very vocally also talked about how although technology infrastructure is available, but data security, privacy are major challenges to telehealth. The patient provider apprehension about data confidentiality that needs to be worked through at a war footing. There is no option to know if the mobile health application developer has taken necessary precautions to ensure the privacy and security of the application against any malicious attacks, any seepage of data which goes and ultimately has patient safety issues also, or privacy issues, personal history issues. So all these are there. And the last is we do not still have a robust legal framework for all of this. We may be using telemedicine, but the potential risk of legal and medical legal implications still lurk around. So I think while telemedicine has its advantages and it's really reduced the number of queues down the cycle, but then if we look at these 6-7 odd areas, telemedicine really needs to spruce up.
Well summed up, Dr. Rajiv. I think you have covered everything, and that whether cybersecurity, telemedicine issues, and positiveness. I think this is the way when new technology comes, one has to be taken care of. The doctor can prescribe whether something happens, adverse event, who will be responsible, etc., etc. Yes, but everything has a teething problem we need to take in such a vast country. Now, let us shift to Dr. Harpal. Sir, with these all these technologies, there is a very interesting phenomena happening with the common man. They also tend to be now proactive and rather reactive. No, see, they are themselves coming to the doctor and asking, "So, Doctor Zabek, I think I would like to go for a health checkup," which was not happening. Maybe it's a corporate or even a common man who is earning maybe just 1,000 rupees per day or 500 rupees. So what do you see? Will it be will it be a good scene, or how can we take it up and then make it in a scale?
Yeah, so I will start where Dr. Rajiv mentioned. He mentioned about human touch. Understandable, and there are many stumbling blocks. But going forward, it's exciting times and very interesting times. Even Dr. Ravi Rathod mentioned about CGM. Now coming to CG, I'll take it from CGM and then take it to other things as well. So CGM is a wonderful thing, but then there are hundreds and thousands of companies floated now. They're saying, okay, get your diabetes reversed. The gimmicks going around in social media. If you open social Facebook or any other social media, there will be a lot of companies which have say some of them. See, if we go as per data, as per endocrinologists and diabetologists, all the cases can't be reversed. So reversal is very minimal. Remission is the one thing which can be done, and it's way forward. And but then CGM is again it's a game changer. And Dr. Ravi Rathod mentioned about the commercials part also of this. It's a game changer. And truly, we mentioned about Apple Watch. Accordingly, we can also save patient from MI and hypoglycemia. I already mentioned that. Going one step further, now there are devices which we can take it to home, like for peripheral vascular disease. So earlier we didn't had it. In just 5 to 10 minutes, just a small technician who can or healthcare worker who is trained on it, he has to add the cuffs to the patient and he can get the data. And now the challenge is we have to find the sensitivity and specificity of the product should be good. There are various Indian companies who are doing it very well. There are international companies, they're working very well. We used to use as a medical student, I used to use as a tuning fork, and other heat and temperature. We have one device, everything related to peripheral neuropathy. So everything can be taken. You mentioned, Dr. Sudhakar sir, you mentioned about diagnostics. So people are not only diagnostics, rest other many examinations can be done at your home. And it's a wonderful time going, so having said that. And also one thing is important, that medicine is changing. Earlier in diabetes, I'm a diabetologist myself, though I'm into management now. So there were only one or two drugs. Like we started with metformins and sulfonylureas. Sulfonylureas we had a class. Then DPP-4 came. Then came SGLT2. It was a game changer. And I tell you, uh, insulin is called miracle molecule of the century, whereas now these are called miracle drugs. At least they can, if a person has, supposingly we calculate everything and person has to drive 5 years down the lane, it can be extended to 10 years without any complications. So CHD, chronic heart diseases can be saved. CKD, that can be taken care of. So these drugs are doing, with data, these are scientific drugs proven. Now, Government of India has done a beautiful thing over here. I would like to mention and appreciate our government. So even though I was part of AstraZeneca and it was a loss to AstraZeneca, so but anyways, it was a benefit to the people of India. The price of dapagliflozin was reduced from 60 to 15 rupees, so everyone can buy it now. Earlier, it is called GLP inhibitors of the developing countries like India. So it's amazing because GLP inhibitors, they are injections and they can't be affordable to each. So affordability is another part. So exciting part, and people are proactive now. A lot of things can be saved. Even I'm talking of complication of diabetes, retinopathy, it can be saved. So if patient has started developing retina changes, we can tighter the doses and it can be taken care of. Podiatric care, if we peripheral vascular disease, peripheral neuropathy, also the heart changes. So heart failure is another thing which was not available. We have biomarkers now. I just sorry, I didn't talk about the biomarkers. They can down the lane they can find out. I think Dr. Rajiv Shibbar is from the same, right? So he knows better than us. And anti-pro BNB was there, and it was not. So it is being used very nicely now. There are companies, pharma companies supporting it. Government is supporting it. People are also aware, and then we have to collaborate and integrate everything, which includes devices, digital, as well as the newer medication. And then, as a team, I earlier also mentioned, as a team, we can do a lot of things. People are educated, people know it. Some of them might not be tech savvy, but then we can, use other sensors, we can use alarm systems. A lot of things can be done. So it's a wonderful, exciting, proactive health is the way forward, and we're looking for it. I'm very excited. personally.
I think it's very, very inspiring in information and very. I think if all of us join together, the world will change. I think. Yeah. Please, please. Yeah.
One thing I will like to change the current innovation where I'm working now. So this innovation is also very exciting. Let's briefly mention about it. So it is a device which we place in the. I think Dr. Ravi also mentioned about devices and Dr. Rajiv Chipra also. So this has to be placed in duodenal bulb. It goes down the GI tract. It mimics gastric bypass surgery. Can you imagine? We are working for this for 19 years, and it can help reduce 30 kg of weight and manage diabetes. There are cases where it has already been on 3,000 to 4,000 patients across the world, and there are cases where insulin was taken off the patient. So exciting times. We will discuss more on this. We will move to next round. Thank you.
Thank you. I think we are coming to the end, but our last question to Dr. Ravi Rathod. With more digitalization, there is a threat of data management. Some of them already dealt by Rajiv Chibaji, but I would like to ask you, what's your thoughts on data management, cybersecurity, data protection? Because data privacy bill has come, still we are a long way to go in India. We are excited to handle so much of data. Are we ready? I don't know. So in the healthcare space, we should be careful. I would like to hear as an expert, Dr. Ravi.
Absolutely, Sudhakar ji. Everything comes with a responsibility and their own challenges and limitations. So we have gone through the the user's perspective of this digital technology, how it is helping reducing cost, able to manage the individual health, and able to help on managing and design and strengthen the government healthcare programs. Now, talking about their challenges and what limitations we can have, it's like the patient securing the patient data, as you have mentioned. So we have HIPAA and SAMD guidelines regulations by FDA. Now I think SAMD is also included. We are trying to implement with the CDSCO, and software as medical devices will be also coming up with a big level with the new PRIP scheme. So this these guidelines, because of these guidelines, now patient privacy is no longer an option, but it is a mandate now, right? And what are some strategies through which we can secure this? Is like, first is the data encryption, right? So at the rest level and in the transit, it should be significantly reduce the risk of data breaches if the data is encrypted. Then the regular audits, we can identify the potential vulnerabilities and we can address them immediately. And the user authentication. So we have seen the user authentication at every level, but it still needs to be, the robust authentication protocol should be there. So that's on the security of the patient data front. Second, how we can ensure the accuracy also, accuracy and reliability of the wearable technology, because we are dealing with the patient data and a large mass of data, right? So if we can get any inaccurate data through those devices, that might uh, get the doctor misdiagnosed or to provide the incorrect treatment, right? So that's potentially endanger the patient's lives. So what the manufacturer can do to address this is we can say the calibration, right? So regular calibration of those devices. Second is the quality control department, the rigorous QA/QC process they needs to follow with high standards of precision. And third is clinical validation, which Sudhakar ji, you also mentioned, to confirm their accuracy in the real world. So those are on that front. Regulatory compliance also they needs to meet, wearable health medical devices and sensor must meet a robust regulatory standards from safety certification sites. The other challenges on the manufacturer sides are these are the high-end devices. Some of the devices are priced out of the reach for average consumer. So when Dr. Rajiv Chiba talked about the affordability and accessibility, so this high-end devices limit their accessibility to such consumers. So manufacturers need to strike they need to strike a balance between whatever their offering is with regards to the advanced and featured medical devices, with regards to maintaining the affordability and to ensure the broader protection. Apart from that, we have already discussed about the technologies and the government protocols, the upcoming technologies like blockchain and all to secure the data breaches. That's from my side on the security front.
We are exactly on time. I think we touched a vast in a matter of 45 minutes with the expertise from Harpal, and I think this is an opportunity with when you have so much of expertise. You can speak volumes. I think we touched on wearables, data integration, empowering individuals with a health shift from proactive, reactive, telemedicine, digitalization, and data management. With that, I think I would like to hand over back to Alisha. First of all, big thanks to Dr. Harpalji. In spite of his busy schedule, he has taken up this opportunity to express his the expertise. And Dr. Ravi Rathod, always helpful and connecting the dots among the technocrats. And Dr. Rajiv, a policy shaping expert and then a technocrat himself. And big thanks for spending your time and sharing your thoughts. I think all this will enable. I think we have to collectively work together to make this world better in health. Back to you, Alisha ji. Please take it further.
Thank you, Sudhakar sir. I guess this was a very interesting session, and I would also like to highlight that this was one of the most watched session. We had almost 698 users watching us live. So kudos to everyone. Now we'll be disseminating for lunch, and we'll be coming back at 2 o'clock for our next keynote session.
I would just like to thank Sogat and entire WWF team and also our moderators, Sudhakar and co-panelists. Thank you so much. Thanks, everyone.
Thank you.
Thank you. Thank you.
Thank you so much, Sudhakar ji. Thank you. Thank you, Dr.
Bye.
Chibber. Thank you. Bye-bye.
Thank you.
Good afternoon, sir.
Good afternoon. Am I audible?
Yes, sir, you are.
And am I also visible now?
I'm sorry?
Am I visible also?
I'll be not. Good afternoon, sir.
Good afternoon.
Okay, I can see you now.
Good afternoon. Am I audible?
Yes, sir, you are.
And am I also visible now?
I'm sorry?
Am I visible also?
I'll be not. Good afternoon, sir.
Good afternoon.
Okay, I can see you now.
Good afternoon. Am I audible?
Yes, you are.
Alicia ji, was there an echo?
Yes, sir, there was. So your session is going to start at 2:15.
Yes, yes. Yes, it's 2:15. I just wanted to see if I could meet the panelists because I had requested them to come like 10-15 minutes before time, no?
No issue, sir. So we are just going ahead with the keynote, and then you'll be able to speak with the panelists in the chat box.
Yes, and also this background, is it looking a bit funny because the frames of the photographs are visible?
Let me just call you, sir. Good afternoon, everyone. Away Health presents World Digi Health and Wellness Forum 2024. We have our second keynote session with Ms. Urvasi Prasad, Director, Office of Vice Chairman, Niti Aayog. Welcome, ma'am.
Yeah, hi.
Hello, ma'am. How are you, ma'am?
Good, thank you.
Ma'am, I will request you to kindly go ahead with your 1 minute introduction so that our audience knows about you, and then you can take it forward.
Yeah, I'm director at Niti Aayog. I'm working with the Office of the Vice Chairman currently. And I have been at Niti now for almost over 7 years, close to coming up to 8 years, working in the mostly in the health policy related areas, but also other sectors. So yeah, I think, today I just wanted to, because this is a digital health summit, so I wanted to touch upon the digital health aspects. And just to say that, of course, as you would have been also discussing, and I'm sure the speakers will also talk about this, that we've seen a huge acceleration in the adoption of digital health and technology, especially in the health sector during and post-COVID. So that is definitely a momentum, that we have achieved during COVID, but we need to sustain it. That is, one big challenge which is facing all of us. Because there is a danger that, the things that we learned during COVID or the innovations that we made then, we're always in danger of, letting go of some of those learnings and then again, reinventing the wheel. So we have to all collectively try not to do that and make sure that we build on the learnings that we had due to the COVID pandemic. Now, of course, about digital health and technology in general, I would like to, say that it is a very important means to an end, but it's not the end in itself. I think sometimes we run the risk of getting carried away with technology, with getting very excited with the new terms that we all, now live with in AI, and now there's generative AI, and there's blockchain, and there's IoT. So, it can all feel very exciting, and we can sort of get carried away. But I think it's important to remember that our ultimate goal and objective, I think, of all stakeholders in the health system is obviously to achieve affordable and quality health outcomes for the entire population. And that is really what underpins universal health coverage. So we need to see how technology can be a means to achieve that end, but it's not an end in itself. We also have to be aware of the risks and the potential downsides of technology, especially when we are dealing with it, in a sector as sensitive as health. And I especially talk in the context of health data. If we are using technology and we are using that for standardizing or aggregating, data or integrating data, it can be hugely beneficial, but we have to have the adequate privacy, security, safety protocols, ethical protocols in place, because large parts of our population are still, not at that level of literacy and education where, they might be very comfortable with this sort of advanced use of technology and their personal health data, which, as I said, is very sensitive. So I think we need to use technology, but use it responsibly. And I think we are still in that process where we're trying to put in place the standards. We're trying to, lay down the basic frameworks and guidelines, which can then be adopted and by all stakeholders. And of course, we also raise this issue of responsible, ethical technology use, AI use during our G20 presidency, because clearly this is a global issue. This is not just specific to India. And we've already started to see some cases of misuse of technology. So I think that is something that we have to be very careful about. Also, use of social media, for instance, in the health sector. I especially feel concerned that we have this, growing number of so-called influencers. And now everybody seems to have some sort of expertise on health or nutrition or lifestyle. And I think while it's good to be able to share your own experiences, your own lived experience of something, I think to start to give medical or health advice, if you're not actually qualified, is very dangerous. And we're seeing this huge trend with the social media and the influencers. Some of them have millions of followers, and they're actually putting out very unverified, sometimes even completely incorrect information. So I think there's a lot of risks, downsides, which we have to be aware of in the health context when it comes to use of technology. But clearly the potential and the advantages are tremendous, right from improving the efficiency of the health system, so reducing the load on our medical professionals, on our health professionals. There's so many tasks in the health sector which you can automate or you can make quicker, you can make faster. Of course, as we move towards personalized medicine, then there's huge, benefit of technology where, through artificial intelligence, you can go through somebody's entire health history, their records. You can see what sort of treatments are likely to work best for them, what is not going to work for them. So all of these can be very important aids and assistive, tools for our health professionals. And so I think that is one very important use of technology. Of course, better, faster diagnostics. And we're already seeing AI being used in a big way, whether it is to screen people for TB or for lung cancer, and many other applications are coming up. So use of technology in medical devices, in the entire pharmaceutical, clinical trials value chain. What used to take a longer amount of time, we can now achieve those results much more quickly because we can use technology. So I think huge benefits, upsides, but we must be aware of the downsides, the potential risks, and we must make sure that we use technology ethically, responsibly, with the proper standards and governance mechanisms in place. And technology is a very important means to an end, but we should never forget the end itself, which is really to achieve universal health coverage, which is to provide the best possible health outcomes to every person in our country, regardless of their location, regardless of their socioeconomic status. So I think that is something that is really what we have to ultimately keep in mind, the overall use of why we are even deploying technological tools. What is the overall purpose of that? So I'll stop here, and I wish you all the success for this summit. There's a very interesting lineup that I saw of speakers and panels, etc. So I'm sure there will be some very good insights which will be generated from today's discussion. So thank you once again for having me here.
Thank you, Ms. Prasad. It was really insightful, and thank you for sharing how technology has taken over in the medical system and how people are educating themselves through our social media platform. Very interesting to know what trending things are in the market. Now, we'll be moving on to our next session, which is the panel discussion 4. The topic of the discussion is global health equity, bridging the digital divide for inclusive digital health solution. In this session, we will primarily be talking and addressing the disparities in the access to the digital health technologies and explore the strategies for overcoming challenges related to the socio-economic factors, geographical location, and diverse healthcare system. Discuss how to ensure that digital health innovation are accessible and beneficial to all, regardless of all their background or location. This session is being moderated by Mr. Achisman Mohapatra, who is Executive Director at Grid Council. Welcome, sir. Our panelist, Dr. Sunil K. Ketrapal, Director, Association of Healthcare Provider, AHPI. And along with him, we have Mr. Puneet Daya, Founder and CEO of Traxova.
Hello.
Welcome, sir.
Hello, Ms. Alicia. Thank you so much for the kind introductions and for introducing the audience to our session and also introducing us to the audience. Thank you for having us. My regards to Mr. Saugat, who has been the brain behind this session. And my hello to our expert panelist, Mr. Puneet Daya. Thank you so much, sir, for joining in.
Yeah.
Saugatji, any opening remarks from your side before we get started with this panel?
No, I guess, Asima, you can take it up from there. I think it's great having all of you, Puneet, all you on the same platform, in the same dais. And I think it's a wonderful opportunity wherein we can discuss and explore many of those things, probably, as we were hearing from in the past sessions, things which probably are a myth or a reality. I think this platform actually will open up all those dimensions. It's really great to have all of you once again. Thank you so much. Please carry on.
Yes, thank you. Thank you for having us for this panel. And I had a chance to listen to what Dr. Urvashi Prasad was just sharing, and very, very, very contextual insights. And that actually sets a tone for today's discussion. And now, if we look at the digital health landscape in India, we are into some very interesting times. On one side, we have a lot of health tech startups coming up, fantastic ideas, trying to solve problems for a country as populous as ours, like 1.4 billion people, and access being a definite issue. And trying to integrate those solutions into the system, both public and private, and at different levels of the health system. starting from primary, right in the community, and also right into the hands of the end user. So patients into self-monitoring, to all the way to tertiary and quaternary healthcare setups, and further integrating those data points to inform policy decisions. So quite a bit of transition that our country is going through. And on one hand, when we have these kind of health tech enthusiasts into startups, we also have the government responding to it through Ayushman Bharat Digital Mission, which creates an ecosystem. And we have stakeholders right from governments, regulators, healthcare providers, individual providers, NGOs partnering there. And then again, we have challenges as well. How do we make these kind of technology more client-centric, more patient-centric? How do we ensure that our people, which is at times digitally not as literate, adopt these technologies and still make the most of it while ensuring that their data is protected and privacy is maintained? Uh, Quite a bit of discussions we have going forward, and I welcome my panelists, Mr. Puneet Daya and Dr. Sunil Khetarpal. Let me introduce Mr. Daya, and I'd also request Dr. Sunil to switch on his video. Yeah, I could see you, sir. Hello, sir, and welcome to the panel.
Hello. Hi, Dr. Mahapatra. How are you?
Good. How are you, sir?
Yeah, good.
Right. So I was just about to introduce our panelists. Let's start with Mr. Puneet Daya. He has a very niche area for himself, like 24 years of international travel technology, and now he's into ensuring like people who are looking for experiences which incorporate travel and wellness, and making them meet people who are able to provide this kind of an experience. Mr. Daya has built the IT landscape for the 6th largest travel company in the world, and that showcases his leadership and innovation. He has collaborated with colleagues from 30 different nationalities and has a deep understanding of this sector, the global travel landscape. And he's passionate about leveraging technology for the betterment of global well-being. He founded Trexova, a digital platform that aggregates and distributes wellness holidays and activities. Welcome, Mr. Puneet. Can you just like briefly give a deeper understanding about what exactly is this concept of Trexova and how you're making it go big?
Yeah, I mean, thank you, Dr. Achesman and Dr. Sunil and this panel for arranging this wonderful session. So it should be insightful and, of course, good for humanity, creativity, everything. So basically, if you understand this global landscape, then more than 800 million holidays were wellness holidays were taken last year in 2022 alone. So it's a big segment already, and it's a very large. People are caring for their health and well-being, especially after COVID. Even the need for preventive healthcare is also very important, just like breakdown maintenance and preventive healthcare. So that's where we kind of try to look into what the gaps are when people, on one side there are a lot of good quality wellness providers. They have excellent products and they can help people in so many ways. And on the other side, we have so many consumers looking for personal and mental well-being. The issue that we realized is only the connect. So, and moreover, how to fit the need or how to align the demand versus the supply. Because supply has so many things are available, but you don't know what fits you, what you need, when you need. And so all those very easy to search platform, of course now digital is the era, so that's what we are looking for. So we have kind of solved both brought both the dimensions into one platform, where we have built a SaaS platform for holiday providers and activity providers, where they can come in, sign in for free of cost, and they can list their wonderful packages. Of course, we have criteria to authenticate them. And then, consumers can go in with their purposes in mind. Of course, everyone has their own purpose. So health and wellness, and then they can go in with their own mind. And we are so far getting a very good response. Like we have more than 1,800 holidays in 20 countries, and covering 60 plus purposes of life. Various purposes covering 30 plus experiences. Yoga is just one. There are so many ways to get healthier, and of course we have more than 2,100 instructors all over India in all big cities. So that's what we're trying to digitally convert it and make a contribution in global well-being.
Quite an innovative field, I must say, very new to explore in the Indian context, and you are already into the international arena. We'll want to know more about your experiences. Thank you for giving us an introduction into Trexova.
Sure.
I would take this opportunity to welcome our other panelist, Dr. Sunil Khetarpal. Dr. Khetarpal has over 30 years of experience in the healthcare industry in different institutions and majorly in leadership positions. Currently, he is the director of Association of Healthcare Providers India, and this is a non-profit organization that works with the government, regulators, and different stakeholders with an objective to ensure universal health coverage. Now, HPI represents majorly, it's most of the private healthcare institutions in the country that come under the umbrella of HPI. Dr. Khetarpal has been in leadership position in many premier institutions before this. So he was the Chief Operating Officer of Rajiv Gandhi Cancer Institute and Research Center in Delhi. And besides, he was also in leadership position at Delhi Heart and Lung Institute and Indian Spinal Injury Center. Dr. Khetarpal, most welcome to this panel.
Thank you.
I'd also request you to give us some kind of briefing about AHPI and your experiences with it.
Well, first of all, I would like to thank World Digital Health Forum for giving this opportunity to be here on this panel discussion. And I would also like to thank Dr. Ajisman Mohapatra, our moderator, and my co-panelist, Mr. Dahiya. Well, regarding AHPI is Association of Healthcare Providers India. As you briefly mentioned that we are a not-for-profit organization registered as a society, and we represent the majority of the private healthcare institutions in the country. We work with an objective to, basically we work with the government, with the regulators, and other key stakeholders with an aim to achieve universal health coverage, that is accessibility, affordability, acceptability, availability, and to achieve comprehensive health security for all in the country. And we are, over the past 11 years, because the AHPI was founded in 2012, December 2012. So we just completed our 11th anniversary. And over the period of 11 years, we have grown steadily in strength and in recognition to become India's largest representative body of healthcare institutions. And we have a combined membership strength of, say, over 20,000 hospitals, because hospitals are our members, and healthcare providers across the country. In fact, we have created 20 state chapters because health is a state subject. So we have 20 state chapters, and each state chapter has an empowered executive committee with the president, vice president, secretary, and 8 to 10 executive committee members. So we educate them, we engage them, and we empower them because they have good liaising with the local state authorities and the state ministry. So that's why we have created chapters. Not even that, we have gone beyond that. Some of the states becoming which are very big, I mean state like UP, Haryana. So we have created some sub chapters like Haryana, Faridabad. We have created a sub chapter. So and then convener for that sub chapter, and also registered as a separate society. So they are maintaining a separate account. So this is how we have, over 11 years we have expanded. And I would also like to mention here that the role of HPI, we have in fact transformed the healthcare landscape in various accolades and contributions by lobbying with the government, and we can by conducting training, capacity building for our member organizations, and also promoted knowledge sharing through our conclaves, and we have our publications, and of course we have liaised with the and supported the government. We work very closely with the government. We support the two flagship programs of NHA, Ayushman Bharat and ABDM. And during the COVID also, we have actually done a great work during COVID. We had to collaborated with various national and international bodies. So this is what we have achieved, and our key successes, which has created a far-reaching impact across the nation in the area of policy and advocacy. We have public-private partnership, training, capacity building, and we have various impactful publications. We have more than 50 impactful publications on various topics, which are not relevant only for our member organizations, but for the healthcare community at large. COVID-19 crisis, I already mentioned that during the pandemic, we created a national working group on COVID comprising of various other HPI, IMA, CII, FICCI, SOCHM, NetHealth, all these industry bodies. And we promote technology and use of technology among our members, quality, NABH accreditation. So this is how the HPI has evolved and what all work we are doing.
Right. So thank you so much, Dr. Keturpal, for giving us an idea about what HPI does. It is so exciting to see that we have one panelist who gives a very global breadth, and the other panelist gives a very deep penetration into Indian context. So quite a well-rounded panel we have, and going forward, we would want to know more about your experiences. So just continuing our conversation with you, Dr. Keturpal, I'd like to request you to reflect on your 30 years, more than 30 years of career. How do you see health tech or digital health technologies evolving in the Indian context? And what are your impressions about it? What are the challenges or strengths that you see?
Well, certainly over the past 2-3 decades, digital health has undergone, I should say, a remarkable evolution, driven by the advancements in the technology and changing healthcare needs and shifting the regulatory landscapes. So I started experiencing the digital health transformation since 1990s. If I walk you through my experience, I think I should go back to my medical college days in 1980s, early 1980s. One of my classmates, he was my roommate as well. He had a pain abdomen, and he consulted a surgeon who advised him ultrasound of the abdomen. Those days, in the whole of, I did my MBBS from Andhra Pradesh, from Kurnool Medical College. And those days, there used to be only one ultrasound machine in whole of the state, that was in Osmania Medical College, Hyderabad. And my classmate who was advised this ultrasound had to travel to Hyderabad about 300 kilometers to get the ultrasound done, right? So that was the early 1980s. And then, of course, late 1980s, we saw the first CT scan. After I graduated in 86, then MRI scanner was commissioned. First MRI scanner I remember was commissioned in MAS in Delhi in 1986. Then came in, if you come to 1990s, what I saw was the first mobile phone we all know, which came in 1995, Motorola. And during the same time, the first pager mobile phone also came to India. And I remember I used to feel very proud, using the pager. And then in late 1990s to early 2000, I should say, I saw the emergence of electronic health records. I remember I was working with a corporate hospital, Max Healthcare. I joined in 2001. And, I saw the, use of there was a very basic electronic health records, which was, you can say, the digital version of the patient's paper charts. So I was quite fascinated by this transformation while working with a corporate hospital. And not only that, I became an EMR champion those days and used to train doctors, including the senior consultants for EMR. And the doctors, they used to give e-prescription, and they could store, retrieve, and update the patient information more efficiently. So even we used to audit for the compliance to EMR by the doctors. Our compliance percentage we used to see of each doctor for use of EMR. Then I think in mid 2000s, I should say 2004, 2005, we could see, telemedicine, which gained traction, and, remote consultation via video conferencing, and particularly for the patients which are in the remote areas, in the rural or underserved areas. Then in 2000, I think late 2000, or you can say in early 2010, there was mobile health apps, which we saw in the healthcare, and the proliferation of smartphones. We all know that how it proliferated, and the mobile apps, which actually revolutionized the healthcare delivery mobile mHealth apps, and there's symptom tracking, fitness monitoring, and access to the healthcare information. And in mid 2010, 2014, 15, we saw this integration of wearable devices, contact devices, and remote monitoring, which became very popular, and which also enabled us, the individuals, to monitor the health metrics they were monitoring, and with heart rate, activity levels, and sleep patterns. So this was an era of remote monitoring solutions which emerged, allowing the healthcare providers to track patients' vital signs and chronic conditions remotely, leading to more proactive and personalized care. And then I remember 2006, I was with Rajiv Gandhi. That time, my first stint in Rajiv Gandhi as a medical superintendent. So I joined in 2016 again as a CEO. That was my second stint with Rajiv Gandhi. In 2006, we saw this Da Vinci robot, which was installed in AIIMS Delhi. The first robot in the country came in 2006. So, and then now you see there is no end of these robots. I think every big, large institution, even secondary or tertiary care institution, you will find robotic surgeries being done. Then let me now come to late 2010, I should say, 2018, 19. Now what we have seen is artificial intelligence and predictive analytics. These were the advancements which have played a significant role in healthcare, and AI-powered tools are developed for image interpretation, risk prediction, drug discovery, and personalized medicine, and of course, among many other applications. So 2019 to 22, what I have seen personally, during the COVID pandemic, of course, COVID was a big, it brought a major transformation in our country as far as the healthcare digital domain is concerned. And the use of medical technology and digital health in India was revolutionized and accelerated the adoption of digital health solutions. Not only in India, we all know it was worldwide, but social distancing measures, because it necessitated us, it forced us to remote. Telemedicine also became legalized during COVID. It was in March 2020. We saw the unprecedented growth, with many healthcare providers rapidly implementing virtual care solutions. And I remember, during COVID days, you were confined to the room, confined at home, and using various virtual platforms, and a lot of webinars where they were in full swing. And of course, during COVID, again, you can remote patient monitoring, telehealth platforms, digital health tools for mental health support. It all experienced increased demand, and there was a lot of innovation which has happened during the COVID. Flagship program of the National Health Authority, that is Ayushman Bharat Digital Mission, which was launched in September 2021 with a vision to create a national digital health ecosystem. And we all know that how it has revolutionized healthcare, where it is offering unique health IDs and digital health records for seamless patient care. And it is like, the ABDM is now picking up like anything. And secondly, in just recently, maybe 2022, 23, we have seen the continued innovation which focused on interoperability. So digital health landscape continues to evolve rapidly with ongoing innovation in areas such as remote patient monitoring, AI-driven diagnostics, digital therapeutics, and blockchain-based solutions for data security and interoperability.
Thank
So
you.
looking ahead, I think what I would like to mention here, yeah. So it has
Yeah.
all, led to improved access to healthcare and enhanced patient engagement. So there's a great transformation which has happened.
Yes, quite a bit of journey that we have done as a country. Yeah, as you narrated, it almost felt nostalgic to see the sophistication with which the health systems have evolved in our country, trying to provide the best state-of-art services to care seekers. On the other side, we have also seen that along with the sophistication within the health system, there is a much of sophistication within the clientele that we're catering to. The population has become more and more health aware. Previously, it was majorly trying to seek therapeutic services, but now a whole wellness industry has also emerged where people are more and more conscious about their wellness. And there is business around it as well. As we could see, Mr. Daya is already working in that area, trying to make the seekers and providers meet. So I'd go to Mr. Daya now. Sir, you have been trying to understand the need of this particular population that is seeking wellness experiences, and you're trying to provide I guess it's customized digital platform-based services that you're trying to provide. Can you just walk us through your experiences as to what exactly these people are seeking and where is the trend going from here?
Yeah, so basically, if we generalize our target audience, so what we are catering to basically, then people who are living in big cities and they are having a lot of competition, stress, all those sort of things. So with this, people living in big cities now, of course, they are looking for health and wellness, especially as Dr. Sunil mentioned that after COVID, there's a lot of consciousness which is going towards preventive healthcare as well. So health has to be better, of course. So from that point of view, that's our target audience. And when we talk about this target audience, then the trend is that the world is getting more and more competitive day by day. Life will continue to become more and more hectic. Families will become shorter and shorter. Social connectivity will become less and less. So all those things are, we all know that this is going on. So then the issue comes that, how and what they should identify, what is their need. And that's when we are, trying to collaborate with holidays, is that when they're going on holiday, then generally you can say that people want to go on holiday to relax. So it could be a simple mechanism. And generally they have a destination in mind that, okay, I want to go to this destination to get some relax. But the moment they choose destination, then the problem starts because, you should focus on your purpose. So for example, I can just say that relax means for someone, it could be sleep wellness, because that's a very common way of addressing, everyone, very busy and hectic lifestyle. Sleep is, very difficult these days. And so sleep wellness could be, one of the need that someone may be having. Then the idea is what we are trying to do is, okay, for sleep wellness, then what you should tell us that I want to go for sleep wellness. And then platform will tell you where you can go for sleep wellness, what are the packages. And then you look at destinations, you look at your budget, you look at your, whatever needs, fits, etc., etc. And then a typical sleep wellness package could be that you go on a retreat. They do some diagnosis, assessment, and then they identify that, okay, this could be the points. And then they have the recommended diet for your duration. And then they give you some recommended yoga, meditation, all those sessions, and then maybe massage as well. And then they basically get your sleep into a natural sleep wake up cycle. So rather than so idea is that you should get yourself normal. And then comes some maybe some seminar or some kind of tips and tricks also they can provide, which you can use in your daily life. And when these people come back after having their basic things sorted out, then they are much more equipped, that they know how they can improve their sleep, what issues are there, what are the activities they can do in their daily life. So holiday is not just about going and spending time or looking at the world. So it's also changing, needs are changing, because world will become more and more competitive. That's how big city life is, and we cannot move away from that reality. So for example, then comes because when you come back from your daily life, then you need to be more equipped. So if you see mankind, then our life was never so hectic. It's only the first time in the life. Maybe if you look 100 years back, then life was not that hectic. Maybe 20 years back, life was not that hectic. But now it has changed, and it continue to changing. So we have to learn to live with it, and then adapt new ways and mechanisms to address it. And another could be for example, like I was looking at menopause retreats. So this could be another good practice, that okay, when a lot of people going through that transition, especially they need support, they need guidance, they need everything. Of course, breakdown maintenance is there, but then what is preventive maintenance? And of course, we all know preventive maintenance and breakdown maintenance in our cars. We do it regularly when we do 10,000 kilometers, that we go for preventive maintenance. And why do we go for preventive maintenance? Is just because there shouldn't be any breakdown maintenance. So same way, life is very simple. We have to go for preventive maintenance. The only thing is that we don't have, we don't know where to go, what to do, how to match, what are the needs, what is my need, what options are available, who can provide, reliable, not reliable. And then we can't compare. So these are all the problems that we are trying to solve. Another interesting area is like bioanalysis. So this practice is already available. So you can get your bioassessment done. So, but the only thing is that in our daily life, we are so busy and so hectic that we are not able to concentrate on that part. Whereas bioanalysis, there are a lot of bioanalysis available. So it can give you a very good data to personalize your needs, your assessment, your diet, your health, everything. And if we are on a holiday and we have peaceful time, we are looking at these things and they get sorted out, and then we understand ourselves much better. Then when we come back, we're much more prepared, much more, life, the moment you come to big city life is going to be same. I said hectic, big problems, competition, we cannot avoid them. But the only thing is that our job is to, equip people, not only go on holiday. And when people come back from their holidays, then because sometimes they need support as well. So that's where these, we also have a network of around 2,100 instructors all over India. So they can also come for a session. You may not need it every day, but of course, you may need mentorship, you may need support, you may need guidance and encouragement, motivation. So all these things are also, so it's like end of the day, when you fall sick, you have no choice but to go to the hospital. That's it. There is no way out. But then before that, there is an opportunity you can do something about it. And that something is not urgent, but very important. So that's where, we kind of, and that's how we are trying to build this society, that whatever best is available in the world, I mean, it's like we are all one family, Vasudhaiva Kutumbakam. So we don't, differentiate between boundaries and everything. So it's more like, it should be available to everyone. People should be able to search, and that's how we will encourage the supply side as well. That they will also be more and more, innovative. And with this platform, we are also getting a lot of data. So that's also we try to mine it and make some machine learning algorithms to guide on both sides, on the supply side as well, that okay, how you can improve your products and services, and also on consumer side also, that what is more. So maybe AI recommendations and everything, so that we can do.
That's quite thought stimulating, I must say. You are trying to intervene for a category of people which is not just concerned about its wellness, but also realizes that something can be done and is hopeful. So you are keeping that hope sustained. So thank you for intervening in this space, and I'm sure this must be very impactful for the people who are participating in it. Let me go back to Dr. Khetarpal. So on one side, we see this, like I must say, these are sort of outlier experiences. The group that is seeking wellness is by far outnumbered by people who are deprived of services. How do you see equity dimensions playing out when it comes to accessing digital health technologies across geographies, across socioeconomic stratum, whatever dimension you could think of, sir?
Yeah, I think it's a very, very valid question. And when we talk of healthcare quality, it has six elements. We all want that healthcare should be safe, number one. Number two, it should be effective. Number three, healthcare should be patient-centric. And number four, timely. Number five, efficient. And lastly, equitable. So the six domains of quality in healthcare, equitable care is one important aspect of quality in healthcare. And addressing the equity in healthcare service utilization is very essential when leveraging the digital health innovation, particularly in diverse health system like those in our country, those in India. So we need to have some strategies actually to ensure that digital health innovations are accessible and beneficial to all, irrespective of their background and the location. Now, the first thing I would like to mention here is that promotion of digital literacy. Promoting digital literacy should be the key. And enhancing this digital literacy among all segments of population can empower individuals to utilize digital health tools effectively. Of course, providing education and training on how to access and navigate telemedicine platforms, mobile health apps, and other digital health resources can bridge the digital divide. This is very important and ensure equitable healthcare access to healthcare services. Secondly, I think those companies, the health tech companies or digital health companies, who are designing their product, they should be, they also have a great role in ensuring affordability and accessibility. And how they can do is, most importantly, they should be the devices. They should be designed with affordable. The solutions should be designed with affordability and accessibility in mind. That is very important, especially for the marginalized communities or underserved communities. This may involve subsidizing the cost of telemedicine consultations, providing the low cost or free access to essential mobile health apps, and ensuring that internet connectivity is available in remote areas. And also, it should be very user-centric solutions which they should devise, because they should develop user-centric solutions through a very user-centric approach, taking into account the unique needs and preferences of the people. So this is, I think, again, will definitely help in ensuring the accessibility and affordability, and also the expanding the connectivity infrastructure. I already mentioned about the internet connectivity. If you improve the internet connectivity and by expanding the broadband infrastructure in rural and underserved areas is very crucial. When we are talking of equitable, so it should reach to the last mile, and it's crucial to ensure equitable access to digital health services. There are certain government-led initiatives, public-private partnerships, and community-driven efforts which can help bridge this digital divide, and it can connect remote communities to telemedicine platforms and other online healthcare resources. Another thing is involving and engaging the community is very important. Community engagement and outreach through awareness campaigns, health education programs, outreach initiatives, which can promote the uptake of digital health solutions and foster trust in these technologies. So, collaborating with local leaders, the community organizations, healthcare providers can facilitate targeted interventions which are tailored to the specific needs, of various different population groups. And one more thing I think I would like to add here is we need to address the language and cultural barriers also. This is very important. So digital health solution should be inclusive and it should be culturally sensitive, catering to the linguistic and cultural diversity of the population. So this is important. You need to, they should provide a content in multiple languages. It should be maybe bilingual or multilingual, incorporating all the cultural nuances into the healthcare communications. And of course, but there are various challenges, ensuring the data privacy and security, building trust in digital health technologies, which require robust measures to safeguard the privacy and data security. So I think this is also we need to keep in mind. And lastly, the collaboration and partnership, as I mentioned, between the government agencies, healthcare providers, technology developers, academia, civil society organizations. They all need to come together. Coming on the common platform, stakeholders can identify the barriers. What are the barriers to the access? And they can develop targeted interventions and leverage the resources more effectively to ensure that digital health innovations, they benefit all members of society. So lastly, I would commend that by adopting a comprehensive approach which addresses the social, not only social, economic, and technological determinants of health equity. Health systems can actually leverage digital health innovation to improve access to quality healthcare and promote health equity for all the individuals, regardless of their background and location.
Thank you, Dr. Khetarpal. You touched upon so many dimensions. Clearly, it is not going to be a straight game. It's a complex, layered approach when we're trying to universalize digital health technology. As Mr. Daya was narrating, many times people experience and then need a longitudinal support after that initial experience. And in your case, as you narrated, that technology could be empowering, but the digital divide would be a dangerous multiplier when it comes to amplifying the differences in the way we utilize digital health technology. So there could be some stratum of the society which leverages technology, feels very empowered, and then there are some which are deprived because they do not have internet access, they do not have digital literacy, and so many things. Mr. Daya, I'll just broaden the scope, going beyond your travel Trexova experience. If you were to comment on how we could make these kind of services, digital health tech services, more universal, more client-centric. So on one hand, universal, and on the other hand, very customized, client-centric. Are there any innovations that you could think of? I remember you were mentioning about the AI/ML data approaches, but could you please elaborate a bit on that and any other aspect that you feel should be highlighted here?
Yeah. You have actually touched on a very important point, which is client-centric. So, of course, when we say client, it's also a big, broad word. But I must say that there's a lot of information available, but unless it is useful for that individual may not be interested. So I would say personalization is the key. So, I mean, a lot of things are available, but I will only be interested if it is relevant to me. So from that point of view, I will just divide it in two small topics. One is Trexova. So in Trexova, what we are trying to make is a digital assistant. So when we say digital, I also add to it that let's make it digital and intelligent. So digital is one part that, of course, a lot of things are digitized, but they have to be intelligently, communicated, delivered, distributed, consumed that way. So same way in Trexova, what we are trying to do is we are trying to make a recommendation, engine where, let's say, if you are having, an app which we will develop, that if you have that app, then it will keep on recording your some touch points. And then it will keep on recording what your health parameters, your related to whatever you need. And then it will basically recommend you, because you don't know when to look for something, because as an individual, we are too busy in our life. We don't know, and we come to know of it very late. So the point is that if you know well in advance that, okay, these are the points. And then second thing is, what is the solution to it? There's ample amount of solution available, but then which fits me, that is more important. So that's where it has to intelligently fit you and give you a recommendation that, okay, based on your need, this is a solution and this is available. Would you like to go for it or not? So that's where, we are trying to achieve an aim. And same way, if you talk about generic landscape, then as Dr. Sunil also mentioned that blockchain and AI is very important. That is the key. Use of blockchain, of course, people can use it in many ways, but I personally see that something like, health parameters of every individual, if from all the touch points, like we get our blood test and we get our, all kind of test, and we go to pharmacy, we buy medicine, we go and prescribe doctor, they give some prescription. So there are a lot of important things which are lying somewhere. So the only thing is that they are not available in a digitized form, in the form of blockchain, something like, you can say, Aadhaar of health. So in that case, if you are going for consulting a doctor or going to a hospital, so your entire history, if available to someone, you can be better guided. And moreover, like we are having, digital literacy and all those issues. So because people go and find, let's say, Google. So I would say they are also medically illiterate in that sense that whatever content is available on Google may not be reliable all the time and may not be relevant for an Indian scenario. So that's where, our own videos in regional format or something that can be distributed intelligently to the ones who are relevant. And moreover, government can also find out that, what is the macroeconomics, macro parameters of health in real time. Not that after 10 years, we know that, okay, what was the index? But now what is going on in our country, and insurance companies also need it, government also need it, preventive healthcare also need it. We don't know how many hospitals are enough for us or not. We don't know how many doctors are enough. We don't know in which form and shape. For example, early parameters of a pandemic also. So if you go for a blood test, and then like we formed a basic rule that if you go for test in COVID, then the organization who is doing test reports it. So that's where it goes into your digital, that, okay, government also knows that, whatever initiative that needs to be taken. So a lot of information is available, but it's just that it has to be consolidated in the form of blockchain, secured health card, and then intelligently solving the small problems, so that people don't need to explain so many things.
This has been a very enriching interaction with both of you. I must thank both of you, sirs, for taking out time and also sharing your experience. We started with Dr. Ketarpal showing how technology has evolved in the healthcare sector, uh, right from early 80s till date. A long way we have come. The Ayushman Bharat Digital Mission stands testimony to all the sectoral developments we could manage. Then we went to you, Mr. Daya, and you very nicely showed how preventive healthcare services could be embedded into wellness packages. And you spoke about bioanalysis, and you also spoke a bit about data management in AI/ML. We went back to Dr. Khetrapal, who again highlighted uh, 6 dimensions of quality when it comes to safety, effectiveness, timeliness, efficiency, and equitability. And he reflected more on the equitable dimension when he spoke about digital literacy and making our digital health tech culture and context sensitive. He also spoke about data security and the need to build trust in technologies and also mobilize whole of the society, whole of the government sectors and civil society as well. You highlighted, Mr. Daya, about digital personalization, and sort of as you spoke, I could relate the very concept of the Abha ID, the Aadhaar for Health, that has now come up. So fantastic interaction. Before we close down, just we have 1 more minute to go. Quickly, any closing remarks from you, Dr. Khetarpal? 30 seconds we have for you.
I would say that digital health, has it's a very transformational tool, and if you are not into digital health, you are not into health. So digital health is not future, not future. Digital health is the present.
Thank you, Dr. Khetarpal. Any closing remarks from you, Mr. Daya?
Yeah, I mean, we are a very rare country which has, very latest healthcare infrastructure and everything, and also ancient, practices like yoga, meditation. So we're a very rare country. So I think we are high IT strong as well. So I think we should lay down some foundation or growth path for the world to also, show that okay, what can be done in this regard, combining all these things, which is more inclusive and holistic.
Thank you so much, Dr. Khetarpal, Mr. Daya. Thank you so much for sparing your thoughts, sharing your thoughts, sparing your time and sharing your thoughts. Thank you, World Digi Health and Wellness Forum, for providing us this panel.
Thank you, Arjisman, Dr. Arjisman and Dr. Sunil. Wonderful session.
Thank you, Dr. Arjisman Mohapatra and Puneet Daya. And Alisha, thank you so much, World Digital Health Forum, for the opportunity. Thank you so much.
Thanks to our audience as well. Thank you so much for your attention. Thank you.
Yeah, thank you.
Thank you, panelists. It was a really insightful information that you shared. Now we'll be going ahead with our panel discussion 5, which talks about empowering patients, the role of health in enhancing patient engagement and health literacy. In this session, we will talk about how to explore digital health tools, applications, and platforms can empower individuals to actively participate in their healthcare journey. Discuss the impact of the patient engagement or treatment, adherence outcomes, and overall wellness. Address the role of health literacy in the digital age, focusing on making health information accessible, understandable, and actionable for diverse population. Now, I would like to invite our moderator, Dr. Jaseet Singh, Vice President Ujala Cygnus Group of Hospital. Welcome, sir.
Thank you so much, Alicia. So the best part of this today's scenario is that we are talking about the digitalization, and digitalization is the basically I usually say the word digitalization is the key. So I would like to thank World Digi Health Forum and the team so in for this wonderful session. So I would like to welcome our three speakers, Dr. Vishal Gandhi, welcome, Dr. Anuj Prakash, and Dr. K. Madan Gopal. So when we talk about digitalization, so digitalization is basically talks about the technology, talks about the information and the communication tools. And these basically, when we are going in the health field, so all the tools, variables that we are using, and these actually helps the patients with a better outcome and the quality of services that we are providing, and the betterment of the life. So first we will start with the Dr. Anuj. He is the HOD and the senior consultant biochemistry, Medanta Hospital, and he has around 19 years of experience in his healthcare and the pharma field. Hi, sir. Welcome to this forum.
Thank you.
So, please share your experience in terms of digitalization and the healthcare sector, which you feel is more relevant for this topic. Thank you.
Thank you, Dr. Jasdeep, and thank you for giving me this platform to speak on this topic of digital health. So, just to start with, I would say that the healthcare landscape is undergoing a significant, I would say, tectonic shift towards patient-centric care, where the patients are being the central role. I mean, they are the individual which play a central or more active role in managing their health. And digital health technologies are actually emerging as a powerful tool to empower patients, enhance their engagement, and improve the health literacy. And this is what is the topic we are discussing in this panel discussion. So I would say that, so for me, if I'd say there are three basic challenges in our traditional healthcare system, where the accessibility was the first one, where still till this year or till this day, we are still not able to get our healthcare to our remote corners of the country. It is still limited to our metros or tier 1 cities. So accessibility is one such issue with a traditional model. Second would be engagement, where I would say that the patients were treated as more of a passive listeners in our engagement. So there was a lot of passive information dissemination was happening, where it was not a sort of active engagement from both the patient side. And third was, I would say, communication. There was very limited consultation time with the clinicians. You know that there's hardly any time to interact with clinicians, and this unidirectional communication channels which hinder the effective healthcare between patients and healthcare providers. So these are three major challenges which I think could be overcome by having digital health because of our information access. You can have a lot of mobile apps, online resources, patient portals, which provide accessibility, multilingual languages, and customizable information, which caters to the various learning style and literacy levels. Second would be active management by using wearables, for example, symptom trackers, medication reminders, which enable patients to monitor their health, set goals, and track progress. And third is improved communication by having, let's say, telemedicine platforms, secure messaging services, online communities. So all of these three, I mean, so this is my opening remark in this for this panel discussion.
Thank you so much, Dr. Anuj. I think Dr. Madan is also joined. I think your sir, your mic and the camera is off. So if you can just turn it on. So we will go ahead with our next speaker, Dr. Vishal. So he's a good friend and colleague also. Dr. Vishal is the founder and CEO of Biorex Venture Advisors Private Limited, and investment banking firm started in the year 2012. Dr. Gandhi has an overall 24 years plus of extensive experience in the various aspects of investment, mergers, acquisitions, and portfolio management and the due diligence. Vishal has been involved in many first M&A deals in digital healthcare, diagnostics, hospital and pharmaceutical space in India. Prior to Biorex, Dr. Gandhi has also held top and mid management positions in the Yes Bank. welcome Dr. Vishal. So what will be your opinion? What is your opinion in all this? How have digital health platforms and mobile applications contributed to enhancing patient engagement and self-management of chronic diseases? So what is your opinion on that?
Sure. Thank you, organizers, for inviting me to be a part of this wonderful opportunity. And thank you, Jasjeet, for taking up the role as a moderator. And I know the toughest role that today, you got to play. And when you have luminaries like Dr. Anuj and Dr. Khetrapal and Dr. Madan, talking, and who has seen the length and breadth of the healthcare. So I think before I get to the chronic management of healthcare, I think we need to probably see that how India was before digital health started, right? India has actually been more of a sick care market than a healthcare. So it's only because we had, technology which has actually allowed the consumerization of healthcare. And that is where today we can truly call ourselves as a healthcare country, not as a sick care country, because otherwise everything was aligned sick care. And so coming to, four aspects of healthcare, delivering healthcare to 1.4 billion people in the country, I think it's a very, very monumental task. Like no private players, no public players can play. It has to be a private-public partnership. And in that dimension, I think one of the key focus for most of these healthcare organizations is to really provide accountable, affordable, and accessible healthcare. And I think if you have to look at these three paradigm, pillars, providing healthcare seamlessly to 1.4 billion people, the only way it can happen is to actually through digital. And so digital has actually allowed us to get the data on a real-time basis, and thereby we can manage not just the acute conditions that we suffer from, but also the chronic condition. And I think there's enough which one can talk about, diabetes to respiratory to all that. And we have seen that how people have been able to take care of take care of their health, provided they have the wearables, they have the remote patient monitoring apps and all that. So doctor is really empowered to take a right decision and what the right medication and the right regimen, because there is a data feedback, and based on the data feedback, there is a kind of individualized treatment which has begun, and that should actually work the best and, like I would say, efficacious. And so this is what actually digital health has enabled. And we have seen like companies like Fitterfly, we have seen companies like Health Impetus, which actually I sold to Dabur family business called Healthcare at Home. So we have seen that if you develop a healthcare as a model, and if you keep chronic as a segment, it's quite lucrative even from the finance point of view, because being a finance guy, I can't stop myself talking about return on investment. So I think it's important for us to see that the return on investment is generated to an extent that actually justifies to attract investment, right? The investment will be only attracted where actually one can make money. And I think in B2C, one of the constant challenges that we have seen from an investment perspective is that there's a cash burn. While if you are able to take care of the chronic segment, there the cash burn is very limited, because the patient is already enrolled, and now it's about what is called LTV, overtime value across the length of the breadth of the patient. So I think a lot of things which we could not have imagined under the no technology, under no digital health, we are able to imagine. And people, there's another very interesting paradigm that I keep talking about is 80-20. Now, people from even, remote village of Rajasthan, or maybe remote village of Assam, can still connect to a best doctor in AIMS, which actually was not the possibility. So I think this 80-20, which will take some time to solve in terms of the infrastructure, because 80% people live in those areas where there's very limited accessibility to the good doctors, because good doctors don't want to go work there because there is no actually market. Why should they be deprived? All right. And so telemedicine, I think Dr. Prakash highlighted in his earlier context that telemedicine has actually allowed things to be, much more impactful. And today doctors can, treat patients even sitting in tier 3, tier 4. We have seen enough cases across all the therapy segments, starting from dermatology to gastrology to many more segments, which we would not have imagined. And again, there's a concept of robotics coming in. So I think digital health has become like an integral part of the overall healthcare continuum. And if we were to talk about healthcare continuum, it's very difficult to imagine life without a digital health. health. So this is my opening remarks, and I'm sure you will give us an opportunity to talk more, as our panel goes, right, Jasjeet?
Yeah, sure, please. So now I will again come back to Dr. Anuj, and so what is your views on how a healthcare provider and an institution can work together so that there can be a better patient centricity approach and a better quality work they can do in terms of the digital health platforms?
Uh, yeah, so basically, this is about engagement of patients into the uh, digital phenomena of healthcare. So
Hello.
I would say the health literacy is something which is very, very key aspect in this particular area.
जी बोलिए.
So basically, as I said, there is a gap which we said digital health would definitely be able to bridge that gap between the haves and have-nots. But how do we get there? The only way I would see is a health literacy, the digital health literacy, and so the basically from a medical perspective, I would say that there is a lot of complex medical terminology and jargon which they sometimes fail to understand. So and various patients come from various diverse cultural backgrounds, and even the language barrier is there between many such cases. So we can have a lot of educational resources in multiple formats. For example, the text formats, video formats, audio formats, and in the languages of the local languages, utilizing clear visuals and infographics to understand those difficult terminologies. We can also offer interactive tools flow for exploring medical test results or such medical terms, which can enhance their understanding. We can also have joint educational initiatives and training programs for healthcare professionals on communicating effectively with patients. And we can have lot of community collaborations. We can have small where the medical fraternity can reach out to their communities, and they can have a lot of dialogue between such to promote health literacy. So basically, I personally feel that this way the patients can better understand their health needs, their test results, their medical needs. They can ask a lot of informed questions and make informed decisions regarding their health. And and obviously, if they are able to follow or adhere to these actions, it can lead to improved health outcomes. These are my thoughts.
Yeah, thank you. Thank you so much. And I think Dr. Madan Gopal has also joined with us. Welcome, sir, for this energetic and session that we are conducting today. And so let me got the opportunity to introduce you, sir. So Dr. Madan Gopal is a highly experienced healthcare professional with over 30 years of experience in health system reforms and strengthening of India. His expertise played a crucial role in implementing the RSBY Rashtriya Swasthya Bima Yojana and one of the world's largest health insurance scheme as well, that is Ayushman Bharat PMJY. During his tenure as a senior consultant at National Institute of for Transforming in India, Niti Aayog, Dr. Gopal provided essential support for various health sector reforms and policy level initiatives, including Ayushman Bharat PMJY, NDHM, and the ongoing COVID-19 pandemic responses. Currently serving as the advisor for Public Health Administration at NHSRC, Ministry of Health and Family Welfare, Government of India. Please welcome, sir, and kindly share your journey and your work experience and how previously the health sector is working and now the health sector has transformed into. Please.
Oh, thank you, Jasjeet. It's very interesting. I was listening to my previous speakers, though there was some technical glitch regarding the muting and unmuting of mic and the video. In fact, I was the first person to join. So I was there online at 2:45.
Yes, sir.
But no issues. But nevertheless, we should be having a standby for your technological glitches.
Yes.
Having said this, the digital journey in the country, I have seen this journey since the early part of this century, that is 2001-2, when the initial thing started with the telemedicine things, and the the district hospital used to get connected with the medical colleges, and most of the district, they wanted to have a telemedicine center so that they can have a air condition and a computer. That was the whole paradigm which we used to have in during that days. Now, having said this, things have changed. The major game change happened after the enactment of the Clinical Establishment Act in 2011, where which mandated to have electronic medical records. Though only 11, 12 states they have adopted it, but at least it has shown a way that the electronic medical records are going to stay. That's one thing. But since health is a state subject and the center is putting money, it has ensured that some assurance has been given that they will be providing some set of services. As a result, a lot of information management system has crept in. That means it has evolved. If you talk about the disease, you are having an integrated disease surveillance program. If you talk about the RCH services, you are having a RCH portal. If you talk about malaria, you are having malaria portal. You talk about tuberculosis, you are having a TB portal. That's the way how the system evolved. That means digital information has stayed. It has come in, and we are using the digital information for informed political decisions. That kind of shift has happened over the last many years. Apart from that, when we were struggling, when the PMJ program, when the RSPY program, Rashtriya Swasthya Bima Yojana program, was a success, and looking at the success, we thought that we should be enhancing the coverage, and that has been rolled as a PMJ program, Pradhan Mantri Jan Arogya Yojana. So later on, the names and other thing changes, but this program was rolled out. When this program was rolling out, at that time we struggled that how to have a unified kind of thing. That means so many softwares are there. You name a problem, and you are having an app for that. At that time, in 2017, the discussion was that can't we have a single identifier so that all these portals and other things which have evolved over the years, they can talk to each other. So as a result, what has happened, discussion started, and we came up, when I was in Niti Aayog, we came up with a national health stack. That means all the portals would be having in a stack, and through a common identifier, they can be talking to each other. All the information can be culled out and they can talk to each other. With this kind of notion, a lot of deliberations and other things happened, and the National Digital Blueprint evolved, which was subsequently rolled out as a Ayushman Bharat National Digital Health Mission, ABHM, which we are calling it as. It was rolled out like that. It evolved like this to have a common identifier. What presently we are doing is we are trying to create a common identifier. That means we are trying to give a number to a person, to a provider, to an institution, to a pharmacy, so that the same thing can be embedded into the patient records, so that what I've told earlier, that the electronic medical record was envisaged in the system, so that all this information is embedded into the records, and that record can be used for improving the services, evidence-based planning, as well as the providing other insights for either for research, for policy, for improving the provisioning of the services. In this way, the system has evolved and it has changed. Now, whole efforts is there to create an ID, embed that ID into the records so that these records can be used. Other aspect is in other direction which we are moving, because the uptake of this thing is very important. If you have embedded these IDs into the record, that records can be used for developing algorithms which can be run into this AI mode and the machine learning modes, and blockchain and other things can be utilized. Because prime and most important thing is the records. So we are in the process of creating electronic medical records after embedding the ABHA IDs as well as the other IDs of the providers in this thing. This has evolved. Now you see that increasingly the government is depending on data-driven governance, because we are using the data which is generated by the digital tools for coming up that for making any sense in which direction the services are moving, in which direction the the disease is moving and what is the burden of disease, what kind of uptake is there, that kind of things are evolving. And private sector is also not left behind. They're also devising ways and means and ways of seeing that how they increasingly utilize the data which is generated in the hospitals. Presently, they are generating the hospital in the data in the hospitals, and they are using it judicially for arriving at conclusions and taking informed decisions. So you see the potential utility of this. We have to see that how both the systems merge together. They both start using the ABHA IDs and other things. That's the work is in progress. That means slowly and slowly we are moving in direction. So I will stop here with my initial remarks. Then I can take further questions later on.
Thank you. Thank you so much, Dr. Madan. I have seen that time also, sir, when the government has started the Ayushman Bharat scheme, and we are the basically Ujala Sickness is the first hospital in the Haryana state that is empaneled under that scheme. That is in the year 2018. And after that, we have seen there are many Ayushman Bharat 1.0, 2.0, 3.0. Even in the, if we're talking about the digital health platforms, they are TMS 1.0. Then recently they have launched the TMS 2.0 also. So the government is also pushing each and every way to enhance the digital health platforms. Next, I would like to ask from Dr. Vishal. Please tell me a few details about the wearables that the patient is using and how that is helping the better outcome and the better patient related information, and that is helping the patient for a better life basically they are having. Please.
Thank you. So I can only say that I'm also using one variable, which is Samsung Watch, and it has really allowed me to manage my health better. And there can't be a other wonderful example than your own health. And I've seen that, because there is a feedback mechanism, as I mentioned earlier, we are able to at least see that, how many steps we have done, what kind of exercises, when we should be doing exercises. So I think there are many variables, but to me, I think one can only wear one variable, and they can be multiple features. They can be integrated, like one of the companies that we have supported called NowZone, and so they've developed a variable which is worn on the torso, and there you monitor the breath rate. Now, it's very difficult for us to wear multiple variables, right? So I think the integration of those APIs and those technologies into one smartwatch will be a big game changer. And I feel that wearable as an industry has gone ahead. And we have seen a wonderful example of a company called Dozy, wherein their mission is that her bed Dozy. So Jasdeep, I'm not sure what journey are you at, but what the kind of revolution Dozy has brought, what is called remote patient monitoring, is a clear indication that it is not about variable. It is actually about, tracking the entire parameters, through the command center, and which actually makes the whole healthcare ecosystem, at least in the private world, very accountable and accessible. And so that way, I think it's very inclusive. And the role of wearable technologies, remote patient monitoring, is very, very profound. And it will be very difficult to imagine a world without such technologies. And I think more we get integrated to one variable, it will be better for us to actually manage our own health. And I think one of the previous panelists was talking about preventive health. Now, preventive health is something which is I would say, the core to the healthcare today. Now, we cannot really depend upon government. We cannot really depend upon insurance, because today, the private hospitals are run by insurance companies. No, we don't pay, any of the guys, right? It's the insurance which pays. Now, even for insurance to track and give you an incentive, whether, your risk premium should go up or it should go down, you've got to have a data. Now, how do you track this data? And I think this is where, we are going to be seeing incentivization of such technologies adoption, and how it is going to create a further more consumerization of healthcare. I think healthcare has two dimensions. One is preventive, which I think is going to be really a center stage. And if that happens, I'm sure we will become, a developed country, because all the money will not go for healthcare. It will actually go towards the development which is required in logistics, transport, and other sectors, which are going to be really pillars of taking Indian economy to the actually a developed economy. And I think lesser money we spend on healthcare, the better it is, because we will not be able to, spend spend that money considering where we are. And so I think managing one's health through wearable is the very, very important aspect of our life. And I think every government must come up with this kind of mechanism. Insurance has come up with it. There's another very interesting company in Bombay, which does a lot of work with the pharma companies. They call it B2B, patient engagement. And but I think insurance can only play certain role, whereas an individual or doctors or, whatever, I think all the stakeholders of healthcare have to play a very, very critical role to ensure that there is an adoption of such technologies, and those technologies eventually will have a very long-term impact, in managing your own health. And I think even patients, definitely don't want to be called patient. They want to be called consumer of healthcare today, right? And I think that is where, I would love to leave. If you have any other additional points to ask, I'll be happy to respond.
Yeah, sure, please. So I think while continuing this, I would like to ask Dr. Anuj. So what do you think? Is this cost effective for the hospital or the patient, or how this digitalization of each and everything will help the benefit and the institutes?
Okay, so before coming to it, I think let me just want to add few more points to Dr. Vishal, because he touched upon preventive healthcare. So preventive is something is a key in the healthcare segment. Actually, the word is going from illness to wellness, or what we call the prevention. We always used to say in the past that the healthcare is the preventive healthcare is the most important segment, because that's the key. So we have to catch people at a younger stage before they fall sick. And so we have a lot of such wearables and like monitors. For example, just to tell, there's something called continuous blood glucose monitoring, where which is actually a very game changer in the management of diabetes. So similar such examples are coming. Similarly, for other cardiac things, there are a lot of variables are coming. So we have to. So preventive is definitely the key for the future healthcare. Now, coming back to the question of the financials of digital healthcare. So initially, we always think that the digital healthcare is a financial is a barrier. What people think initially, but if you see in the larger context, where those hospitals or those institutions which have adopted digital healthcare or digitalization of their systems, they have proved to be very, very cost effective and economical in the long run. For example, if I'll tell you the example of, let's say, medical records section or MRD department, where in earlier days it was like a very cumbersome department, where all the records were in a hard copy format. But once the institution started investing into the technology of keeping the records in a digital format, the space has been saved. A lot of other saving has been done to the institution. Paper has been saved. In fact, in my previous organization, we did a small study about paperless hospital. We have gone paperless because of adoption of digital technology, and there were a lot of saving in the context of our papers. So if you put all of these things in the perspective, you will see that you actually end up saving a lot of money when you adopt technology in your day-to-day practice.
Thank you so much. You have Dr. Nuj have added a very good point. And now I will be coming to the Dr. Madan. So, what is your opinion? How this digitalization, all the health sector has reached to the rural level, to the ground level patients and the hospitals, those who are working in the tier 2 and tier 3 market? What is your opinion on that, and how the government or the private sector can help these patients and the hospitals so that can be reached to the ground level?
Jasjit, yeah, it's good that you have put this question, because if you look at the uptake of the digital IDs, our IDs, so the uptake is it's not that significant in the private sector, because we have to see that how, because we are using variables in a bet, all the parameters are there. Has it been embedded into a ID? Then obviously the behavior and the other things during subsequent visits or subsequent thing that can be analyzed if it is linked to the record. That's one area that which is not happening. Apart from that, if you look at the way things are being, we are trying to embed this ABHA IDs into the electronic records at the population level. Population level means at a 3,000, 5,000 population, 3,000 to 5,000, we have a Ayushman Arogya Mandirs, which were erstwhile sub-health centers, where we are screening the population as well as generating Abha IDs. After screening the population, we are creating the digital records in which Abha IDs are getting embedded. Even in the immunization also, we are creating an Abha IDs and linking that record with the immunization profile of them. That means we are trying to create an electronic record at that level. That's one thing. Second thing is, if you look at the internet penetration in the country, is more than 60%. The smartphone penetration is more or less more than 60%. If you talk about the 2G internet, is more than 90%. If the broadband is limited, but 2G is more than 90%. That means feature phones are more or less available everywhere. And what we are trying to do is we are trying to gather information through these smartphones and the feature phone. You might have heard about the accredited social health activists, who are the health workers, who are in all the villages. Around 10 lakh, a million of ASHA workers are there in all the villages. They are being equipped with a smartphone, Android-based smartphone. In some of the places, they are having tablets. They collect information from the people, and that is fed into the system. In the system analyzes that. So we have gone up to that extent. The government has gone to that extent, and we are capturing the information from the ASHAs, right from the village level. Apart from that, we are using that same platform because if you look at the e-Sanjeevani teleconsultation platform, as I mentioned that the Ayushman Arogya Mandir, they are the peripheral most health institutions. From there, doctor-to-doctor consultations are happening. And you would be happy to know that more than 10 crore consultations have happened over the last 2-3 years. And every day, so many consultations happens. That means doctor-to-doctor consultation in the public sector, they are happening. But if you look at the number of institutions which are there, if you talk about the tier 2, tier 3, and the other cities, this kind of mechanism is there, and that is working very effectively. You can't say that it would be 100%, it can match the standards of the peripheral level apex private sector. No. But when many of the things which can be handled at that level, they have been handled at that level through various means. That is, telemedicine is one of the things. And it is yielding results also. It is reducing the load on the district hospital and everything. Up to the district level, it's only the public system which are more or less. Once it comes to a tertiary level care, then the other role of other institutions come. But essentially, the question which you have asked, how much penetration we have already penetrated into the lower level. If you look at the way the IC activities and the awareness related activities happen, in the awareness also, we are using the Android phones and small clips. The reels are being made for propagating IC activities. So you're also utilizing the same things. Apart from that, if you come further upwards, we are trying to see that how a clinical decision system, the support system is enabled to the auxiliary nerve midwife, the health worker, male and female, who are more or less act as a doctor at the peripheral most level. You see that this kind of digitalization of the system has happened. And apart from getting information, we are training them also. Whatever new methods, whatever new training guidelines, or whatever new advances are happening, which are related to the public health system, that is immediately being propagated through our iGOT platform and the learning management system, which we have evolved. So immediately, the moment any module is maintained, the medical officers right up to a PSC level. PSC is at the 20,000, 30,000 population. At that level, the information percolates, and so that the transmission loss which used to happen earlier through the cascade mode of training, that is also been avoided. That means right from building capacities, getting information, as well as supporting them with a decision. That is all getting inbuilt into this. That means work is in progress in that direction. We see that how the system evolves and gets mature in the coming days.
Right, sir. Right. Absolutely right. So I think my question justifies this one is the best answer I have got. And there is one question from the audiences. I think Dr. Anuj would like to answer. What feature or tool are available to help patients track their progress, set reminders, and stay motivated in managing the health goals? Dr. Anuj.
Yeah, Dr. Jasjeet, as I said, there are a lot of mobile apps which the users can download. For example, there is a app called MyFitnessPal. It is a very popular app for tracking nutrition, exercise, and weight goals. So there is something called Fitbit. You all must be using. I mean, I was using. Then there's the Apple Health. There's Google Fit. So a lot of such are available. There are a lot of free also available. A lot of the Android phones have Google Fit, and Apple Watch users can also use their Apple Health app, so which tracks your steps, calories, and such. You can do exercise routines, all those water reminders. So all of these are available nowadays. So, and in fact, these apps also have something called gamification. They give you rewards, they give you benefits if you do that much steps, that much activities. So those are the things which you can use. Apart from it, you can have what is that? The wearables. Again, there are watches like Samsung Galaxy Watch. What I think Dr. Vishal has just shown us, which is like very advanced in that context. So if some people wants to purchase or to invest in their health, they can go for these gadgets. They are really helpful. And what else? So these are, then there are, okay, there are something called a lot of personalized coaches, which comes with the watches. For example, Garmin and other such watches, they also have their advisors, which tracks they take your history, they advise you about your diet and all that. So all these things are available nowadays, which comes in packages. So if you explore it, you will get it. So I don't see a problem in that.
Thank you so much, Dr. Anuj, and I hope our audiences are satisfied with the answer. And now I will be going back to Dr. Vishal. So you are basically from the finance background, and you have a very good expertise in the due diligence part and the other parts also. So what is your opinion, or what is your opinion where you can push these startups to go in the digital health platforms and start doing all the works where the digital and the health sector are coming at one place, and they are basically starting their business in the health sector? What is your opinion, and would you recommend or not?
Yeah, absolutely. So, I think digital health is a great enabler. And we see that, like because of digital health, we can address what has not been addressed so far. So for, I think from an investment point of view, there are, I would say, more than 1,000 companies which have been angel invested or venture-backed companies in the area of digital health in India itself. Some of them have also died down. Very few could scale up. So I think there are certain challenges that needs to be addressed to be able to attract the investment. And one could be around the security of the data. The second is that, even our own portal of Abha, if you look at, there are 135 service providers registered, and even big wigs are there, and they've not been able to induce the people to go for personal health record or electronic health record. So I think there has to be an incentivization. As I said, there has to be a clarity on the regulation, the data treatment, the safety of a data. There's so much of cybersecurity challenges which are coming up. So I think these all needs to be fixed up. Otherwise, data could be misused, and at the end of the day, I think it's a personal data, right? No pharma company or no company that way for the commercial motive should be allowed to create a business model around it, right? And your previous question about what are the features or tools which are available to manage patients, track their progress. So I think very wonderfully captured by Dr. Anuj. I just want to supplement a couple of points. So there is a very interesting startup that we are supporting called DoseTap. So they actually help patients to do something called medicine tracking, right? Because people after 60, they tend to forget whether they have had their medicine regimen properly or not, and they have no idea. And they sometimes, they don't have anybody to take care of them. And so how remotely, their relatives can actually figure it out. So this is one approach I can share. The other is Goki. Goki is very interesting, digital health company, which has raised about close to $20 million. And it's a B2C company. And they also work with a lot of pharma companies to be able to manage the health of the individuals through the B2B channel. Then we have seen AR, VR, which is also, like I would say, emerging for the rehab purpose primarily. Like, wherever there's a physiotherapy required, there are tools now which are through the augmented reality. You can actually manage your health at home. So, which is again a very, very important step, I think, which we would not have imagined if digital health was not there. So to me, I think digital health continues to be a very interesting subject of investment, and every week we get to see one investment. We personally have also invested in about 15 plus companies in digital health. What basic challenge we have figured it out is that scaling up is still a big challenge, because it has to be entrenched into the healthcare ecosystem, and it itself is taking time to digest, right? Even the big companies like Dozy, who's sitting with tons of money, but they still are probably at not even 1% of the total beds that the country has today. Now, how does Dozy capture 10% of the private beds? I think is going to be, I would say, a big challenge. But I think having the clear need and having a clear economic business model, because I think adoption comes from economic business model. And I think Dr. Anuj also spoke about that, how ROIs in a paperless hospital is much better than a normal hospital which is still working on the paper mode, right? So I think there is a clear enough case studies which talks about that if you spend money on digitization, how it creates ROI. Then I'm sure, Jasjeet, your own hospital is also adopting something called electronic health record, and how it is actually helping you to go back and communicate and engage with the patient, because that is what has actually allowed us to unlock. Otherwise, there would hardly be a tertiary hospital reaching out to the patient saying that, this is your appointment time, please come on time, this is your electronic health record. Today, it's like so great, it's totally democratization. And I would again go back to my famous line that, we are in a very interesting phase of consumerization of healthcare, where, healthcare actors, which did not play a role earlier, but today they are playing a role, and which is actually nothing but our own self, right? And so this is an empowerment, and this is how truly we'll all become empowered and to be able to create value for the country. Our GDP should grow only when we take care of our health. And I think this is where
Right.
I want to stop, right?
Absolutely right, Dr. Gandhi. So from illness to wellness and from patient to consumer, we are now coming to the end of this session. So any closing remarks from Dr. Anuj, please.
No, Dr. Jasjeet, I think what the whole idea of this conference was to have the understanding of from illness to wellness, and from patient care to bring the patient care into the center of all of our activities. I think is the core objective and core phenomena, and how to reach to the patients to make them so that they take care of their health as a most important subject, and which in long run prove to be good for the country, as Dr. Vishal has mentioned. So I think if we're able to achieve that objective with this with this sort of conference, I think it would be a great step.
Thank you so much. And Dr. Madan Gopal, please
So
share your
one
closing
thing I
remarks.
want to add to your illness to wellness, from wellness to well-being, because we are focusing on well-being. Because illness to wellness is all institution based. To well-being means we have to see that how a holistic way we promote health.
Right, sir. Thank you so much, Dr. Vishal. You have
I think
30
I've said
seconds.
enough. Only one point I would like, since Dr. Madan is here and he's a policy maker. So I think there's enough happening on the senior care. And I feel that the next opportunity for all of us to actually contribute socially and economically would be to focus on senior care, because today we are the having a demographic dividend of the youngest population. But what is going to happen after 15 years is going to be actually liability, no more demographic dividend. And I'm sure Dr. Madan Gopal and his team is already looking at it to create a connected world where, like we are able to manage our health very significantly at a very low cost, leveraging the power of technology. And I think this is where government has to play a very important role. And Dr. Madan Gopal I'm sure he's already thinking on that direction.
Thank you so much, Dr. Madan, Dr. Anuj, Dr. Vishal, and the platform is all yours to Alicia. Thank you so much.
Thank you, panelists, for sharing your insights. Now we are moving on to our very last session, panel discussion 6, wherein we are covering a topic on digital mental health, innovations, challenges, and the path forward. Here we talk about explore the advancement in digital mental health tools, including teletherapy, mental health apps, and the virtual support communities. Discuss the challenges and ethical consideration associated with using digital technologies to address mental health issues, including privacy concerns and potential bias in algorithms. Now, I would like to introduce Mr. Bhupendra Kumar Rana, founding CEO, Quality and Acceleration Institute, QAI, our moderator. Welcome, sir.
Thank you.
Along with him, I would also like to invite Ms. Priyanka Sachdeva, founder, Core and Pure. Welcome, ma'am. Ms. Shivi Sabrawal, co-founder and director, Vellum.
Thank you.
Welcome, ma'am. And Dr. Sushil Mehra, medical informatics, AIMS. Welcome, sir.
Yeah. Thanks for inviting me.
Mr. Bhupendra, sir.
Thank you, Alicia. Thank you very much for kind introduction. Welcome, my panelists, eminent panelists, in fact, and all the participants to this wonderful webinar on digital mental health. I think I was taking some time to understand what does it mean actually. Are we going to manage mental things in terms of, that Dr. Madan has mentioned wellness, illness to wellness and well-being, and that's all connected from mental health, which everyone is, concerned nowadays as we're moving forward into the lot of digitalization, and a lot of industrialization of healthcare as well. In that way, a lot of data has been, gathered around, and so we need to think about how innovative we can be as an organization as well as individuals. What are the challenges being faced, and how we can take it forward. And so today with me, as Alicia introduced, we have three eminent panelists, Priyanka, Shivi, and Dr. Meher. And time is very short and topic is too wide. I think this is a topic we can talk the whole day, but we have limitations of time. So we have just 30 minutes, all inclusive, including what we already spent on till now. So maybe we can have a couple of minutes of conversation and open ideas of your own organizations and how you are driving this agenda. So I would just like to start up with Priyanka. Priyanka actually founded is very interesting organ, Core and Pure, a very interesting name, Core and Pure. And I was given to understand is into the business of manufacturing products from all natural products, right? So how these products can be helpful for the mental well-being, and how the digitization can actually be connected with the whole world of mental health. So I'll just leave it to Priyanka to open up this thing. Over to you, Priyanka. Thank you.
Yeah. Thanks a lot. Thanks a lot for having me here. And good evening, everybody. This is Priyanka Sachdeva, and I'm founder of Core and Pure. As Mr. Anna said. So Core and Pure is an essential oils and based product company, and we manufacture products for concern specific based on essential oil. Because first of all, I would like to say what exactly essential oils are. So the smell you get from any plant is because of the essential oil component present in that. And they are volatile in nature and are nanoparticles. So whether you inhale it, consume it, or use it topically, it enters your blood vessel. And whatever will go to the blood vessel would work on your hormone. So this is how it works on the hormone. And 95% of the problem what we have is all because of the hormonal imbalances. So we manufacture product based on essential oil for concern specific, working on the root cause of any ailment like sleep disorder, anxiety, depression, arthritic pain, and many more. So when you talk about how this helps, I told you that essential oil works on the root cause of anything, and this is how we are manufacturing product for this thing. You want me to take it up more in the digitization, or here just the introduction, and then accordingly others can introduce and we can take it up?
Maybe it's good that if you can connect with what you're doing and how it is connected to the mental health.
Right. So what happens is, like, specifically when you talk about stress or, the mental health, this is very important. And if you are stressed, it will lead down to major problems. And approximately, if you see 29 major diseases, like, definitely anxiety, depression would lead to this. But apart from that, like blood pressure, you talk about diabetes, heart attack, arthritis, cancer, all somewhere, if you are under stress, it would impact your immunity, it would impact your hormonal imbalances, and then it would lead to this. So what, as I said, that essential oil is something which just in inhalation, if you are taking this, it would balance your hormones. For example, I'll just give you very common example in household. Traditionally, you see, every one of us were said, whatever the religion you follow, we were said to do, havan or, fumigate, loban at home. And it was said that the negativity will go away. There is nothing outside, right? It's all inside. We are not, changing the arrangement of the house and all. But through inhalation, that essential oil component, when it is fumigated, goes through your olfactory inside your blood vessel and works on the hormone and keeps your, like, cortisol is a very important hormone which, impacts you. It is important in terms of the development, as well as when it is on the higher side, it impacts your mental well-being. For example, okay. So for example, if you are, if we talk about, when the kid is in mom's womb, at that time, if mother is stressed, the level of cortisol is so high that, if it is entering the uterus, then the kid is also swallowing it. And if the kid is swallowing in later stages, you will see that the genes are impacted and the kid can be in very panicking state, like, very small things, he or she can start panicking. So this is how these essential oils in inhalation you can take, and it will keep you completely calm, relaxed. And once you are not stressed, many things would be taken care of.
Thanks,
so that's how
thanks,
these products are
Priyanka.
impacting and
Thanks for
helping.
sharing your thoughts on usefulness of essential oils. And if time permit, I'll come back to you over second round, connecting with the digital world, how it can be right. So now moving on to Shivi Sabarwal, and
Right.
really another interesting panelist. Shivi is co-founder and director of WellM, and which is actually, I just did a little bit of research, not much, but is on how lifestyle can change the things for human beings. Okay, so I just would like to hear from Shivi what she think about how your organization can contribute, or the processes you are thinking of can increase the mental health and mental well-being of individuals. Thank you.
Sure. Thank you so much. Good afternoon, everyone. I'm Shivi Sabarwal, and I'm the co-founder of WellM. It's a mental health support platform. And thank you so much, firstly, for giving me this opportunity and honor of presenting my views and also my learnings about the digital health space of mental health. If I talk about WellM is a platform that we have been passionately building to provide an ecosystem of care for people who not just want to provide or to basically take help, but essentially they want to understand their emotional state of being. And then thereon, there's a beautiful journey that we have crafted for them in order to give them guidance from caregivers to self-help tools to guides, etc. Personally, I feel it's been a rewarding 3-year journey for me, being in the space of spreading awareness about mental health in corporates and in institutes. That's the area that we target. But honestly, I feel there is a long way to go before we start normalizing and destigmatizing these conversations in India and prioritize not just mental health, but also self-care for individuals. So talking about my learnings, WellM, when we started, was actually started as a holistic well-being platform. And it was a web-based platform. But soon we realized that if you really want to work on the happiness quotient of people, then the focal point needs to be mental health. As that's the window to actually your well-being, because it impacts not just the emotional, but your physical, but your day-to-day operations as well. And also we wanted to basically support people through a 24/7 platform, which provides the right guidance, right tools, and right caregivers to people. So hence we created a very robust platform, which is in the shape of the WellM app. I would call it like a secret confidant for people who are looking at a holistic mental health solution. And since we've gone on the app, I think this has really been a game changer for us. So the app basically suddenly made us accessible to people, not just in corporates, not just in institute, but also in BC towns who may not have access, to proper care, and also at a very nominal fee. And I think the app also made it possible to break the barriers of time, of region, and provide support to people at any time when they need it. So I'm quite, I would say, proud at this point of the platform that we've created. We provide a 24/7 support. We offer one-on-one therapy. We've created actually a standardized tool, which is called the Joy Care Assessment. Joy Care Assessment actually helps you understand your emotional well-being. And from there on, take the right actions on daily basis with the nudges and the support that we provide. We've also created an assessment, which is called the self-care assessment, essentially, which helps people in understanding their lifestyle in accordance to nature. Because there are a lot of times the answers are hidden in how are you leading your life? Are you exposing yourself enough to sun? Are you drinking enough water? Are you exercising enough? What are the right people that you're surrounding yourself with? So there is a proper tool and guidance which is provided by the app. And also what we've done is on the app, we've also provided community support. A lot of times with mental health, what happens is people are not able to express themselves because they have the fear of being judged. So we have a community aspect on the app where people can actually come and talk about their feelings anonymously. And they'll see that they find a lot of support from people in the community. Plus, of course, we have therapists who look at these messages and conversations and support them in a positive manner. Yes, I think mental health community plays a very big role, because most of the times you want to be heard and feel supported. I think with corporates and institute, we also started, this beautiful thing called the listening circle, which I would say is not really therapy, but still it helps you to release a lot of emotions, and then you start connecting to people. So this is where we are at this point in time, and I hope to take it wide around in the country. Maybe I can talk about the challenges, I think, in the second round of what we are facing right now.
Thanks, Shivi. Thank you very much for opening your conversation about lifestyle and how it connected through app. Now we move to the third panelist, very eminent person, Dr. Sushil Kumar Meher. He is the head of Health IT, AIMS New Delhi, and over 3 decades of experience in health informatics and all, and what others organizations, platforms, apps are using. He is the person actually driving many of those items and building blocks of those digital world. So I would just request Dr. Sushil to please open up with your conversation, what you feel that how this digital world, I can use the word digital in your case, digital world is actually helping in mental health. As we know, that our government of India's telehealth platform actually totally changed the platform of healthcare to reach to the accessibility and all. So how you think that the digitalization and digitization can help really building blocks in making the health for individuals a better option? Over to you, Dr. Sujit. Thank you. You are muted, sir.
In the health IT, I was working last 35 years. And in AIMS, I am working last 32 years. I have seen from the beginning of the digitization of healthcare to the, today can say, AI-based healthcare. In this journey, I have felt that how the patient can be facilitated through technology. And the only technology is that information technology. Okay. Everybody, they always be afraid to reach to a hospital to get a treatment because they are afraid that they might have some critical disease they have. That's why they are coming to the AIMS. That's why we have to facilitate them in such a way that everything should run smoothly to them. If someone is coming to the AIMS, they can empower themselves to do the registration themselves. Just last panelist, they have talked about the ABHA ID. Okay. Right now, I'm talking about the integration of ABHA ID in AIMS registration process. You take an appointment online, reach to the hospital on time, go to the OPD hall, there is lot of QR code is available. You scan the QR code, then automatically from the QR code, it will ask what is the appointment number. If the appointment number is there, you can fill it. All the details will come up. Then it will ask that, do you have the Aadhaar ID? If it is not, then it will create the Aadhaar ID to integrate with the Aadhaar ID. Authentication from the Aadhaar, your Aadhaar ID will be created, and simultaneously AIMS ID will be created. So that what it happens, whole process, it takes the people not required to wait in the hall to come there turn to get the registration. Because in the morning, we are getting 14,000 patients in the hall, 14,000 patients. It means that about 30 to 35,000 people are in the hall because each patient carry one a person with him. That is, we say these peoples that, see, this is the Indian system. Somebody carrying one or somebody carrying two. So in this crowd, to manage this one, this is the one best process which we have done it, that the seamless registration process, those who have the smartphone, no internet connection is required, Wi-Fi will be given to them, they do it and they can reach to the doctor immediately. This is the one process we have done it. Now up to the mental health. Okay, one example I'm giving to you. If you go 10 years back, every year 2 or 3 students, they do suicide in AIMS. And right now it is totally zero. Why it is zero? We have taken a step on it. When the students come to the AIMS, we do the counseling. And we have found those who are coming for the post-graduation level, around 90% are on depression. Because all the cream players, cream doctors, they are coming to the post-graduation course to AIMS. And they are on depression. And what we have done it, we have started one apps too. The first, before admission, the counseling has to be done and treatment plan has been done. And everybody has to register on that apps. After that, when the exam will come, then one questionnaire will send to them. Then we'll know that what is their mental state. And beside, if somebody is getting treatment and he is not taking proper treatment, he is not reaching to the doctors on time, we are sending the message to them. You are sending the message to their family, or we are reaching to the student directly. So in this way, we have done our homework, that we have saved 2 or 3 people, the cream and one of the best doctors' life, those who are suffering in mental health. This is one of the things what we have done it. Another part we have done it during the corona. Technology has given such a high hand to us that how to get the person he is on depression. As per the data, every 1 lakh, there is 2,500 people are on depression, which is not been detected in India. So what it happens, we do not, and during the COVID, it has gone 3 times. So what we have done it, we have AI-based application has been developed, and we have taken the data, his face value, his voice, and some clinical questions, if he's giving it. And we are predicting that this person is on depression or not. If he's in the depression, what is the grade of depression, we have knowing it. If the grade is very high, we ask them to reach to the hospital immediately to get the treatments. So these are the technological leverage what we have got it today's stage. Over to you, sir.
Thank you, Dr. Suresh. Thank you so much for sharing your ideas, views, and experience. And it reminds me a movie which I watched 2 weeks ago. I don't remember the name, obviously now, but that's in that movie. There are friends, and one of the friend is an entrepreneur, the lady, and she developed an app, like you just mentioned, and that app was actually helping getting data, and they get the alert if somebody's under depression, and is tending to suicide, then they will get the alert and they will reach and then prevent its suicide. So it's just coinciding with what you mentioned. Maybe they have taken your ideas and built that on that part. So thank you so much, which actually is very practical, and this is what the digital mental health actually can be connected very well. That how we can use technology, digitalization, information technology, in integrating into a system or app or whatever platform you say, which captures data and give you the information based on which we can make a choice and make a decision that what can be done. Reach out to the person, safeguard, and whatever thing. So it's like collecting data, making it into information, and make use of that information in preventing such things which might create a lot of problems. So now go back to Priyanka. Core and Cure is using the essential oils for the mental well-being. But coming to that, how actually you think you can make use of digital world in making it more effective and efficient? And that can
So,
be something for you as well. Thank you.
right. So, am I audible?
Very much.
Yeah.
Thank you.
Yeah, great. So, a very common thing here as we are sitting, but from this event itself, let me correlate this. So, this event was supposed to be offline, right? And we could not do it, and we are doing it online. People who are not here, once it would be posted, people can see those who are not present at this particular moment as well. In the same way, for example, Core and Pure, at Core and Pure, what we do is every Friday we do live with some expert, like, it can be with the psychiatrist or the gynecologist or the orthopedician. And then those people who are not able to come in front, because there is a big taboo about mental well-being, right? If I am everybody, let's say, for example, WHO says that just a minute. So WHO says that about by 2035, approximately every household would have people suffering from mental well-being, right? Mental health issues, and you can understand the situation. And we are not able to come out and talk about it. If you have been able to correlate it digitally, if the videos are there or the knowledge about it is there, those who are feeling helpless going and reaching out to doctors or coming in person, they can see this content can be uploaded online, and it can help people to take care of themselves. This is one thing I feel. Another, apart from that, there are telemarketing, or another thing, as Dr. Sunil was saying, that we have with the language, with because there are in different field of medical sciences. For example, there is something where you can cough, and from phone you can find out that whether the person has tuberculosis or not. In the same way, with the language, with the heart rate, with the fingerprints, and everything, you can find out whether the person is under mental stress or not. And by doing that, apps like Calm and all are helping people to understand at what stage they are, and they can take care of themselves, or other can also help them, but like family members can help them to understand and come out of that particular situation. Because see, mental health in today's lifestyle, as Shivi was talking, that it is lifestyle thing, it is 100% lifestyle thing. Prior, what we used to do, we used to meet people, तो वहां पे भी कुछ है ना hormones release हो रहे थे. Those हम बोलते हैं dopamine, oxytocin, serotonin and endorphin are known as happiness hormone, right? And these are secreted by the natural thing what we do, meeting people, praying or exercising or meditation, लोगों को दान देना. So something like that we are doing, and हर चीज से एक है ना hormone release होती है. People are not aware about it. आप digitalization से चीजों को upload कर सकते हो, वहां पे बता सकते हो. People like Shivi, people like me, people and many others, who are working in this particular field. Now, AIMS, as sir is saying, that is working a lot, and government is working a lot on this. अभी तो इस बार के budget में we have budget allocation as well for these things. So you can understand the way it can be developed, and it can easily reach out to the B, C, D category of cities as well. So this is how I believe, digitization can help in taking care of the mental health.
think we lost him.
Are you there?
I must compliment you, Priyanka, on the essential oils that you're doing. I personally use essential oils, for myself and even for my kids. Yes.
Great, great. So that is what the kind of awareness I am trying to create, and definitely hospitals now, mainstream doctors are prescribing these products. So I'm glad about it. I'm glad that people are taking and working a lot on this. So, sir, by the way, I had got the chance to meet Dr. Guleria in one of the holistic well-being program, what he was addressing. And I told him, sir, you are talking about holistic well-being, but, mainstream doctors are not into natural things. So he said, no, you will see them coming up. And this is what I can see now. People are very much open to these kind of things.
Yes.
Great, this is amazing. Dr. Mehra, would you like to say something about the topic on digital health in your closing remarks?
Yeah, see, just I have told you technology not an issue. Issue is the application of technology in a healthcare is challenging to implement it, and people the acceptance levels also. Earlier, what happens before COVID, nobody is interested for the virtual consultations. Right now, people are ready for the virtual consultation. This culture has been changed right now. Right now, the technology has come up. The IoT device has come up because internet strength is so high right now that you can put the instrument in your body and remotely it can be monitored. So this is the things it is right now. It is reality it has come up, and real data is fetching to the doctors directly. Even if some of the instruments are there, they can alert you that this things maybe happens. So next features in the mobile, it will come. All the features it will be the healthcare based, because the features in the mobile it is already been saturated. Either the speed will go up, or it is after now it is 5G, now 6G will come. That change you'll get it from the technology level, but application levels only healthcare is there. So many things it will be integrated with the healthcare, and that is the real time information you will get it from the mobiles. That's why we tell it is mHealth. mHealth has playing a major role in our life right now. When we are walking, you want to know what is our pulse rate, what is our BPs, everything it is already been in our wearable devices, which is are wearing it. So simultaneously, many things it has come up. Earlier, what I have told you, to recognize the face, recognize your eye, recognize your voice, then you can predict that you are under depression or not. That is the things it has come up right now, because AI is playing a major role for us. Recently, you might have seen in the newspaper, we have launched a new product that is early detection of breast cancer and ovarian cancer. And it is in the public domain. Anybody who will register it, they can use this application and they can predict that the person has, or the lady has, the breast cancer or ovarian cancer or not. So this is the things right now slowly coming up. Government is putting a lot of efforts to get new things to come in. Recently, what we have launched one more things. We can predict the newborn baby which moving from the delivery room to neonatal ward. That we can predict that this baby will get what kind of infection. So if you know early, then we can detect, we can take the major step on this, that this kind of infection, how will not be done, then you can do it. Simultaneously, mental health also. Whether the person is not going in 1 day or 2 days or a month to mental health, mental disorder. If we can predict early, then it will much better. Say he is going for this bipolar disorder or something, because many people, they are suffering bipolar disorder. So we can do some counseling. So you can take the step before coming something to us. So these are the technology you have to leverage it. Many people, they must be knowing it. ChatGTP. So ChatGTP now also playing a major role right now. But in healthcare, my request to the audience to that, don't depend totally to the ChatGTP. ChatGTP can be used as a screening. Yes. If something is coming, then you go to a doctor and take a consultation. This is my suggestion to. Thank you.
Absolutely. Thank you, sir. I think my apology for disconnection. Digitization and this failure of technology. But wonderful to have you all three. I think there are many ways. There can be many ways of reaching the same goal. Somebody can reach through essential oils. How you can create things better. And somebody can use lifestyle changes and reading the mind, reading the behavior, and then obviously the technology. What Dr. Sushil mentioned, the use of technology in extracting the data and in converting them to the information, which is a valuable information, giving us to act on. So I think that's the basic essence, whether it's a mental health or is a physical health or any type of health. But I think how we can really leverage on the appropriate technology. It's not everybody can't use AI here. We have to really make use of our own mind, basically what mental health we have, into ensuring that we use the right technology at the right time, at the right place, for the right perspective. I think those are the things which we have to take as an essence. But again, I would say we can reach to the same door by different channels. How you adopt, left to the choice to the people who want to adopt those choices and select those choices out of those available to them. So I think thank you all three of you for your wonderful three different perspectives. I think no webinar can have three distinct. And fourth one is me coming from an accreditation organization who develops standards for healthcare, starting from a clinic to hospital, telehealth, and everything, even mental health. Also, I think this is a very strange and combination of expertise coming from all three of you. Thanks, Alicia. Thanks, the organizer, for having us here for this very interesting webinar. I'm sure whosoever is available to attend, they will get some enrichment in their mental health, and they will think positively how they can change the life of individuals in a positive manner. Thank you very much, Alicia, and over back to you. Thank you.
Thank you.
Thank you. Thank you, everyone.
Thank you. Pleasure to be here and meet all of you.
Talking about me also coming from an era wherein the medical field is very important. I also think that it is very important to have a brief understanding what you are going through, and having these applications in the market is really helpful for us, and of course for a new generation also, with the digital watch, of course. So thank you everyone for joining. Now we are just going to our closing ceremony. I would like to say a big thanks to our organizing team, the GCIT events team, our sponsor, Away Health, and Ministry of Micro, Small and Medium Enterprise, our esteemed speakers and their organizations for their support, our attendees, which is more than 1100 plus in 34 countries we were live. So kudos to that. And our partners, Amand, A-Technos, PhD Chamber of Commerce and Industry, Away Health, Away Ventures, Vellum, Idea RX, Lowy Global, Go Games, Olive Life, Grid Council, and Share India. This has been a wonderful association working with you all. Thank you everyone for joining. We look forward to hosting you again in our next edition of WDWF. Thank you.
Thank you.
Thank
Bye-bye.
you. Thank you. Bye. Bye.